We'll be going live in next 2 minutes. Good afternoon, ma'am. Welcome. We'll be just going live in next 2 minutes, max to max. We'll be taking hardly a few seconds more to go live.
Fine, sir. Can I have the spotlight, please?
Yes, Dr. Omkar, we'll be shifting the spotlight to you within a second. So, we're just shifting the spotlight to you, Dr. Omkar. We'll take starting 10 seconds more to spotlight you.
No worries.
And you'll be on screen in the count of 10.
Yes. Suswagatam, namaste. Welcome for this first National Ayurved Cardiology Symposium powered by Medemy, certified by MUHS and partnered by knowledge partner Madhavbaug Institute of Preventive Cardiology. I am Dr. Omkar Chaudhary, host of this cardiology symposium, and I will guide all of you throughout these 4 energy-packed days. It gives me immense pleasure to lead this first National Ayurved Cardiology Symposium in front of whole Ayurved fraternity. More than 90 plus doctors of Madhavbaug will be presenting their case studies on various lifestyle disorders like CHF, IHD, DM.
Dr. Omkar, you'll have to unmute yourself. There was some background noise, so everybody is muted.
Okay, no worries. Fine. So I'll start from the beginning. So Swagatam, Namaste. Welcome for this first National Ayurved Cardiology Symposium powered by Medemy, certified by MUHS and partnered by knowledge partner Madhavbaug Institute of Preventive Cardiology. I am Dr. Omkar Chaudhary, host of this cardiology symposium, and I will guide all of you throughout these 4 energy-packed days. It gives me immense pleasure to lead this first National Ayurved Cardiology Symposium in front of whole Ayurved fraternity. More than 90 plus doctors of Madhavbaug will be presenting their case studies on various lifestyle disorders like CHF, IHD, DM, HTN, as well as their complications, which they have treated with scientific evidences with help of modern diagnostic tools and Ayurved medicines within a time limit of 10 minutes per presenter. As a ritual, before starting any Siddhantik Sambhashan, all Ayurveda graduates worship Lord Dhanvantari for his blessings. Hence, we too will be doing the same virtually. Please spotlight all three chief guests for Dhanvantari Pujan. Requesting all to stand up, please.
नमामि धन्वन्तरीरादिदेवं सुरासुरवन्दितपादपद्मं लोके जरारुक् भयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुदं शुकपरिविलसन् मौलिमं भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारु पीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवन् प्रौढदावाग्निलीलं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम्.
Om Dhanvantare Namaha. Yes, thank you all. Now moving ahead, I will like to give a brief introduction of all our chief guests for the first Ayurved Cardiology Symposium. Can we have the spotlight on respected Dr. Madhuri Kanetkar ma'am?
Yes, it will take us 3 to 4 seconds to get that spotlight on, ma'am. Ma'am, you'll be on screen in next 3 to 5 seconds. So welcome to the symposium, and Dr. Omkar will be changing the spotlight right now.
Yes, thank you. Friends, we are blessed to have our first chief guest, Dr. Madhuri Kanetkar ma'am, retired Lieutenant General, Indian Army, and Honorable Vice Chancellor of Maharashtra University of Health Sciences, MUHS, Nashik. She is the third woman in the Indian Armed Forces to be promoted to a 3-star rank. She has served as the Deputy Chief of Integrated Defense Staff Medical under the Chief of Defense Staff. Ma'am also serves on the Prime Minister's Science, Technology and Innovation Advisory. On 6th July 2021, she was appointed the Vice Chancellor of Maharashtra University of Health Sciences, Nashik, after retiring from the Army in October 2021. We are really honored by your presence, ma'am, and will like to hear from you.
Dr. Omkar, you'll have to give ma'am unmute permission.
Yes. Yes, ma'am.
Thank you so much for putting this, Dr. Omkar. Dr. Rohit Sane of the Madhavbaug Trust, Dr. Jagdish Hiremat, the renowned cardiologist and a colleague and a friend who's contributing a lot of to this great initiative. All the Madhavbaug trustees, faculty members and delegates and members who are participating so actively and in such large numbers in this symposium. I really wish you the very best. I went through the program and it's very, very heartening to see so much good work being done in the field of preventive cardiology. I think there is no better area to work on in a collaborative manner than in cardiology. We are seeing a huge spurt of cases of non-communicable diseases, which basically emanates from lifestyles, nutrition, environmental factors, stress, which is affecting finally the heart and in turn the blood vessels, the kidneys, and we are looking at India being the capital of diabetes, chronic kidney disease, and what have you. So in this backdrop, when the great work that is being done by the Madhavbaug Trust is very, very noteworthy and need of the times and society. So what we really need is, besides using these forum where, you are all sharing your good work being done through various studies, whether it's a single case report or it's some research that you have undertaken, I will request Dr. Jagdish Hiremat, the chair of this Chair of Excellence, which you have with the MUHS, to take this forward, because what we need is a standard document of a standard treatment guideline, which will be accepted at the national level, which will be put into the curriculum by the MUHS for an interdisciplinary approach, because there is no doubt that the world is now looking at solutions, and those solutions will come through our ancient wisdom, ancient literature, but we know we have to need to present it. So if you have to create this into an evidence-based standard treatment guideline, there will have to be a group of team or a team to putting their heads together of compiling everything that is there as evidence-based. And it would have to be through either, to get the highest level of we need to have a meta-analysis, or we need to, in addition to that, we could probably get into doing a systematic review of all the cases. The issue is that we may have small groups which have tried it out. But when you look at a therapeutic you're really telling when it comes to a medical intervention, you're talking of what dose, how often, what are the side effects, what would be. We need to put it into some kind of a structure which looks like a scientific document. So if you're talking of pranayama, if you're talking of meditation, if you're talking of an intervention like yoga and its impact on ejection fraction is a standard outcome. But have we quantified the same thing for the pranayama as to how it needs to be done, in how many times, how many minutes you need to do, how many hours in a week, and what is that outcome? That is what will come out as a standard treatment guideline and a strong recommendation based on level of evidence. If we can work together, put all this collective wisdom together and bring out such a document, I think that is the way forward, and what MUHS would look at to get from Madhavbaug Trust and take it forward at the national and international level. So with these few words, I wish all the participants and all those who are attending this meeting my best wishes, and I'm sure in the years to come, this is going to be a force which is going to help us decide. And these standard modules will then be used by the MUHS in our integrated courses, which we are in the process of designing. So thank you very much for inviting me to address you all, and Jai Hind.
Jai Hind, ma'am. Thanks a lot for your kind words. Now, I will like to introduce our second chief guest, Dr. Rohit Madhav Sanessa, founder and CEO of Madhavbaug Cardiac Care Clinics and Hospitals from January 2006 till now. Sir is an MBBS graduate and has also completed a fellowship in preventive cardiology from Apollo Hospitals. Sir has empowered many BAMS doctors to be entrepreneurs and treat patients successfully. Requesting Dr. Rohit Sanessa to please address all. So kindly unmute. Now, sir, please unmute.
Sir, you can check now. I think now you'll be able to unmute. One minute, sir. Sir, now you can try.
Yes, sir.
Okay. Thank you. Thank you, Dr. Aman.
So you might have to unmute yourself once more.
Okay.
Yes.
Is that right?
Perfect, sir.
Okay. Thank you. Respected dais and
Sir, you are not audible at the moment.
am I audible now?
Yes, sir. Perfectly audible.
Thank you. Thank you. Respected dais, Honorable Vice Chancellor, MUHS, Dr. Kanitkar Madam, and Dr. Jagdish Hiremat, Sir, the Chair Professor of Madhavbaug Institute of Preventive Cardiology, and my dear friends. Today, we are going to learn a lot from n number of presenters about the methodology of Ayurvedic clinical cardiology practice that we have been doing since last so many years. But before we begin with these presentations, I would like to highlight the need of evidence-based clinical cardiology practice. And why is that so important? Because as what Dr. Kanitkar Madam said just few minutes back, Ayurveda being the first line of therapy was the dream when we started with Madhavbaug in the year 2006. And since then, we have been working meticulously on those points where we had thought about that why Ayurveda has not been the first line of therapy. If at all we go back in the past, we would see that Ayurveda has an origin of 5,000 years ago as compared to modern medicine, which is about 200-300 years ago origin. Still, Ayurveda could not be the first line of therapy. The reasons, according to me, were very simple, and that was lack of evidence-based approach of Ayurveda. Like, for example, if at all we talk about modern medicine practice, if at all we are trying to deal with any kind of disorders, there are parameters with us which clearly give a roadmap to the patients as well as to the doctors while the treatment process is going on. Hence, a doctor as well as a patient can take informed decisions whether to change the therapy or whether to make the therapy aggressive or whether to lesser down the dose of the therapy. But the same thing is not as clearly available as allopathy in Ayurveda. Hence, as what Madam said, this is the only way that we can go ahead is having an evidence-based approach towards treating a cardiological patient, whether it's a risk factor of heart disease like diabetes and blood pressure, or whether it's heart disease itself. So I would like to just put out those major concerns, like the first concern that why a normal doctor not able to go for any kind of evidence-based practice is lack of parameters. When Ayurveda gives typical parameters in Ayurvedic science or else in ancient science, whatever it has been called as dosha, dhatu, mala, all these evidences are supposed to be clinically validated. Many a times, as what Madam said, like for example, if at all we are conducting pranayama or we are conducting any kind of yogic procedure or else panchakarma therapy, we are supposed to standardize the host protocol, and that is what we are been doing since last so many years. Right now, we have formulated or we have tried to standardize about more than 100 different protocols for various different disorders, and that is what is available for each and every doctor to practice in our clinical system that is called as clinic management system. So Madhavbaug has been trying out to generate these protocols, to standardize these protocols and validate these protocols through different research techniques that we were trying to do. Till now, we have been able to publish ourselves in Indian Association of Medicine, in which we could see that a few of the journals like Indian Heart Journal has published our trials, as well as a few of the journals in which Association of Physicians of India journal has also been publishing our research papers recently. So I am sure that Ayurveda, to be the first line of therapy, we are supposed to concentrate on evidence-based practice, and that is what is this conference for. Many a times an Ayurvedic doctor is not able to present himself scientifically because of lack of such a kind of platform. So today I would like to congratulate Dr. Kanitkar Madam to be with us for this special August gathering, wherein all our BMS doctors would feel blessed to have you, ma'am, because presenting any type of typical research paper, whether it's a case study or whether it's a clinical case series, presenting it in front of you is going to be a great honor for our doctors. As well, I would also like to thank Dr. Jagdish Hiremat to be with us since so many years and helping us to show our path to make Ayurveda the first line of therapy in chronic cardiovascular diseases as we go ahead. With these words, I would like to end my presentation right now and hand it over to Dr. Omkar. Thank you.
Thanks a lot, sir. Now I would like to introduce our third chief guest, Dr. Harish S. Hiremat sir, who has a huge experience in the field of cardiology. Sir has completed his education in BJ Medical College, Pune, Grant Medical College, Mumbai, DM Cardiology with gold medal in 1986, DNB Cardiology in 1987, Fellowship of Coronary Angioplasty in Melbourne, Australia, 1988, Fellowship of American College of Cardiology, FACC in 2015, practicing as interventional cardiologist in Pune since 1989, having performed many thousand angioplasties till now. Other areas of special interest are prevention of atherosclerosis, heart failure, including heart transplantation. Sir is the director of Cath Lab Ruby Hall Clinic, Pune, which is a 750-bedded super specialty hospital. Sir is the chief cardiologist in Heart Transplant Unit, Ruby Hall Clinic, Pune. Sir is the chair professor in Preventive Cardiology, Maharashtra University of Health Sciences, MUHS. Sir has done pioneering work in color Doppler, coronary angioplasty, and heart transplantation in Pune. He is the principal investigator of many prestigious international trials, RELY, TRUST, OASIS. Sir has authored a book on coronary angioplasty for cardiologists, has to his credit a book and many CDs of public education in cardiology. Teacher of DNB Cardiology and DM Cardiology for more than 10 years, exceptional skills in delivering talks on varied topics to varied audiences, reaching across the country. Total nearing 3,000 lectures so far. That's quite huge. Rotary member of 18 years. Trustee of an old age home activity.
Enough. Stop it, please. We
Yes.
can go ahead.
Right, sir. Can we have the spotlight on Dr. Jagdish, sir?
Thank you, Dr. Omkar, for that introduction. Dr. Kanetkar Madam, Dr. Rohit, and all the attendees of this conference. I can see Dr. Manisha also attending this, Dr. Potnis. Way back in 1992, a book was published from California about reversing heart disease. That was by Dr. D. Nornish. And what he did was took some 15 patients who were known to have blockages in the coronary arteries. He practically jailed them in a 5-star hotel, gave them fat-free vegetarian food, which was actually a sea change for any American who typically eats a lot of white meat. Then there were aerobic exercises, and there was a lot of spiritual input for this, and that was provided by Sachidananda Swami from India. And with this, they went on to do this process for 15 months. At the end of 15 months, it was shown that the blockages have reversed angiographically as well as through the thallium stress test. Now, just an experiment of 15 people can kind of tell the whole world that such a thing is possible, only because, as Dr. Kanetkar said and Dr. Rohit also reiterated, that it was documented very well. In your own clinics, I'm sure all of you have seen patients who were very sick some time ago, but with some treatment have become completely normal. I have seen several such patients with meticulous management and a lot of luck become completely normal. The blocks have reduced or their bypass surgeries are avoided, angioplasties are avoided. So all that we need to do is documentation. And this experiment of being Nornish, there were no medicines used. That time statins were not in existence at all. So all this was just lifestyle change. And what is that finally lifestyle? Fat-free vegetarian is very much an Indian way of looking at things. And leading a sattvic way of life is very much Indian. The pranayama and yogasana that were taught were all Indian. And based on this, we thought that we could provide something to the world which was even better than the Nornish. And such efforts have been going on. Unfortunately, they did not materialize into a clinical research paper. But time is now come. This is new India. Things are looking different now. And if we all put together our heads and our efforts, we can teach the whole world what Indian science can do or Indian methods do. We know that these methods are good. All that we have to do is scientifically record them. Even it could be an Ayurvedic drug or it could be a method which would be useful in any kind of prevention of coronary atherosclerosis. So that's why I am very keen, was in fact very keen to join as a chair professor. Things have moved into some direction. I see that Madhavbaug publishes a lot of papers which are of international repute. So these small papers which start with will gain momentum, and finally we'll come up with a method for the world. I'm quite sure about it, because these things don't happen overnight. It is a sustained effort that takes a long time to come up with a solution for something. But I'm glad that we are heading towards it. All of us have that inside us that we can provide something to the world. It could be very Indian. It's not being proud of India as such, but we know that these methods are used abroad and then they come up, give us solution based on these methods. That at least should not happen. So let's put our heads together, come up with some things which are useful to the society, our own and internationally, and of course come up with papers of international repute. I'm glad such a conglomeration has taken place. I'm glad that Madam has graced this occasion, and I'm looking forward to something very concrete from this conference, or at least a seed of something which to come in the future. Thank you.
Thank you so much, sir. Before we move on towards our presentations, I will like to mention the names of the chairpersons for this first National Ayurved Cardiology Symposium. Dr. Praveen Ghadigaonkar sir, Head of Medical Operations, Madhavbaug, and Dr. Rahul Mandole sir, Head of Research and Development Department of Madhavbaug, and myself, I'll be the moderator, Dr. Omkar Chaudhary. Now we will start with individual doctor presentations of Madhavbaug. Can we have the spotlight on the first doctor? I'll mention the names. First doctor to present is Dr. Monica Abhijit Patil.
So hi,
Good
Dr.
afternoon,
Monica, you're
everyone.
on screen.
Yes, before our doctor presents, I will like to thank all the chief guests. And if your schedule is too busy, you can leave the symposium. Thanks a lot for being part. Yes, Dr. Monica. So can we have the spotlight?
Yes, sir.
So good afternoon, Dr. Monica. Welcome. You're on screen. Over to you.
Good afternoon, sir. Sir, PPT.
Yes, you can share your screen. You can share your screen with everyone. So while so all the doctors who are presenting, great good afternoon to all of you. Please keep your presentations ready. And when your name is announced, please share the screen at your end. You will be able to share the screen. We have given you the permission to share the screen. Dr. Monica, please start your screen presentation.
Yes, and one more announcement to all the doctors. You all have pretty smiling faces, so keep on smiling and let all the doctors of Ayurveda know the power. Over to you, Dr. Monica.
Hello. Good afternoon, everyone.
Good afternoon.
I am Dr. Monica Abhijit Patil. I am working as a preventive cardiologist in Kalyan last 9 years. I am going to present case study of ejection fraction improved with help of Panchakarma and Ayurvedic medicines. My patient is age 71 years male, staying in Kalyan West. Known case of DM, CHF, CKD, hypothyroidism. DM, diabetes and hypothyroidism since last 25 years. CHF and CKD since 2019.
Doctor, can you please on the presentation mode? Just click on the enable editing option and then you can please start the slideshow.
Patient visited. Am I audible?
Yes, ma'am. But please start the slideshow. There's a small icon at the bottom right. If you can just click it.
Okay.
At the bottom, ma'am, at the bottom.
Okay, I'll adjust it from my end.
Yes, sir.
Yes, doctor, please go ahead.
Patient visited our clinic on 20th November 2020. Complaints with dyspnea of exertion, constipation, pedal edema. Patient was having symptoms of dyspnea of exertion since last 1 year. His physician advised angiography, but he was so tired and depressed. He didn't want to undergo any surgery and he wanted to take Ayurvedic medicine. Even he was diagnosed with cataract, but he was unable to undergo surgery because of uncontrolled surgery level, sugar levels. On that day, vitals are heart rate 59 per minute, blood pressure 127/77 mm of Hg, SpO2 96, BMI 28.37. When he visited to clinic, he was consuming 14 allopathic medicines, anti-anginal, anti-hyperlipidemia, anti-platelets, anti-diabetic, anti-thyroid drugs, and beta blockers. 2D echo shows ejection fraction 20 to 25%, coronary artery disease, dilated LV, prominent LV, global LV hypokinesia, severe LV systolic dysfunction, mitral regurgitation, mild mitral tricuspid regurgitation, mild pulmonary pressure, calcified aortic wall, mitral annual calcification, and serum creatine was 2.90 ml per dm. हमने क्लिनिक में पेशेंट को लिपिड प्रोफाइल, HbA1c और 6 मिनट वॉक टेस्ट एडवाइस किया था. तब 6 मिनट वॉक टेस्ट करते समय पेशेंट सिर्फ 380 मीटर ही चल पाया था. तब VO2 max 15.38 और HbA1c 8.5% ही था. डायग्नोसिस: chronic heart failure with uncontrolled diabetes, chronic kidney disease. डायग्नोस करने के बाद पेशेंट को अर्जुन, पुनुरा, हरिद्रा, अमल किए स्टार्ट किया और उसके साथ डाइट 800 किलो कैलोरीज, लो GI लेस देन 30, हाई प्रोटीन, लो कार्बोहाइड्रेट्स, हाई फाइबर्स और इंटरमीडिएट मूव डाइट स्टार्ट किया. पंचकर्म में स्नेहन, स्वेदन, हृदयधारा, बस्ती और विरेचन स्टार्ट किया. ट्रीटमेंट शुरू करने से पहले हम हर पेशेंट को एवरी 3 डेज में बुलाते थे और थेरेपी के लिए भेजने से पहले ECG, 6 मिनट वॉक टेस्ट और ECG निकालते थे. उसके बाद प्रोसीजर स्टार्ट करते थे. प्रोसीजर में सेंट्रीपिटल ओलिएशन में पूरे बॉडी का मसाज हार्ट की तरफ किया जाता था. उसके बाद दशमूल काढ़े से स्टीम दी जाती थी और हृदय धारा की जाती थी. उसके बाद पर रेक्टल ड्रग एडमिनिस्ट्रेशन. फॉलोअप में पेशेंट का डेली वॉक करता है क्या और उनको प्राणायाम, स्पायरोमीटर और विरेचन विथ अमरी ऑयल वंस इन अ वीक. बीच में मूंग डाइट 14 डेज के लिए स्टार्ट किया था. रिजल्ट शोज आफ्टर 21 थेरेपीज, ejection fraction 22 increase 45%, normal chamber dimensions, structurally normal cardiac walls, no PAH, PASP 20 mm of Hg. HbA1c 8.52 reduced 6.4, lipid profile is normal, serum creatine 1.4, TSS level is reduced. 6 minute walk test, patient was unable to for 6 minutes and the total distance was 380 meters and VO2 max was 15.38 ml per kg per minute. Now patient's test is done by modified Bruce protocol. He is unable to walk on treadmill for 15 minutes without any symptoms and VO2 max is 36.05 ml per kg per minute. Latest medication, patient के anti-anginal, anti-diabetic, anti-platelet, anti-lipidemia medicines are stopped and only Madhavbaug medicine, Alluri liquid, Glyinoma, Dipram काढ़ा, ARJ काढ़ा, Amari oil, Cat P, Punura और GHA चालू है. How we achieve results? Centripetal oleation improves the volume of blood returning to the heart, decrease the activity of nerve that puts strain on heart, reduce the increased peripheral resistance. Thermal vasodilatation induce sweating, thus excretion salt and water, and reducing the turbidity and viscosity of the blood. Dilates blood vessels, reducing the load on heart. Thoracic drip reduce breathlessness on exertion by improving blood supply to the chest muscle. per rectal drug administration improves the ability of the heart muscle to contract, reduce oxygenated stress and fluid overloaded. Conclusion, not only the ejection fraction is improved, but also kidney function is improved. My patient happy face. Thank you.
That was a super presentation, Dr. Monica. Yes, if anyone has any questions, kindly mention in the chat box. Any questions? You can please put in the chat box so that Dr. Monica can answer the same. Yes, Dr. Monica, you can see the chat box now. There are some 2-3 questions. I'll be asking you the question. You can answer it further. Yes. What was the treatment duration in this case? Can we have the spotlight on Dr. Monica?
Yes, sir.
Yes, thank you. Yes, doctor. There's a question. What was the treatment duration in this case?
Treatment duration था 3 months only.
Okay.
Every 3 days में हम थेरेपी के लिए बुलाते थे पेशेंट को.
Okay. One of the doctors has asked what was the diagnosis according to Ayurveda. Okay, we'll move on. To reduce the creatinine levels, what changes were made in the treatment?
ट्रीटमेंट के वक्त हमने मेडिसिन भी स्टार्ट किए थे, उसमें पुनोरा भी स्टार्ट किया था. तो पुनोरा की जो प्रॉपर्टी है, मतलब डायूरेटिक के वजह से जो ब्लड में यूरिया है वो डिक्रीज होने के कारण भी सीरम क्रिएटिन लेवल है वो कम हो गई.
Okay. What was the dose of Amari oil? Let me tell, Amari oil is basically Erandatel, Triphala and Shunti. So what was the dose and duration given in this case?
पेशेंट को स्टार्टिंग में कॉन्स्टिपेशन की कंप्लेंट थी, तो हमने डेली 10 ml भी स्टार्ट किया था और वीकली वंस 30 ml ऐसा डोज दिया था विरेचन के लिए. और फर्स्ट बार 30 ml दिया था और 60 डेज में हमने वो 60 ml पे शिफ्ट किया था.
Okay. Just a minute. There's one more question. Okay. Dr. Yogita has asked a question. Is this the standard protocol for all the patients? What about dosha dushya vichar? Dr. Monica?
I think her internet has got frozen.
Yes.
We are not getting stream from her end.
I think, Dr. Omkar, we should move to the next presenter.
Can I make a comment and then I can leave?
Yes, yes.
Yes, sir. Yes, sir.
I think it was a brilliant case. The result, of course, is very, very dramatic. I don't think many have seen such a result in our patient. I think there was a cardio-renal element in the sense the kidneys themselves were not diseased, but lot of kidney creatinine high was because of the low output from the heart. And all these methods probably brought in a good change in the hemodynamics, and that led to real kidney improvement as such. So the cardio-renal part was taken care of by improvement in the heart failure. One of the things that all of you can follow in management of heart failure is the daily weight of the patient. If it can be done so easily at home, if weight increases by 2 kilos in 2 days, that means fluid buildup has started in the system. So a patient can also easily diagnose it at home. So that also can be incorporated into the management. But all in all, wonderful case. Believe me, even 10 such cases can make an internationally perfect paper. I think look for it, document it well, and we would be really interested in presenting it on an international forum. Thank you. I take your leave. Thank you very much.
Thank you, sir, for your valuable time and guidance. So we'll move on to the next presenter. The next presenter is Dr. Vidya Buddhe, and her topic of presentation is role of pranayama in unstable angina. Can we have the spotlight on Dr. Vidya?
Dr. Omkar, before moving to the next presenter, I would like to give some instruction to the presenter. You have to stick to your time. You have to finish your presentation within 8 minutes. Last 2 minutes will be for the question answer session. Chairperson will comment on each and every presentation, and after that we can open the platform for other doctors to discuss. And we can adjust only 2 questions, not more than 2 questions, because we have to complete almost 22 presentations in this by today. So there is so many cases are coming up. So I know there are so many questions we are going to discuss today. So I request all the presenters and the delegates to stick to the time.
Right, sir. Yes. So can we have the spotlight on Dr. Vidya? Yes, ma'am. Welcome. Okay, you're not audible. Can you speak now? Please unmute.
Am I audible?
Perfectly, ma'am. Yes. You can share your screen now.
Good afternoon, all.
Yes. Good afternoon. You can share your screen, ma'am.
Yes, sir.
And keep it on presentation mode, slideshow mode. So I hope the instructions are very clear to all. You have 8 minutes of time for your presentations, and 2 minutes will be given for the question answer session. Not more than 2 questions will be addressed, and the questions will be asked, or the comments will be given by the chairpersons, Dr. Rahul Mandole, sir, Head of Research and Development Department of Madhavbaug, and Dr. Praveen Gadigaonkar, sir, Head of Medical Operations, Madhavbaug. Yes, Dr. Vidya.
Sir, मैं presentation share नहीं कर पा रही हूँ.
Just a minute. There seems to be some technical issue. No worries. We have solutions for all.
Dr. Vidya, what error are you getting? Can you please share with me? I'll try to help you out. Okay, just give me a minute. You have sent your presentation to me? That's the same presentation, right?
Yes, sir.
Okay.
Yes,
just
same presentation.
Give me 5 seconds. I will try to share the presentation at my end. So don't worry, we'll run the presentation from our end, and you can, go ahead through that. But it will take me a couple of seconds. In the meanwhile, my voice is echoing. Okay, so I hope it will take me a few seconds because all the presentations were to be shared from the doctor's end. So I am just changing the whole thing. Please give me a few seconds.
Yes, meanwhile, Dr. Rahul, if you want to speak, you can, sir.
Okay, Dr. Vidya, I hope the screen is now visible. Yes,
visible, sir. It's visible. Yes. Thank you, sir.
Yes, sir. It's visible. Yeah.
Yes, Dr. Vidya, you have 8 minutes of time.
Yes, sir. Good afternoon, everyone. My case is role of pranayama on unstable angina. Myself, Dr. Vidya Buddhe, clinicate from Madhavbaug, Ghatkopris Cardiac Care Clinic. Next slide.
Yes, that is the challenge thoda sa. You'll have to bear with me. I am a little slow. मैं कोशिश करूंगा जल्दी से जल्दी आपके लिए करने के लिए. Yes.
Yes, my topic is pranayama on unstable angina. The case was a 74-year-old male patient, known case of diabetes, blood pressure. Since 1997, he had chest pain on 2010-2016 with diagnosed by acute coronary heart syndrome with unstable angina and treated with medical management with the help of the blood thinner, statins, gluconom G1, antihypertensive, and anti-diabetic. Episode of same with in 2020 also. So he was advised for 2D echo and chest X-ray. Chest X-ray was absolutely normal, but 2D echo showing the evidence of LVDD and evidence of dilated aortic root. So he was that time also not did any CAG or anything. He was advised for that, but he was not doing, and he was just taking medicines. Patient avoid CAG and continue for medical management for 1 month, and episode of chest heaviness on exertion not reduced. Hospitalized for the same complaint on 11th Feb 2022, and CAG was done. So CAG was showing the severe TVD. Next. So that time he was advised for early CABG. Patient came to me on 12th of Feb 2022. Sir, next slide. 12th of Feb 2022, he came to me, and sir, before this. Sir, before this slide.
The previous one, sir.
Yes, doctor. Just give me a few seconds. I have to do a little adjustment because this was a little unplanned at my end. I'm sorry. It is taking a little time from my end. Just give me a few seconds. Apologies from my end. All right. Yeah.
Yes.
Is that okay?
Yes. सो पेशेंट 12 फेब 2021 को मेरे पास आया था. उसी समय में उसको चेस्ट हेवीनेस था, घबराहट थी, वीकनेस था, इकोस्प्रिन, रोजडे, कार्डिवॉन, एम्बिटा एक्सआर, देन नाइट्रोग्लिसरीन और एंटी डायबिटिक मेडिसिन वो ले रहा था. उसके वाइटल्स आर नॉर्मल थे, ब्लड प्रेशर 150/70 था, उसका वेट भी ऑलमोस्ट नॉर्मल था और BMI भी नॉर्मल था. HbA1c that time was 6.3 and lipid profile जो था वो भी नॉर्मल रेंज पे था. बट पेशेंट हैज द सेम कंप्लेंट्स ऑफ चेस्ट हेवीनेस ऑन एक्सर्शन. सो हमने उनको एडवाइस दिया था कि CT एंजियोग्राफी कर लीजिए और 6 मिनट वॉक टेस्ट भी लिया था. सर नेक्स्ट स्लाइड. सो माधवबाग में उन्होंने ट्रीटमेंट स्टार्ट की. माधवबाग में ट्रीटमेंट स्टार्ट करने के वक्त हमारा डायग्नोसिस था पेशेंट कोरोनरी artery disease with heart failure, reserve ejection fraction, with diabetes type 2. Treatment start with low diet, low carbohydrate diet with fiber rich and high protein diet, anti-inflammatory and antioxidant diet with some panchakarma of centripetal oleation, thermovasodilation, Hruday Dhara, Shirodhara, and per rectal drug administration. Some oral medication also started, Arjuna, then Withania somnifera, Garcinia indica, and other medicines also. So exercise I was prescribed for him to do daily warm-up with joint mobility, resistance training, stretching, and pranayama. Next slide. After 2 months, patients are absolutely normal. His weight was reduced from 62 to 57 kg, and BMI was also absolutely normal. Blood pressure was normal. HbA1c reduced from 6.3 to 5.6. His all medicines was tapered. Only the blood thinner and antiplatelet medicines was going on. So that time, his 2D echo is also not completely normal, come to the normal. But the sudden onset of chest pain was happen after 2 months. So next slide. Yeah, his CTA report also showing that his reduction of plaque, total atheroma volume from 1185 to 843. So reduction almost 350 of plaque, total atheroma volume, and after 2 months. Sir, next. Yeah. After treatment of 2 months, he has a sudden onset of chest pain. I was done his tropionine, it was negative, and so because of that chest pain, he was unable to walk. ECG was not showing any fresh changes. So I was advised him to do pranayama 40 to 45 minutes on daily basis. He has started deep breathing exercises, and after for regular follow-up, of 30 days, his pranayama working very nicely, and his chest pain was reduced and shoulder pain also completely reduced. Next pain, and he was walking at least 45 minutes every day. So unstable angina is a insufficient blood flow and oxygen to the heart muscle, that is myocardium. It is the imbalance between the oxygen supply and demand of oxygen and supply of oxygen. So because of that, the myocardial ischemia was happen, and because of that, the angina is produced. Next. So causes of unstable angina: increased heart rate, increased blood pressure, vasospasm, and sympathetic overtone. So according to causes, I have started his pranayama. Sir, next. Yeah. So my thinking was, so if we do pranayama, then the stretch receptors of the lungs during deep breathing was stretched, and that stretch receptors is supplied by vagus nerve, and this stretch receptors supplied by vagus nerve is activated during breathing exercises, and due to deep breathing exercises, the vagus nerve activates very nicely and reduces the heart rate and reduces his blood pressure also, and because of that, vasodilation was happen, and his chest pain was reduced. Next. So this is the my observations. This pranayama might be a probable mechanism of action of pranayama on unstable angina. Thank you.
Thank you, Dr. Vidya. Fantastic presentation. So we'll move on to the questions. There are a couple of questions in the chat box. When you say pranayama, what exactly was being prescribed? Can you enlighten?
Yeah, pranayama, actually there are so many types of pranayama, just like Adulom Vilom, deep breathing exercises, Brahmari, Omkar. But strictly I was advised for deep breathing exercises.
Okay, so deep breathing
deep breathing exercises is specifically I told him, and deep breathing exercises is stretching of the lungs, alveoli, and that receptors are stretches, and that because of that the vasodilation was happen, and because of vasodilation his heart rate and blood pressure was reduced down, and because of that only the things the chest pain reduces.
Thank you. How many times a day?
Just for one time only, for not for 30 minutes. It's a 40 to 45 minutes at least.
Okay. Dr. Vaibhavi has asked, have you noted any difference in breath holding capacity of the patient?
Yes. His breath holding capacity was increased. I was checked in a incentive spirometer.
Okay, so that was being monitored on an incentive spirometer.
Yeah. First time his incentive capacity was 1000 to 2000 ml, but after that it was increased from 2000 ml to 5000 ml.
Superb results. Superb. So yes, Dr. Rahul and Dr. Praveen, if any one of you want to comment.
Yes, very beautiful case presentation, Dr. Vidya. Congratulations to you, because treating unstable angina in a clinical condition, in a clinic setup only, is very courageous job you have already done. And I just have a question that the intervention that you have done in this patient. The first, you suggested patient for some medication, Ayurveda medication, along with the diet.
Yes, sir.
And along with that, you added this pranayama add-on to it, right?
Yes, sir.
So if I'm considering a Rudrog as in nutshell, so even the diet modification and the medicine that you have used can correct the rasa dhatu and may help your patient to come out from a Rudrog as well. So even this intervention has a good role. So how we can differentiate whether that improvement is only because of a pranayama or only because of that diet and the panchakarma modification?
Sir, actually, yes, sir. Actually, when I was started his treatment, that time he was unable to walk for 1 minute to or 2 minutes. Then after that, he was improving very nicely on 6-minute walk test. Okay, so I was thought कि मुझे ऐसा लगा कि okay ठीक है, patient improve हो रहा है अभी. But suddenly the onset of जो chest pain हुआ after treatment, so उसकी वजह से मुझे एक बार सोचना पड़ा कि सिर्फ डाइट या सिर्फ पंचकर्म से ही हो रहा है, या फिर और मैंने जो एक्सरसाइज एडवाइस की है उसी से उसमें कुछ चीजें कम तो नहीं हो रही है. तो मैंने जब उनके केस स्टडी को फिर से एक बार देखा तो उस समय में मुझे पता चला कि नहीं, उनका जो ब्रीदिंग कैपेसिटी था वो कम था. वो चल तो रहे थे लेकिन 6-minute वॉक टेस्ट पे चल रहे थे. एज हिज एज वाज 73+, सो आई कैन नॉट टेक हिम ऑन ट्रेडमिल. सो मुझे ये पता नहीं चल रहा था कि वो कितना चल पा रहे हैं और कितना नहीं चल पा रहे हैं. ओके, सो 6-minute वॉक टेस्ट वो यहाँ पे कंप्लीट कर लेते, लेकिन वो घर पे जब चलते थे तब वो रुकते थे, नहीं रुकते थे. ये सारी चीजें मुझे हर्डल करने लगी थी. इसलिए मैंने उनको कहा कि आप प्राणायाम कितना करते हो, इसलिए मैं उनका हर दिन प्राणायाम क्लिनिक बेसिस पे लेना शुरू की थी. सो फॉर 1 month he came to me for 1 month in clinic, and I was did his exercises also, and pranayama I was just taking him for pranayama for 45 minutes only.
Dr. Vidya, have you continued with the vasodilator allopathy medicines while treating the patient with the pranayama?
No, see, sir, actually, already I was tapered his nitroglycerin and other medicines. I just he was on only just on blood thinner and antiplatelet medicines.
Then that is superb job done. Congratulations. And over to Dr. Praveen, sir, if you have any
question. No question from my side.
Okay, great. Thank you. Over to Dr. Omkar, sir. I think we should continue with move to the next presenter.
Yes, sir. We have the third presenter, Dr. Suvarna Prashant Mhatre, and her topic of presentation is role of Brahmari Pranayam in HTN management along with HTN therapy. Can we have the spotlight on Dr. Suvarna?
Yes, am I audible?
Yes, doctor.
Hello.
Yes.
Am I audible, sir?
Yes, yes, ma'am.
Okay.
So can we have the presentation mode on?
Yes. So good afternoon, everyone. Myself, Dr. Suvarna Prashant Mhatre. I am a preventive cardiologist working in Madhavbaug Cardiac Care Clinic since 14 years. Today, I'm here to present my topic, role of Brahmari Pranayam in HTN management, along with the HTN therapy of Madhavbaug. So as we all know that hypertension is one of the major risk factors for cardiac diseases. And we know that it is classified into essential and secondary hypertension. Most of the times, essential hypertension cause is unknown. But secondary hypertension has some existing pathology as its causative factor, like chronic kidney disease, artery disease, cardiac disease, or endocrine disease. And the predisposing factors are various, like stress, food habits, and unhealthy habits. So during my consultation with the patients, I have seen that most of my hypertension patients are suffering from stress. So the main objective behind presenting or studying these cases was to identify the effect of non-pharmacological therapy of pranayam, especially of Brahmari pranayam, in hypertensive patients. Those are dealing with stress in addition to the conventional Madhavbaug hypertension therapy. Now, we know the role of sympathetic nervous system and autonomic nervous system in maintaining our cardiovascular homeostasis. Now, the excess activity of sympathetic nervous system causes increase in the blood pressure, and the activation of autonomic nervous system causes a decrease in the blood pressure. When we are exposed to stress, the sympathetic activity increases, and this repeated stressful activities in turn causes vasoconstriction, which may result in vascular hypertrophy, atherosclerosis, leading to a progressive increase in the peripheral resistance and thus increase in the blood pressure. Also, continuous exposure to stress causes endothelial dysfunction, which is the main cause of blockages. So the endothelium, it produces these substances like nitric oxide, which is mainly responsible for the relaxation of vascular smooth muscles. In endothelium dysfunction, there is an imbalance in the production of nitric oxide, which leads to the contraction of vascular smooth muscle, restricting the blood flow and so directly increasing the blood pressure. So any mechanism that can correct these damages to the endothelium due to stress and the nitric oxide imbalance will help the blood vessels to relax and in turn reduce the blood pressure. So I started my first treatment or my first study in this patient who was a 64 years old patient. He was a retired patient. He was a known case of hypertension since 20 years, also a known case of coronary artery disease and diabetes. He had done his angioplasty in 2019 along with the left partial nephrotomy for left renal mass. He had come to us with the complaints of weakness in the evening, heaviness in head and giddiness. His first day BP was 141/96 mm of Hg. We started his treatment on 3rd of October 2020. The treatment given was hypertension management and IRP-based treatment. On 22nd of December, his BP readings were not showing much improvement. There was quite fluctuations in his BP. Sometimes his blood pressure measurements were normal, but sometimes it used to go very high. So we counseled him in detail. And in the month of August, we decided to start Brahmari treatment along with the conventional therapy. So after the treatment, after starting Brahmari for 4 months of continuously, on 24th of December 2021, we found his blood pressure ranges were coming to normal, and it was 120/70, and till today they are normal. So that was my first patient in whom I introduced Brahmari. So this is the second patient. She was a 55 years female, known case of hypertension since 2000. She was taking 3 medicines for hypertension. She had hypothyroidism since 3 years, history of endometriosis, renal stones, recent menopause, osteoarthritis, low potassium levels. She had come with the complaints of uncontrolled BP, especially disturbed sleep and joint pain. Her first day BP was 156/83 mm of Hg. We started her on treatment on 5th of January 2022 with HTN management and EPT. On 21st of March, her BP was 150/90. Her BP levels were also fluctuating, and on counseling, we found that one of the main causative factor was stress. So again, with the previous experience, we started her on Brahmari from 22nd March 2022. And within 1 month, we saw that her blood pressure was coming down to normal, and it was 117/82. Third patient was a 41 years male patient. He was working in the IT sector. He was known case of diabetes since 5 years, hypertension 7 years, hypothyroidism 25 years, asthma 25 years. He had a history of slip disc, knee pain, calf muscle, but his main complaint was disturbed sleep and stress. His main concern with which he approached us was his higher diastolic blood pressure. His first day blood pressure was 140/90 mm of Hg. We started his treatment on 13 February 2022 with HTN DM3. On 11th of March, his systolic BP showed a good improvement to 128, but his diastolic blood pressure was 95. So again, based on the previous experience, we started him on Brahmari on 27th March 2022. And within the 15 days of period, we saw an improvement in his diastolic blood pressure as well. It was 111/81 mm of Hg. Before coming to us, he was not taking any type of allopathy medicines or any type of Ayurvedic medicines for his diabetes or blood pressure. So these were my 3 patients. When I studied these three patients in details, I found the major common causative factors were sleep disturbance, emotional disturbance, excessive thought but lack of expressions, and stress. So we diagnosed him as a secondary stress-induced hypertension in them. Now, the treatment that was given commonly in these patients were their duration was for 90 days, except the first patient in which we introduced Brahmari, it was later 90 days. Oral medications that were given was Artil, which has Sunti, Brahmi, Serina, Brahmi, Shankupushpi, Jatamasi, Kurasni, Ajuvan. Endogard has Amalki, Haridra, and Guruchi. Now, these herbs help in calming down the central nervous system, as well as it helps to rectify or heal the endothelium of the blood vessels. We also worked on his Ras Dhatu. On the Ras Dhatu of this patient, as Rahul sir mentioned, we gave him a specific diet therapy of 1000 calories, low sodium, low carbohydrate, high fiber, good quality fats, potassium-rich diet, and magnesium-rich diet, along with the Panchakarma hypertension therapy, that is Snehan, Swedan, and Shirodhara, which help to decrease the sympathetic overactivity, cause thermal vasodilatation, and reduce the stress and anxiety. Now, in addition to this treatment, we added Brahmari in a subjected dose, like 11 times of Brahmari, twice in a day, once before sleeping, and then the second time after waking up on empty stomach. So this was the given dose of Brahmari to these three patients. Now, if we see the results of this case study, we can see that the BP was substantially reduced from 141 to 96, 141.96 to 120.70 in the first case. There were no any symptoms, and the medicines are reduced by more than 50%.
Last 2 minutes.
In the second case also, BP was 156.83, 117 by 82 latest with reduction in medicines. Third case, blood pressure was 140/90, and latest it is 111/81 with no any complaints. So Brahmari Pranayam is mentioned in the Hatha Yoga text Geran Sanhita as well as in Hatha Yoga Pradipika. These are attached references of the text. So here, how do we respond to stress? Our brain releases adrenaline and cortisol. They signal brain to drive blood from your prefrontal cortex to the amygdala, which is the fear center. It increases your heart rate and blood pressure. The digestion level shuts down and the liver starts releasing glucose. So if we perceive stress as a danger, it damages our body. But if we perceive it as an opportunity for growth, it can create more growth. So how can we do that? So we require to counsel our patients for changing their approach to react to stress. And how can we do that? By responding skillfully to the stress. And how can we do that? By creating inner stillness, the state we create when we are more resilient. And how can we become more resilient? By practicing pranayama, that is Brahmari. So Brahmari, it calms down our central nervous system. It is a phonatory respiratory exercise. It significantly accelerates the release of nitric oxide, which in turn accelerates the microcirculation of the blood by dilatation and releasing the spasm of peripheral blood pressure. Hence, controls the blood pressure. So we can understand the importance of nitric oxide. These are some research papers that I studied before starting the treatment. So my conclusion is the findings of this study concludes that Brahmari Pranayam practice improves the stress management, stress-induced blood pressure substantially by increasing the parasympathetic effect in patients, increasing the relaxed state of mind, and also by enhances the endothelium health by increasing the nitric oxide secretion. So thank you. I request all my doctors to practice pranayam, Brahmari to reduce down their stress before the presentation. Thank you.
Awesome presentation, Dr. Suvarna. Rahul sir.
Absolutely, Dr. Mukhar. A very nice presentation and very noble thought you have shared, because hypertension is a growing risk factor for heart disease. Almost 11% of Indian adults are suffering from hypertension, and such non-pharmacological intervention, because ACCORD trial has already taught us the use of excessive of antihypertensive drugs can be very fatal. And in such situation, if you are giving a solution like a Brahmari non-pharmacological intervention, can be life game-changing and life-changing for all everyone. But before going ahead, Dr. Suvarna ma'am, very nice presentation. What I found is the first point, that the blood pressure that you have shown of all the three patients, the first patient was systolic was 142 and dropped to 120 within 48 hours. In the second patient, systolic was 150, dropped to 120 after 3 months. and the third patient is showing almost normal blood pressure and maintain his normal blood pressure with even after 2 months. So there are differences in the duration of their follow to blood pressure. And again, blood pressure is a very dynamic thing. It's a very dynamic thing, and I would like to understand how you have measured whether it was a home-based blood pressure or a clinic-based blood pressure or an ambulatory blood pressure.
Yes, sir. As you said that there was difference in the duration of improvement. So actually, in the first case, there was a resistance of the patient to accept that Brahmari can reduce down the blood pressure. So when it was advised, the patient didn't do it on the advised dosage. So after a few days, when we found that the results were not coming as per the expectation, we monitored his dosage. Like we used to tell him that when you complete the dose, just give me a message on a WhatsApp and take your blood pressure. So the blood pressure monitoring was done on the homely basis as well as when the patient used to visit to our clinic. So it was done on the both sides, because we asked the patients to measure the blood pressure at home as well.
But if you want to take Ayurveda to the first line treatment option, what I will suggest, if you are practicing a Brahmari in your hypertensive patient, record their ambulatory BP. And that will be the much better and accurate method, because even clinic blood pressure may not be that accurate. But considering it as a case series, I would like to congratulate you and your team for doing the fantastic job and helping the hypertensive patient without adding any allopathy medication into it. So over to Dr.
Thank you.
Yes, ma'am. There is a question whether any difference in the ambulatory blood pressure monitoring were observed by you, ABPM.
In 3 out of 2 patients, there was difference in the ambulatory blood pressure monitor. The third patient, second report has to be yet to be done. So I didn't present ambulatory blood pressure monitor report in this case studies. But in the coming series, I would surely add it to the case studies. Yeah.
Fine. Praveen sir, any comments? Dr. Praveen sir, any comments?
Unmute me.
Yes.
Yes, Dr. Suvarna, very nice presentation. Can you put light on the heart rate of the patients you observe during the line of treatment?
Yes, sir.
Any change in their heart rates?
So actually, the change was, it was a decrease. There was a decrease in the heart rate of the patients. But in the first case, we found that the patient was on a beta blocker. So he already had a lesser heart rate. But that was increased to, not to abnormal, but it was increased to 84, from 65 to 84, if we say. Otherwise, in other patients, we are seeing a decrease in heart rate.
Okay, thank you.
Yeah, thank you, sir.
Okay. There is one more question which I will like to take. What would you comment on the need for diuretic in HTN?
Of course, diuretic is a part. It is a part of therapy in HTN. But in these patients, we did not find any kind of swelling in the patient, so we had not used any kind of diuretics in these cases.
Cause of hypertension is different in this patient.
Yeah,
it is a stress-induced hypertension.
It is a stress. It was a stress-induced hypertension.
Great. Super. So we should move to the next presenter, Doctor.
Yes, thanks a lot, Dr. Suvarna.
Super, Dr. Suvarna.
And the next presenter is Dr. Ashish Khillare, and his topic of presentation is quality and quantity of life improved after heart failure reversal therapy, SHS, Sampurna Hruday Shuddhikaran. Can we spotlight Dr. Ashish? Yes, Dr. Ashish, good afternoon, welcome.
Dr. Ashish, you will have to unmute him. You're the co-host, you'll have to unmute him.
Just a minute. Okay. Yes, Dr. Ashish.
Yes, sir. Hello. Good afternoon, respected guests and delegates. Sir, I have a technical issue. So PPT should be shared on your side. Omkar, sir.
Just a moment. Have you shared the presentation?
It is already mailed to the concerned email ID.
Okay. Aman sir, if you can just help me out, if you can make the course to Dr. Rahul, sir can share his screen.
Dr. Rahul can share. Anybody can share the screen. The screen sharing is open to all.
Yes, because all the presentations are with Dr. Rahul, so it will be easier for him.
Yes, yes. All the screen sharings are open to all. Anybody can share the screen.
Meanwhile, Dr. Ashish, please understand we have 8 minutes of time and
Yes,
2 minutes for any further questions or comments. So best of luck for your presentation.
Thank you, sir.
And once Rahul sir shares his screen, then you can start with your presentation.
Yes, sir.
You can tell about your case briefly by the time sir shares his screen. Yes, we have the screen shared now.
Yes, sir.
Can we have the presentation mode, sir? Yes, thanks a lot. Yes, Dr. Ashish.
Yes, I'm Dr. Ashish Kilare, practicing at Madhavbaug Clinic, Mumbai, for the last more than 10 years. Today, I'm going to share an observational study about my patient, in which quality of life is improved after the treatment, that is heart failure reversal therapy program, which we do at our Madhavbaug centers. A patient, 64 years old male, visited to my clinic in June 2021. He is a known case of hypertension, CHF, and CAD post PTA status since 2016 on regular medicines. He had a history of hospitalization due to anterior wall MI, followed by CAG, followed by PTCA to the single vessel disease. He was presented with the bipedal edema with nocturnal micturition, along with that mild dyspnea to the clinic, and which is on regular medications. So medications are rosuvastatin 20 mg, clopidogrel, aspirin, furosemide, sacubitril, and valsartan. These medications were continued for the last 5 years. Next slide, please. Next slide, please. After examination, I had advised him to go for the 2D echo test, because with the 2D echo test and a few blood investigations, after doing the 2D echo test, what we have found, his LVF was severely depressed. It is around 25%. Along with that, their dilated LA and LV, and entire IVS, inferior wall, and apical cap were akinetic. Along with that, lipid profile, hemoglobins were absolutely normal. I just forgot to mention their NT-proBNP status also here, which is also was fine. But the only thing is that I have observed his HbA1c raised to 7.1%. Next slide, please. Then we have done a 6-minute walk test at our clinic. Then he could able to manage only walk for 5 minutes, and the termination criteria was pain at the both lower limbs with heaviness. Due to this, and the ECG shows, pre and post ECG both shows the ventricular conduction defects. Next slide, please. With the help of clinical examinations and investigation, I had diagnosed him as he is a known case of chronic heart failure with post PTCA status with hypertension and diabetes. Next slide, please. So the treatment and the management of the disease were started with the Ayurvedic herbal medications, Arjuna and Punarnava typically used. Along with that, the diet, that is a 800 kilocalorie diet with low GI, and a few Panchakarma procedures, that is a copyrighted treatment, that is heart failure reversal treatment program. Next slide, please. Duration of the treatment is total of 6 months. For the first month, we have delivered 7 therapies of HFRT in the span of 1 month, twice in a week manner. After that, one therapy per month for the next 5 months. Plus, low GI diet was started from the day 1 to day 60. Later on, patient was on normal low GI diet charts. And third one is Ayurvedic medications were started from the day 1 to day 180 with a tapering manner. Next slide, please. After the treatment course, I had observed a significant improvement in the 2D echo report, as previously it was 20 to 25% ejection fraction, and after the 6 months of course, it improves to 36% of ejection fraction. Also, the akinetic nature of the heart walls improved up to the hypokinetic level, and also the dilated LA and LV are improved to the mildly dilated LA and LV. Next slide, please. As we are in the evidence-based practices, so I would like to show both the 2D echo reports. First one is previous one, and second one is latest one. Previous one was done on 14th of June, and latest one was done on dated 25th of January 2022. Though it's just a 6 months of span. You can clearly see here the ejection fraction is improved. While during this course, the allopathic medications were tapered down as the patient's rest of the basic parameters were stable, and also his bipedal edema was reducing, and we can say improving. And at the end of the treatment, we can say after 6 months of the treatment, there is no any pedal edema, there is no any DOE, and patient also not on any Ayurvedic medication. Only the Gudichi I had prescribed him for the Rasayan Chikitsa. Next slide, please. With the help of Panchakarma, next slide, please. With the help of Panchakarma, I have used Arjuna oil and Arjuna for the Basti to do the therapies, and with the help of that, the cardiovascular sympathetic tone is improved, cardiovascular health is improved, and also the tone of the heart muscles is also improved. So with that, I have achieved that results. Next slide, please. My topic is quality of life is improved. As I had gone through so many research articles, so I don't find any particular topic related to the quality of life, but a few things I have observed, that is quality of life can be explained in a physical well-being, material well-being, social well-being, emotional well-being, and development and activity. With the help of these frames, quality of life can be explained. But as per the Ayurveda philosophy, if the patient is healthy, or if anyone is pursuing healthy body and mind, then he can enjoy the quality of life. So health can be defined as a state of balance of functional humors, metabolic fires, tissues, and excretion of the pleasant soul. So in my case, my patient, as I said, his walk test was around just 5 minutes, and he stopped due to the heaviness in the legs and with pain. So all his physical activities were completely restricted. But after the treatment, as he is a farmer and he is doing his all farm field activities very effortlessly, and he is enjoying his life right now. So that can I say, or I can come to the conclusion that the patient's quality of life is improved. Next slide, please. So conclusion can be the quality of life is improved with the improvement in LVEF after HFRT therapy treatment as an add-on therapy to the modern medicines in chronic heart cases, chronic heart failures.
Thank you, Dr. Ashish. Fantastic presentation. Any questions? Yes, Dr. Ashish, if you can see the chat box, there is one question before we move on to Dr. Rahul, sir. You said 6-minute walk test was terminated due to pain in lower extremities. So was it claudication? If yes,
no.
Did you investigate this patient clinically for diagnosing PAD?
Yes, sir. Yes, sir. There was no any claudications throughout the day or also not at the night. But whenever he start walk, he feels heaviness and stiffness in both lower limbs. So that is nothing but the Stoth, which is due to the fluid retention, and which is also due to the lower ejection fraction.
Fine. Rahul, sir, any comments?
Superb case presentation, Dr. Ashish. Congratulations to you and your team.
Thank
and
you,
the changes in patient's life may be a quantitative or maybe a qualitative. Quantitative may have a larger requirement or larger perception, but what do I feel? A qualitative change really plays a lot, because as you rightly said, the change you made in the patient's life matters the most. The patient who's a farmer and was not able to do the routine activity, and after your treatment, if he is doing his routine activity without any symptom, so nothing like it. So no more questions from my side. Over to Dr.
Yes, Praveen sir, your comments on this, please.
No question from my side.
Fine. So we move on to the next presenter. Thank you, Dr. Ashish. The next presenter is Dr. Vidyanvadkar, and her presentation topic is role of Sasneha Virechan in hypertension. Can we have the spotlight on Dr. Vidya?
Dr. Omkar, I would request you to do the spotlight because it's becoming
fine. No worries, sir.
Good for me to handle.
Okay, no worries, sir. Yes, Dr. Vidya, welcome. Good afternoon.
Hello.
Yes, ma'am. Good afternoon. You have 8 minutes of time.
Yes, sir.
So please share the screen with the presentation mode.
Yes. Hello all. Myself, Dr. Vidyanvadkar, Madhavbaug clinic head, and my today's topic is effect of Sasneha Virechan karma in the management of hypertension. Most devastating aspect of hypertension is that it is not characterized by any of cardinal symptoms and cause damage to vital organ over period of time. As we know, persistent hypertension doubles the risk of cardiovascular diseases, including ISD, CHF, and hemorrhagic ischemic stroke, also the peripheral arterial disease. And we know the long-term use of antihypertensive drug associated with many adverse effects like insomnia, slow heart rate, and kidney failure. Ayurvedic aspect is that according to Ayurveda, hypertension is tridosh janya Vat Pitta Pradhan disorder with the dushti of Dhatu dushti is main, Ras, Rakta, and Med. Ayurveda, through its holistic approach and radical treatment like Panchkarma, correct the basic pathology by eliminating the chief causative factor. Among the Panchkarma treatment, Virechan is the best for elimination of excessively vitiated Pitta dosha and to correct the Agni, and also it regulates the movement of Vata dosha. Aim and objective is that to evaluate the effect of Sasneha Virechan in management of hypertension. So mainly Virechan कर्म में 4 पेशेंट्स में मैंने विरेचन के रिजल्ट देखे हाइपरटेंसिव पेशेंट में. इसमें इंक्लूजन क्राइटेरिया जो था तो ओल्ड एज पेशेंट अबव 70 इयर्स उनको नहीं लिया था. कार्डियक कंडीशन जैसे CHF है, ISD पेशेंट या फिर कार्डियोमेगालिक के पेशेंट एक्सक्लूड किए थे, और जो एनीमिक पेशेंट है जिनका HB लेवल बहुत ही कम था वो पेशेंट में विरेचन नहीं दिया. इंक्लूजन क्राइटेरिया में 25 to 70 ईयर एज के पेशेंट इसमें इंक्लूडेड है, और उसमें भी मोस्ट ऑफ पित्त रिलेटेड कंडीशन जो है जैसे हाइपर एसिडिटी के पेशेंट या फिर एक्सेसिव स्ट्रेस ये कॉज जिनमें था, या फिर बर्निंग सेंसेशन इन चेस्ट और पाम, तो ये पेशेंट यहाँ पे विरेचन उनको दिया गया. ड्यूरिंग विरेचना से पहले जैसे सस्नेह स्नेहपान किया गया तो कुछ मतलब स्नेहपान के ड्यूरिंग पेशेंट में शिरशूल, भ्रम, क्लम, रुद्रवता, स्वेदाधिक्य, अनिद्रा ऐसे कुछ सिम्टम्स थे क्या, वो वहां पे मॉनिटर किए गए. और ड्यूरिंग स्नेहपान एंड ऑल्सो ड्यूरिंग विरेचन पेशेंट का सिस्टोलिक डायस्टोलिक बीपी कितना था वो मॉनिटर किया गया. विरेचन करते समय सबसे पहले स्नेहपान में पंचतिक्त घृत यूज किया गया, क्योंकि पंचतिक्त घृत जो है मोस्टली तिक्त रसा पित्त दोष पे काम करता है, और इसका डोज जो था तो वो 30 ml से स्टार्ट किया और 30 ml से फिर इंक्रीजिंग ऑर्डर में 5 डेज के लिए दिया. तो 5 डेज देते समय 30, 45, 60, 75, 90 ऐसे डोज में पेशेंट को वो दिया गया. घृत जो है वो सवेरे 6:30 to 7 AM पेशेंट को लेने के लिए बोला था, और सम्यक स्निग्ध लक्षण दिखने तक पेशेंट को स्नेहपान किया. तो सम्यक स्निग्ध लक्षण मतलब अधोस्ताह स्नेह दर्शन जब तक नहीं दिखता है तब तक वो स्नेह पेशेंट को लेने के लिए बोला. बाकी अनुपान में उनको उष्ण जल और बाहर ज्यादा नहीं घूमना है या फिर एक्सेसिव टॉकिंग ये सब चीजें अवॉइड करने के लिए बोली. और डाइट में थोड़ा लाइट डाइट जैसे राइस ग्रुएल या फिर ग्रीन ग्राम सूप ये सब चीजें उनको रिकमेंड की. बाकी पूर्व कर्म और प्रधान कर्म में सर्वांग अभ्यंग विथ निर्गुंडी तेल 25 to 30 मिनट्स के लिए किया गया वो पेशेंट में, और बाकी स्टीम दशमूल डिकॉक्शन से दिया. विरेचन योग में त्रिवृत्त अवलेह यूज किया, तो त्रिवृत्त अवलेह मॉर्निंग में 8 AM उनको देने के लिए बोला. और त्रिवृत्त लेह लेने के बाद पेशेंट के ऑब्जर्वेशन में जैसे विरेचन उनको जो वेग आए तो वेग कितने बजे स्टार्ट हुए या फिर वेग कैसे थे, उनके जो लक्षण थे मतलब जैसे लैंगिकी लक्षण, आंतरिकी लक्षण, व्यापद उसमें कुछ दिखे क्या, ये सब चीजें उसमें मॉनिटर की. लैंगिकी लक्षण मतलब ड्यूरिंग विरेचन पेशेंट को कुछ सिम्टम्स थे क्या, या फिर अंतिकी लक्षण मतलब लास्ट में जैसे विरेचन का प्रोसीजर कंप्लीट हो जाने के बाद पेशेंट को जैसे मोशंस में कफ निकला क्या या फिर पित्त निकला क्या, वो चीजें थोड़ा मॉनिटर करने के लिए बोले। पश्चात कर्म में संसर्जन क्रम जो है, तो अकॉर्डिंग टू विरेचन में कितने वेग उनको आए वो बेसिस पे 3 to 4 डेज का संसर्जन क्रम मतलब डाइट फॉलो करने के लिए बोला। तो डाइट में जैसे मूंग का कड़न या फिर मूंग का सूप, राइस, पेज जो रहता है वो उनको रेकमेंड किया। पंचतिक्त घृता की मेन इंग्रेडिएंट जो है वो निम्बो, पेट्रोल, वैगरी, गुड़ुची, बासा, हरित की, जो कि सब तिक्त रसात्मक और बेसिकली पित्त पे काम करने वाले हैं। त्रिवृत्त लेह इसलिए यूज किया क्योंकि वो रेचन द्रव्य में सबसे श्रेष्ठ बताया है। रेचन मतलब बेसिकली जो पक्वा अपक्वा दोष को बाहर निकालता है और बेसिकली उसमें उष्ण तीक्ष्ण ऐसे गुण होने के कारण उसका सूक्ष्मगामित्व ये बहुत अच्छा है, जो कि सेल्स में जो कुछ एक्यूमुलेटेड फैट्स है या फिर एक्यूमुलेटेड दुष्टि जो है वो वहां से इंटेस्टाइन में लाके बाहर निकालने का काम करता है।
डॉक्टर लास्ट 2 मिनट्स।
पेशेंट में जो रिजल्ट्स मिले तो 4 पेशेंट में फर्स्ट पेशेंट जो था फर्स्ट डे उनका बीपी 147/96 था। आफ्टर विरेचन जब उनके बीपी मॉनिटर किए तो 130/85। सेकेंड पेशेंट में फर्स्ट डे पे 154/96 था और आफ्टर स्नेहपान और विरेचन लास्ट डे पे 130/80 था। थर्ड पेशेंट में भी डायस्टोलिक बीपी उनका हायर साइड पे रहता था, तो डायस्टोलिक उनका 100-105 की रेंज में था, जो कि आफ्टर विरेचन 120/85 पे आ गया। और फोर्थ पेशेंट में भी आफ्टर विरेचन उनके बीपी ये नॉर्मल रहने लगे। अभी ये चारों पेशेंट जो थे उनमें बेसिकली एसिडिटी का इशू ज्यादा था, ओवर स्ट्रेस वो पेशेंट थे, खाने में स्पाइसी फूड उनके ज्यादा आते थे, तो पित्त रिलेटेड कंडीशंस उनमें ज्यादा दिखी। आफ्टर विरेचन जब पेशेंट के सिम्टम्स देखे तो सभी सिम्टम्स उनके रिलीव हो गए थे। बाकी कंक्लूजन में इट कैन बी कंक्लूडेड फ्रॉम प्रेजेंट डेटा, hypertension is prolonged and excess of tension and stress caused by blood on arteries. Hypertension is basically tridosha vyadhi with pitta dominance, and dushti of ras rakta med is there, strotorod and sira shaikilya is there. Virachan karma eliminate the morbid pitta dosha, particularly by having its effect on rakta and regulate activity of vat by its anuluman action, and thus it correct the ras rakta samvahan. And Virachan by means of inducing purgation help to reduce fluid volume, which may help to reduce cardiac overload and subsequently reduce blood pressure. Thank you, sir.
Thank you. Super presentation, Dr. Vidya. Rahul sir, your comments on this, please.
Excellent presentation, Dr. Vidya. I have one question, I'd rather say. It's not a question, I just curiosity. You did a fantastic job. You have given Virachan, classical Virachan Chikitsa to the known hypertensive patient. Have you seen the effect of this Virachan on their lipid levels as well?
Yes, sir. After Virachan, lipid level also reduced. Actually, I unable to mention here because of all data was not present at that time with me. But after Virachan, there is reduction in triglyceride level and LDL level also.
Because see, we need the data because in the modern aspect, they think a ghee intake may increase the triglyceride, right? Because here you have given a sasneha virachan. Sasneha, when you given a snehapan, many of time patient goes into the skeptical mode that I'm taking so much of ghee, so my triglyceride will increase. So unless and until we compile a data with continuous virachan chikitsa pre and post, अगर उनके हम लोग lipid levels करते हैं, and if you have a data of like 100, 200, 500 patients with a pre and post lipid profile, and if you publish that, then slowly and gradually people will understand that this sasneha virachan, the sneha what we are giving, will not damage the lipid levels or will not derange the lipid levels. So fantastic work, doctor. And one last curiosity that I am having is how long the results were sustained after a reduction. Once you find a reduction in blood pressure, how long it remain into the normal?
Actually sir, विरेचन के बाद 4-5 months तो भी मैंने वो पेशेंट को मॉनिटर किया, तो उनके रेंजेस अभी नॉर्मल में है। इवन एक पेशेंट में ट्राइग्लिसराइड लेवल जो कि 240 पे था, तो जस्ट आफ्टर विरेचन उनका लिपिड प्रोफाइल किया गया था, तो ट्राइग्लिसराइड लेवल 130 पे आया था और एलडीएल भी जो 150 पे था तो वो 90 पे आया था। जस्ट अभी वो लास्ट केस था, तो उसके बारे में बताया मैंने।
Yes, Dr.
Vidya, I have one question.
Yes, sir.
Is Virechana, is there any impact on allopathy dose tapering? What is the impact of this Virechana on allopathy drugs tapering?
एक्चुअली सर विरेचन के बाद जब पेशेंट के रिजल्ट्स अच्छे आने लगे, तो उसके बाद में पेशेंट के सिस्टोलिक डायस्टोलिक बीपी देख के फिर मेडिसिन टैपर किए उनके।
So right now patient are on allopathy medicine or not?
सर 2 पेशेंट्स में उनके 75% मेडिसिन टैपर हो गए हैं और बाकी 2 पेशेंट में मेडिसिन अभी नहीं है।
Okay, great. Congratulations. Yeah.
Yes, there are some questions in the chat box. Dr. Vidya, त्रिवृत्त अवलेह की मात्रा कितनी थी? एक ऐसा सवाल आया हुआ है।
त्रिवृत्त अवलेह 30 to 40 ग्राम दिया था पेशेंट को, मतलब 3 to 4 TSF लेने के लिए बोला था, और अकॉर्डिंग टू पेशेंट उसका मात्रा जो है वो थोड़ी वैरी भी हो सकती है। जैसे किसी पेशेंट में 3 चम्मच देने के बाद भी 15-16 मोशंस हो जाते हैं, वेग आ जाते हैं, लेकिन किसी पेशेंट को कॉन्स्टिपेशन का हिस्ट्री है या फिर वात दृष्टि वहां पे ज्यादा है, तो वो पेशेंट में डोज बढ़ाने की जरूरत पड़ती है।
बराबर, कोष्ठानुसार ये डोसेज किया जाएगा। और एक आखिरी सवाल था, घृत का डोज आपने कैसे डिसाइड किया स्नेहन के लिए?
यस सर, एक्चुअली घृत स्टार्ट करते समय 30 ml जैसे रस्सी ऐसी मात्रा बताई गई है, तो 30 ml से स्टार्ट किया और पेशेंट के सिम्टम्स वहां पे मॉनिटर किए। पेशेंट के मतलब उसको घृत लेने के बाद कितने बजे भूख लग रहा है, वो हिसाब से उनको सेकेंड डे का डोज डिसाइड किया, तो 15 ml से बढ़ाया।
Fantastic presentation, Dr. Vidya. Next, now we'll move on to Dr. Lakshmi Basutkar. Effect of lifestyle modification on ejection fraction. Dr. Lakshmi Basutkar. I'll just spotlight Dr. Lakshmi now.
Hello, everyone.
Yes, Dr. Lakshmi, you're audible.
Yes, sir. Hello, everyone. Today, my topic is about effect of lifestyle modification with Snehan Swedan Hridayadhara Basti and dietary changes on ejection fraction in known case of heart failure.
Yes, ma'am. Continue. You have 8 minutes of time.
Objective to do this is a chronic heart failure become the leading mortality in society. Epidemiological transition is because of increase in prevalence of chronic heart failure and the risk factors. 1 in 4 deaths in India are now because of chronic heart failure. Indisciplined lifestyle leads to lifestyle disorders. Now it was much needed to be incorporate non-invasive technique to increase quality and quantity of life under chronic heart failure patient, where Ayurveda is having a great path on reversing this. A patient, here I will be explaining a case where patient of 54-year male came to me with the anasarca, reducing resting DOE, heaviness in chest, sudden weight gain, fatigue, and pitting edema on feet. Medical reports along with ejection fraction, ECG with T-inversion, renal profile with reduced EGFR. He was ongoing medication on Ecosprin 150 mg OD, tablet Concor 2.5 mg OD, tablet Ditor 10 mg OD, and tablet Isolazine OD. Patient assessment done by me. There was no any history related previously. No any operative surgeries also happened to him. Patient was anxious, means anxiety and stress factor were there, and he was suffering from insomnia. Then assessment done by us are patient was present with 2D echo with a low ejection fraction, which was 15%, with a generalized hypokinesia, with LVH and type 3 diastolic dysfunction. His eGFR was also reduced to 39 ml per minute. Serum creatinine was 1.9 mg per dl. Investigation advised by me were a 6-minute walk test, because he was a low EF patient, so we were unable to do his stress test. That's why we done his 6-minute walk test using Carlin's equation to assess the VO2 max, which was 8.05 ml per kg per minute, and also did his ambulatory blood pressure monitor, and we found that he was a reverse dipping status. Diagnosis did by me was chronic heart failure with reduced ejection fraction after MI, hypertensive, and chronic kidney disease. Here, patient was advised to take 21 number of Sampurna Hriday Shuddhikaran Panchakarma, which includes Snehan, Svedan, Hridaydhara, and Basti. This therapeutic process is called as heart failure reversible therapy, which includes Snehana, means centripetal oleation for 30 minutes, which was having 120 ml of combination of Arjun, Nirgundi, Dashmula prepared in Tilataila. It reduces palpitation, improvises endothelial dysfunction, calms down hyperactive sympathetic nervous system, thus improving in chronic heart failure. Second procedure we done on him is Svedana, means thermal vasodilatation, which was there for 10 minutes. 15 ml of Dashmul Kada used for thermal vasodilatation to reduce the vata from body and also detoxification. Hridaydhara, it is a process called thoracic drip, improvises contraction and relaxation of muscle of chest wall and also reduces localized vata. Basti is a lastmost process of this Sampurna Hriday Shuddhikarana, which called as a per rectal drug administration, whereas we have used Arjuna and Punarnava extract in this. Arjuna, as we know, Arjuna is having an active component called terminic acid, arjunolic acid, glycoside is arginine, arjunosides 1 to 4. These are cardioprotective in nature, hence improvises blood circulation to heart tissue. Also, Arjuna is having a role of anti-arrhythmic, anti-anginal, anti-athromatic, anti-hyperlipidemic, anti-thrombotic, and anti-hypertensive. Also, extract of Punarnava is used in this, which is having an active component called Punarnavoside and Punarnavin. It works as an excellent diuretic and anti-inflammatory. Oral medication provided to patient was Arjun Kada. As we know, Arjuna is again major content in this medication, whereas it helps to strengthen myocardium, lowers cholesterol, improvises blood circulation. Punarnava helps in Punarnava helps by active component beta ecdysone and potassium nitrate. Act as a diuretic, reduces congestion, decreases cardiac load, and have a AC inhibitor activity. Vacha Vacha also present in this Kadha combination. It is a nephroprotective, neuroprotective, anti-epileptic, anti-stress bronchodilator. AC inhibitor vasodilator increases coronary flow and reduces load on the heart. Neutralizes mental stress and prevent its effect on cardiovascular system and other systems also. Other medication given to him was Shunti and Brahmi extract. As we all know, Shunti purifies Rasarakta Dhatu and nourishes other body elements also, and helping in strengthening heart muscles. As Brahmi extract is also used in this. Brahmi acts as an anti-hypertensive, neuroprotective, antidepressant, anti-anxiolytic, sedative, calms down sympathetic nervous system. Shunti and Brahmi both have calcium channel blocking activity, which is also used in this. Nitric oxide mediated vasodilatation activity, and also relaxation of CNS happens by this. It also lowers the heart rate. It also causes vasorelaxation, reduces peripheral resistance and cardiac output, and hence lowers hypertension. Arjun Kshirapak also used as a oral medication, as it is a preparation done by with the help of Godugdha. It acts as a murdu bahala, and snigdha gunas of milk will help to reduce down chronic heart failure. Some
Dr.
of
last
diet.
2 minutes.
Yes, sir. Dietary changes. We have provided with the 1000 kilocalorie ORAC diet to him, low carbohydrate, low fat, and high fiber diet to him, required amount of along with required amount of protein, and also water restriction up to 1.5 liters per day. Exercise, we have told him pranayama, anulom vilom, bhastrika, brahmari, 15 minutes walking, and yogasana. As we can see here, before and after parameters, we have reduced down his almost 10 kg weight and abdominal girth by 87 to 74 right now. Blood pressure has decreased to nice way, and pulse rate was 103, and right now it is like 69, ranging in a normal status. VO2 max was 8, and now it is 29.75 ml. Serum creatinine was 1.9, and now it is reduced to 0.92 mg per dl, and eGFR improved to a fantastic level, like from 39 to 90. All allopathy medication I have stopped, and all the parameters after stopping this allopathy medication are good. We can see the stepwise monitoring in total 6 months. We do have a 6 2D echos right from ranging EF 15%, 25%, then 25% to 30%, and then last 6th was 45 to 50%. In first and last, as we can compare, here is generalized hypokinesia in first, and so many other things with low EF 15%. In the last slide, we can see the transformation to 45 to 50% of ejection fraction, and with generally good in all parameters. This all happens. Reasons for improvement was timely investigation, education and awareness, daily monitoring, moral support, stress management, and lifestyle modification. Hence, I can conclude today's my case study as ejection fraction in known case of heart failure can be improved by lifestyle modification with Snehan, Swedan, Hriday Dhara, Basti, and dietary changes. Thanks a lot.
Thank you, Dr. Lakshmi. It was a fantastic presentation. Rahul sir, over to you.
Dr. Lakshmi, really fantastic presentation, and it really mesmerized me when I saw that the eGFR increased to the 90. Especially the patient with the heart failure with reduced ejection fraction, we know as their cardiac output is less, definitely their glomerular filtration rate is also lower. And if you are improving their LVEF, that is maybe the primary cause that the patient's eGFR has increased. I have few doubts, not bigger. Your research question was the role of lifestyle modification, right?
Yeah.
And Panchakarma. But what I have observed in your presentation, you used Arjuna in 3 ways. First, you given Arjuna in a basti, that means in a parectal route. Second, you given Arjuna with the oral route.
Yeah.
You gave third, you gave a Kshirpak of Arjuna.
Yes, sir.
So you used Arjuna in a 3 way for the same condition.
Yes.
And Arjuna, we all know it's a very fantastic herb who can act positive as a positive inotrope and who can nourish the myocardium very well. In Ayurveda perspective also, it has a very good result. But do we really need to use Arjuna in a 3 way?
Sir, the requirement what I have seen in patient was patient's 10 kg weight loss has happened in just 2 months. So in starting phase, a patient was with a swollen body, and then after, because of the reduction in water retention, patient was feeling a little bit of fatigue. That's why I preferred to go with the Arjuna Kshirapaka to act as an balya also. And oral, as we know, our ideal dosage 10 ml twice a day has been used. That I think which was required the most. And Basti procedure is, as of now, we are giving weekly twice. So per day, the introduction of that drug is not in that much dosage, overdosage. So I thought in that way, and I have prescribed in that way.
I feel that that your research title should be that what is the role of Arjuna in a three-way, in specifically CKD and HF-ref case. That could have been the little bit different aspect. But as my other question is like weight loss of 10 kg, and you already given the answer. That might be a reduction in the fluid retention, and that is the reason you have observed, because the patient, when he came to you, had a weight of 62 kg. So it is not he was not a obese patient.
Yes.
So 62 to 52 kg. So that means that was differently a fluid retention that you have reduced. Yes. And superb results, and keep it up. Over to Dr. Omkar.
Praveen sir, comments?
Yes. Lakshmi madam, very nice presentation, and very good documentation of consecutive 2D echo reports, where we see the progress of ejection fraction from 25% to near about 40-45%. So that was awesome. One question is that you are in your first slide, there is a reverse dipping status in this patient. So after the whole scenario, whole treatment, any change in that reverse dipping pattern? Yes, now you can speak.
Yes, sir. As we have done later on also, his ABPM without any allopathy medication was fantastic. With a patient was in starting phase, it was all based on stress factor, because of which he was having insomnia also, and that is why it was a reverse dipping status on that. And later on, as he starting improvising his sleep pattern, later on we did his ABPM for twice rather, and both the reports are absolutely normal with the normal ranges.
Yes, thank you.
Next time, whenever you are presenting, show that part also, because it's very crucial.
Yes, sir.
And we request you to compile at least 100 cases with the same manner, so that definitely we can consider the Ayurveda can be a very useful in a HF-ref like condition, because Dr. Hiremat sir is not here with us, because when we discussed the major the loophole where in the management of chronic heart failure is the management of HF-ref condition, because allopathy is almost helpless after some time. So we can be this kind of intervention can be very helpful to improve patients' quality and quantity of life, especially in country like India, where we are lack of tertiary care centers. So definitely, good job done.
Definitely, sir. We'll do that. Thanks a lot, sir.
There are a couple of questions in the chat box. First question is, can this protocol be applied to the patients with dilated cardiomyopathy?
Based on the symptoms, we can move ahead with it.
Okay. Second is, how was the percentage of oil in the basti? Percentage of oil, if oil was used in basti. Okay, there is one more question which I think Rahul sir or Praveen sir can also answer. Can every patient stop allopathic medicine when completed this Ayurvedic treatment?
Yes, actually not needed. When you see the patient first, Dr. Praveen sir can answer it much, because he is in touch with patients, so many of patients. But what I feel is you don't need to abruptly stop all the allopathic medicine on the day one, as Dr. Lakshmi has also done very nicely. As you are getting a recovery in the sign and symptoms of your patient, for example, you don't stop your, for example, patient is having such condition like CKD, and patient is already on some diuretic, don't stop the diuretic abruptly unless and until you find there is urine output is normal now, there is no fluid retention. After that, when you don't need that allopathy medication to be continued, then you can stop it. Otherwise, anyone should continue with the allopathy medicine and for the benefit of a patient.
Yes, true.
Yes. Praveen, any comments?
No, we can move to next presentation.
Okay, thanks a lot, Dr. Lakshmi. It was a super presentation. We'll move on to the next presenter now, Dr. Deepali Amin, and her topic of presentation is role of Vrana Upakrama in diabetic wound management. And spotlight Dr. Deepali. Just a minute. Dr. Deepali. Okay, please join by your names. Otherwise, it will be difficult to spotlight. Dr. Deepali, if you are there, kindly raise your hand.
Yes, I am there.
Yes, the presentation is already shared. Just put it on the presentation mode. On the right side corner, you will see the presentation mode just beside that 81% mark. You just click on it.
Yes, ma'am, you have 8 minutes of time.
Yes, am I
luck.
audible?
Perfectly
Yes,
audible.
very audible.
Best of luck.
Yes, sir. Good afternoon, everybody. Here myself, Dr. Deepali Amin, presenting my case. The topic for today is Vrana Upakrama. Application of Vrana Upakrama in management of diabetic wounds.
Make it on.
Application of Vrana Upakrama in the management of diabetic wounds. These are the pictures of my patient who has improved gradually. The treatment was started in January 2020. This wound is 8 months old and the patient being 15 years of diabetic. In the pictures we can see there is gradually changing.
There is some technical, just a moment, ma'am. The screen is not visible. Aman sir, can you just...
I think your screen, there's something on your screen, the presentation screen, your Zoom screen is on top of it. Probably we'll have to remove that.
Yes, sir. I'll just check out.
Yes. Your Zoom screen is probably on top of your presentation. Can you do one thing, Dr. Deepali? Just stop sharing for a minute. Just stop sharing. We can go ahead, click on share button. Go to advanced. And in that, select the PowerPoint presentation. That will help you make it much easier. So when you click on share button, on the share button, when the window pops up, there will be an option basic advanced. Click on the advanced tab.
Yes, sir. Yes.
Right there, you will see PowerPoint presentation. So yes, so doctors, everybody who is here, it's okay. I think this is a different presentation.
Yes, it's visible.
Yep. Visible now. Yes, ma'am. Please carry on.
Deepali madam, start your presentation.
Actually, I am not able to use it.
Your presentation is visible to us. what you'll have to do is go to the presentation screen and do forward and reverse. That should be able to help. I know sometimes what happens is there are too many screens on top of each other, so it becomes difficult. Just press Alt and Tab. Alt and Tab. You will see different screens and you can select a presentation screen from there.
Is it visible now?
For us, it is visible. It is visible to us.
Okay. Yeah, it is visible to me only. Sorry for the interruption. So I will start
No
with my
worries, no
topic.
worries. Please go ahead.
The application of Prana Upakrama in the management of diabetic wounds.
Yes. Okay. Continue, madam.
So these are the pictures of a diabetic patient who had a diabetic wound since last 8 months, which has not healed. So in the pictures A, B, C, D, E, F, we can see the gradually wound is healing, and the infected part was index toe, middle toe, and the little toe of the left leg. And first it was the wound was very bleeding, it has oozing and lots of pain and swelling on the left foot. And gradually we can see the changes in the inflammation condition, the swelling has completely reduced out. And the last picture we can see complete remodeling of the skin, and very fresh skin is present now. So the wound has healed up completely within a period of 3 months. Next slide. So what I believe is wound healing is not only about dressing with local ointments locally, but it is all about treating the wound from inside. The principle of wound healing is based on proper lifestyle management, correction in diet, managing micronutrients, macronutrients, taking care of GI tract, proper sleep and stress management. 20% of diabetic patients develop diabetic wounds. Out of diabetic wounds that do not heal, 25% require amputation. 50 to 70% of limb amputation are due to diabetic wounds. So it is very much necessary to heal the wound by controlling blood sugar and proper lifestyle transformation of the patient. In every 30 patients, one leg is amputated. Research says that following amputation, 50% of people will die after 2 years. But what is the reason? The reason is no change in lifestyle after amputation, and there is no proper diet regime to control the blood sugar level. So it is utmost necessary to complete lifestyle regime has to be followed to recover the wound or to heal the wound completely in a diabetic patient having long-standing high sugar level. Hurdles in wound healing are many a times diabetic patients having high sugar levels have defective vasculature due to poor diabetic control. The immune system is also hampered. Malfunctioning of the immune system delays wound healing as it plays a key role in wound healing. Poor amino acid uptake due to insulin resistance is also one of the major causes in delayed wound healing. And glycated proteins. Proteins are actually the building blocks, but they are glycated when they fail to perform their functions well. This leads to defective wound healing. Protein is necessary for the body, but protein when combines with a sugar molecule, it gets glycated, and these glycated end proteins increase the interference with normal cell functioning. Then also they increase diabetic complications and interfere in recovery from the diabetic complications. High HbA1c level is also one of the end glycated proteins which delays the diabetic complications recovery. Hence, these are the reasons which are the hurdles in recovery of the wound, and hence the wound does not recover completely. So, in Shishru Sanhita, Chikitsa Upakram, Shodash Shashti Upakram, 60 Upakramas, important diabetic tool to recover the diabetic wound, 60 Upakramas are been explained in our Sanhita. So these 60 upakramas are helpful in wound healing process, out of which I had used 60 upakramas in this case to recover the wound completely. The 16 upakramas are Apatarpana,
अभ्यंग, स्वेद, पाचन, स्नेहन, वमन, विरेचन, भेदन, कषायम, सर्पी, तैल, कृमिघ्न चिकित्सा, नस्य,
There is some technical issue, I feel so.
Yes.
I think Dipali madam is not there present now. Okay, just wait for a minute.
I think the network seems to be
There's a network issue.
There seems to be a network issue. Dr. Dipali has got disconnected, I think.
Yes.
Okay. So while Dr. Dipali reconnects Dr. Omkar, we can just, I would request you to hold on for some time, and then maybe we can go ahead and...
Sure, sir. We'll just wait for a minute.
Yes. So in the meanwhile, all those who are chatting, there are people who are on Facebook, YouTube, Twitter. I would request all of you to please give a comment on the chat box. What is your biggest learning from the cases that you have seen till now? I would request all of you to go ahead, and even those who are present in the Zoom session right now, please go ahead and type in the chat box your biggest learning from the cases that you have seen till now. In the meanwhile, Dr. Dipali would be able to join us in a few seconds. Dr. Omkar, you please carry on. I'll talk to Dr. Dipali and see.
Yes.
Dr. Omkar, what I'll suggest, we should move to the next presenter. We will accommodate Dr. Dipali ma'am in the next.
Fine, sir. No worries. Okay, the next presenter of today is Dr. Sagar Patil, and his topic of presentation is effect of high ORAC diet on liver function, case study. Yes, Dr. Sagar.
Okay.
Yes, Dr. Sagar. You have 8 minutes of time and you can share your screen now.
Sir, how to share my screen?
Dr. Sagar, click on in the Zoom. Can you see the share button below? The green colored share button.
Share
On your
yes,
screen, there is Spotlight Security Participant Chat. There is a green colored share button. Please click on that share button. Right? There you will see the option of your screen, PowerPoint in basic and advanced. You'll see two types of options. Fantastic. Your screen sharing is started. Great. All the best, Dr. Sagar.
Yes, sir.
Just request to put it in the full screen mode. Please press Shift and F5. Yes, that will also do. Perfect. Slideshow mode, yes. Fantastic, Dr. Sagar. All the best.
All the best.
So, respected dignitaries, senior team, and my dear colleagues, today I am presenting a case study, efficacy of high ORAC diet on a liver dysfunction due to alcohol abuse. Myself, Dr. Sagar Patil, I have done BMS and fellowship in preventive cardiology and now working in a Bhiwandi Madhavbaug clinic. So about 30% of the people with alcoholic liver disease have hepatitis C virus and others have hepatitis B virus. People with alcoholic liver disease are also at a greater risk of liver cancer. About 50% have gallstones. So those with the cirrhosis often develop kidney problems, intestinal bleeding, fluid in the belly, confusion, liver cancer, and severe infections. Chronic and excessive alcohol consumption produces a wide spectrum of hepatic lesions, the most characteristic of which are steatosis, hepatitis, and fibrosis or cirrhosis. So, early treatment can prevent the further complications. So, my objective is very clear: to regulate liver function to its normal level and to prevent liver from going into more severe form of liver disease. So now I am presenting my patient's case study. My patient is 38 years male patient having a history of alcohol and tobacco chewing.
He is living in Bhiwandi. He is taking alcohol and tobacco since last 23 years. I am audible?
Yes, you are audible.
He is taking alcohol and tobacco since last 23 years. His daily alcohol dose is 720 ml of whiskey, which almost contains 40 to 50% of the alcohol. And he is taking daily dose of tobacco 7 to 8 times a day. He has complaints on his first visit like dyspnea on exertion grade 2, palpitation, burning and pain at both soles since 4 years and at both palms since 15 days, swelling in lower legs, fullness of abdomen, constipation. His weight was 99.4, so his BMI was 38.83, abdominal girth was 120 centimeter, and loop pulse was 140 by 140 per minute. BP was 164 by 124 mm of mercury. Oxygen and sugar was at normal level. His hemoglobin was normal, but his bilirubin levels were increased, and also SGOT and SGPT levels were also increased. In lipid profile, his cholesterol and LDL levels were increased. Rest blood reports were normal. Due to his dyspnea and swelling in both legs, I have done his 2D echo, and the report was his ejection fraction was 55% with the concentric LVH and moderate left ventricular diastolic dysfunction with borderline tachycardia. His sonography report was normal. I have done his walk test to check his heart health, and his MET level was 4.1 and VO2 max, which was 14.18, which was reduced. So the diagnosis was very clear according to his dysfunction in the liver function test and the lipid profile. Due to prolonged alcohol intake, he was alcoholic liver disease. And on the basis of NYHA class 2 DOE and the reduced MET value and VO2 max, he was diagnosed as a CHF, that is a chronic heart failure. So now the treatment. I have given him a high ORAC value portion controlled diet labeled as a reverse diet box. So why I have given him a high ORAC diet? Because alcohol is one of the major reasons for the formation of free radicals in the blood, which causes inflammation and oxidative stress on the liver cells. Diet with the high ORAC value helps to reduce this oxidative stress and inflammation of the liver cells. So ORAC, which means oxygen radical absorption capacity, is a food which reduces inflammation and oxidation of the liver cells. So reverse diet kit was that food with the same properties. Properties like low calorie means 1000 calorie per kilocalorie per day diet, low carbohydrate with moderate protein and fat with the high antioxidant capacity, almost 50,000 ORAC value, with the richest source of vitamin C around 500 milligram per day, high potassium and low sodium, rich in omega-3 fatty acid with anti-inflammatory properties in the food. I have given him Panchakarma for his CHF condition, Panchakarma called as a Sampurna Hruday Shuddhikaran therapy, which contains centripetal oleation means Snehan, thermal vasodilatation means Svedan, thoracic drip means Hruday Dhara, and per rectal drug administration means Basti. I have given him a decoction of hepatoprotective and Yakrut Uttejak dravyas like Daru Haridra, Kutki, Apamarga, Parijat, Bhunimba, Rohitaka, Pippali in a 20 ml BD dose before food. So after 2 months, I have find these fantastic results. His weight was reduced by 5 kg, so BMI was also improved. Abdominal girth was reduced by 5 centimeter. Pulse rate was reduced from 140 per minute to 118 per minute. BP reduced to 144 by 98 mm of mercury, and his MET value also increased to 10, and VO2 max also reached to its normal value. In blood test, his bilirubin levels, which was earlier in an abnormal value, were reached to its normal value. SGOT and SGPT was also in a normal range, and in a lipid profile, his cholesterol and LDL were also reduced after 2 months. So my conclusion is high ORAC diet proved to be the effective to normalize liver function to its normal level with its anti-inflammatory and antioxidant property. So high ORAC diet ultimately helps liver to prevent it from going into the more severe form of liver disease. Thank you. Hello.
Yes, super presentation, Dr. Sagar. No question from my side. Dr. Rahul, any question from your side?
Dr. Sagar, it was a fantastic presentation. और थोड़ा ये हटके presentation था अब तक जितने हमने topics देखे. It was quite an outstanding topic. Rahul sir, any questions from your end?
Yes, you can. You are on mute.
Dr. Sagar, fantastic case presentation and very well explained the concept of Pathya Ahar, because nowadays people are considering the medicine for every disease. But in Ayurveda, it is very well written. The Hetu Viparit Chikitsa is the primary mechanism or the primary action to play, and this very well explained with good evidence. As I asked to other presenter, I'll ask you again to collect or compile at least 100 of cases with the same results document that you have compiled. So that will be definitely very next level treatment for the upcoming generation. Okay, over to next presenter from.
Yes, one question I would like to take. There was a question asked by one of the doctors whether any sonography was done in this case.
Yes, was done, which was normal. So I have not done second sonography report.
Fine. So there was no fatty liver disease as such.
No, sir, no.
Fine. Okay. So now we'll move back to Dr. Dipali Amin. Dr. Dipali, if you have joined, kindly start your video so that we can spotlight you. Dr. Dipali.
Move to the next presenter, Dr.
Move to next presentation.
Just a moment. Okay. Fine. We'll move on to the next presenter then. The next presenter is Dr. Nilesh Subhash Kulthe.
I think Dr. Dipali has started the screen sharing. Dr. Dipali, I hope you're there. Can you please confirm? I think I can see your screen. You started sharing your screen.
We are unable to spotlight because
she has joined as Madhavbaug clinic. I'll just spotlight her. And Dr. Dipali, you'll have to start your camera. Your camera is right now off. That's the reason why we are not able to spotlight. So you'll have to put on your camera. Great. We'll spotlight you and then you go ahead.
Yes, ma'am. Now you can share your screen. Dr. Rahul, if you can help by sharing the screen, or Dr. Aman, if you can help by sharing the screen.
Yes, I'm sharing her presentation.
Yes, sir.
Yes, I think we were at this Shodash Upakram.
Right. Yes, ma'am.
Yes, ma'am. Go ahead.
I think there is an internet issue.
Dr. Dipali, we can see you. Please go ahead and start. We can see you. We are able to see you.
Okay. Then starting with the first slide, we show the pictures of the wound recovery.
You'll have to just come a little closer to the mic. Just come a little closer to the mic. Or if you can put headphones, it'll be much easier, but I can see you and your slides are also visible.
Okay. Let's start with the first slide.
Okay.
Okay. Next slide. Okay.
Yes, ma'am.
So
Please start.
I am explaining the application of Prana Upakramas in diabetic wound healing. The picture application of Prana Upakram in management of diabetes. Next, the picture shows recovery of the wound. This wound is 8 months old in a patient who is suffering from diabetes since 15 years. The affected part is the index toe, middle toe, and the little toe of the left leg. Next slide. We are seeing improvement in his wound in the last picture, where the inflammatory signs, the bleeding, the oozing has reduced out, and the pressure wound has improved. The diabetic wound management is not only about dressing with local ointment, it is all about treating the wound from inside. The principle of wound healing is based on proper lifestyle management, correction in diet, managing micronutrients, macronutrients, and taking care of GI tract, proper sleep, and stress management. 20% of diabetic patients develop diabetic wounds. Out of diabetic wounds that do not heal, 25% require amputation. And 50 to 70% of limb amputation are due to diabetic wounds. So it is very much essential to control the blood sugar and to transform the life of the patient to improve the wound and prevent him from amputations and delayed wound healing. Research says that following amputation, 50% of people will die after 2 years. The reason behind this is no change in lifestyle after amputation and no proper diet regime to control the blood sugar level. Next slide. What are the hurdles in wound healing? In a long-standing diabetic patient with higher blood sugar level, there is defective vasculature due to poor diabetic control. Even the immune system is hampered. Malfunctioning of the immune system delays wound healing as it plays a key role in wound healing. The poor amino acid uptake due to insulin resistance also causes delayed wound healing. The end glycated proteins, that is, the proteins are building blocks of life, but they are glycated when they combine with sugar molecules in uncontrolled diabetic patients. Hence, they fail to perform their function as well. This leads to defective wound healing. It is the major reason with high HbA1c levels where the wounds are not healed. Water retention is one of the other causes. Hyperglycemia leads to water retention as sugar is hygroscopic. Even high sugar level provides a favorable atmosphere for the bacteria to grow. Higher HbA1c level delays wound healing, and in diabetic complications, the advanced glycated end products play important role in long-standing hyperglycemia state in reducing the normal cell functioning. They interfere with the normal cell functioning and delay wound healing. So the AGS progression increases the progression of diabetic complications. So it is utmost necessary to control blood sugar level in diabetic patients. Next slide. Next slide.
Rahul sir, next slide.
So dealing with the wound regime, I followed the Brana Upakramas explained in Sushmit Sanhita, 3 Braniya Chikitsa. 60 Upakramas were explained. 60 important tools were explained by the Granthakaras while treating the wound. So I followed 16 out of it. Next slide. 16 Upakramas out of 60 explained in Sanhita were used by me in treating this patient and getting his wound healed. The 16 Upakramas are the Apatarpana, Apyanga, Sveda, Pachan, Snehan, Vaman, Virejan, Vedan, Kashayam, Sarpi Tel, Bhakti Karma, Bhumigna Chikitsa, Nasya, Shiro Virejan, and Am. The Apatarpana can be considered as Langhan, giving low-calorie diet, restriction of fluid, can be taken as Apatarpana. Abhyanga is oleation with oil. Vedana was done localized and whole body Vedan was given. Pachana with herbal medicines was done. Snehan is application of ghee or oil orally or local application for wound healing. Vaman is the herbal medications induced for vomiting with good control on vitals. Virechana is the purgative medicines to induce loose motion.
Vedana's treatment was given with medication. Kashayam, herbal decoction of purgative, the combination of purgative medicines, the combination of anti-diabetic medicines and immunomodulator herbs were used as an kashayam. Sarpi, that is Ghrita, medicated Ghrita was used for local application and also internal intake also the Sarpi was used. Tela is medicated oil that was used for dressing also and also for the overall abhyanga. Trimigna Chikitsa was given, Nasya was given, Shiro Videshana was given, and a special ahar was also planned for the patient which helped in wound healing. A special diet for wound healing containing proper balanced nutrition and calories was introduced to the patient, which helped him to get clear his wounds properly and also good control on blood sugar level. Next slide. Principle based on Vana Upakrama which helped me wound healing were water restriction, the Virekana Vega, 15 to 18 days Resi Vega, which throw out the plague and Dusha Dosha and excess water from the body which helped in wound healing. The Vamana was given Lagu Vamana, Branaropa herbs were used, medicated ghee and oil was used as per the stages of the wound healing was used for dressing. Proper monitoring of sugar levels was done. Low calorie diet plate photos were taken from the patient and was monitored strongly for a stringent diet. And exercise lessons daily were taken at the clinic to improvise his lifestyle. So these were the all measures which helped in wound healing. Next slide. This was the case of 58-year male which I explained, and he was a diabetic since 15 years, was tobacco addicted, and the wound was not healed from the last 8 months. The patient has taken various approaches, various treatments from other sources, but by transforming his lifestyle and an holistic approach of many things has helped him to improve his wound and also control his diabetic parameters. Next slide. Local complaints patient during the treatment where he has non-healing wound, pain, burning, feeling, swelling, and burning sensation. Fried food was also had burning and numbness, restlessness at night due to leg pain, and he was unable to walk due to leg discomfort. Next slide. Generalized complaints were constipation, majorly bloating, dyspnea on exertion, insomnia, weakness. He was suffering from all these generalized complaints. So this shows that his GI tract was also not good and no proper food. Next slide. His parameters were improved, like the weight reduced from 70 kg, it reduced to 63.2. Abdominal girth was 94, reduced to 82 centimeters, and his HbA1c was 11.3, and now it is 7.2. His random blood sugar levels were 347, and now they are nearly 147. Triglycerides were 123 earlier, and now it is 105, and an SSCRP, which is inflammatory marker, was 9.6, and now it is 5.4. Next slide. The treatment regime includes the comprehensive diabetic care treatment, which consists of panchakarma therapy, diet, oral medication, exercise and yoga, and proper monitoring. So these all the 5 elements help him to recover early from his diabetes case. Diet regime, a special diet was given to the patient, which included low calorie diet, high in protein. In this diet box, there are 7 healthy options of breakfast which contain high level of protein, and these proteins are an excellent source of improving the immunity of the patient and giving him a proper nutritional balanced food. It contains lots of antioxidants and less carbohydrates, which made him improve from his blood sugar levels. Exercise, yoga, stress management also helped him recover. This was all done through an app called as MIT Pulse app. MIT Pulse app is an app used by Madhavbaug patients for continuous monitoring of exercise and diet and sugar parameters by the patient. So continuous monitoring is done with the help of MIT Pulse app. Herbal medications were used like decoctions of anti-diabetic decoctions, which improve the liver function. Immunomodulator decoctions were used. So all these medicines help him improvise. So this Panchasutri treatment of diabetic care control helped him to recover from his diabetes wound, along with the 60 Upakramas explained in Sushi Sanhita also helped him to recover completely. Thank you so much.
Yes, madam, that was super presentation. There are some questions before I move on to Rahul sir and Praveen sir. A question has been asked by a doctor. PAD is a crucial problem with diabetes mellitus with smoking. Whether you have examined ankle brachial index of your patient.
No, sir. Ankle brachial index was not measured.
Okay. Fine. Right. Rahul sir, your comments on this, please. Just a minute, sir. Please unmute. Yeah.
First of all, I congratulate Deepali ma'am for selecting such a difficult point to explain here on this platform, because we know diabetes is a one part, but the treating the complication of diabetes is very difficult, and especially the diabetic wound. We know the managing diabetic wound, it's a very difficult task, and how scientifically she has managed and that the treatment aspect that you have given up, put a light on the treatment aspect, how what 16 procedure that you have practically done in your patient, and how your patient has improved. So fantastic job done, excellent. And clinically we have seen the superb improvement. What I feel, if we can gather other parameters also, like the as one of the doctors suggested, the ankle brachial index, the peripheral artery disease, and along with that, if we are having some inflammatory markers also, like HSCR, CRP, or the total, at least a total count, what was the changes in the total count, or the neutrophil to lymphocyte ratio, if there is any change. So such path lab markers, I think they could take this presentation to the next level. But at the end of the day, it is a superb presentation what I have seen, and thanks a lot, Deepali ma'am, for this fantastic presentation.
Yes, Praveen sir, your comments.
Yes, very nice presentation, Deepali madam. Can you put light on the local application treatment in this case?
Yes, sir. Local application, initially I had used medicated oils for the local application, and the dressing was done by me at the clinic itself. And the dressing, the intention behind was first not only to get into the wound part, because there was excessive bleeding. I started nourishing the nearby part to reduce the inflammation of the nearby part, and to reduce the Snehan Svedana was also done very mildly to improve the vasculature or improve the blood supply of the near part, so that I can recover the tissue from within. So in that way, I started with oil application, that is Jatjadi Tela. And after that, when I saw there are 4 stages of wound healing. When I saw there is coagulation of blood, and the blood and oozing has stopped, now that the wound has gone into the second phase. So later on, I started using Bruta, that is Yashti Madhu Bruta was used. And as I started Yashti Madhu Bruta, the next phase of proliferation, inflammation reduced out, and the remodeling of the tissue has started. So these all help me in improving this.
Okay, thank you. Yes, Omkar sir.
Yes, awesome presentation, Deepali ma'am. And now we'll move on to our next presenter. And the next presenter is Dr. Nilesh Kulthe on the topic of effect of Virechan karma in dyslipidemic patient and GTT negative. Yes, Nilesh sir. Yes, sir, you have 8 minutes of time. Kindly unmute yourself. Unmute, sir, unmute.
Wait, I will. Okay, start your presentation.
Thank you, all the respected members in the presentation. My topic is effect of Virechan karma in dyslipidemic patient and GT negative case study. Myself, Dr. Nilesh Kulthe, working in Madhavbaug since last 7 years. So why this question came? Because generally when we are treating patient with diabetes, our end goal is to take the patient towards the GTT negative. So this case was started with the thought that a patient, if he is getting treated with a diabetes care plan, he should end up with the GTT test. So my research question here was, does Virechan Thus, Virechana Karma aids reduction of dyslipidemia and helps in attaining GTT negative. So this was a case of 51-year-old gentleman who presented with diabetes history since 2010. He was having dyslipidemia and he was a retired person from LIC and he was from Karnataka region. So his initial presentations were as symptoms we can see here: burning soles, vertigo, giddiness, obesity. Weight was somewhere about 75 plus, body mass index 27, HbA1c being in 9.8 range. So looking after all the vitals, his diagnosis, he was diagnosed as diabetes mellitus type 2 with dyslipidemia, with uncontrolled sugar, with obesity. So looking after all the parameters, he was started with diabetic management, which ended up with getting his HbA1c below 6.5 with good glycemic control and weight loss. But after attempting for a glucose tolerance test, where a 75 grams of anhydrous glucose challenge was given, his GTT test was not up to the mark, where we can see his post 2-hour glucose levels were above 140, that was 160. So it was thought that why that GTT test negative could not be achieved. So as I went through various researches, came to know with the relationship between dyslipidemia and deranged glucose levels. Also, there were some researches stating that liver lipid metabolism, and also we can see that in twin cycle hypothesis, liver also plays a very crucial role to get you good glycemic control or reverse your diabetes. So looking after all these details, the patient was planned with Virechana Karma, as he went with Snehapan with Gogruth. Virechana Dravya was used for as Abhayadi Modak, and later he was followed with Sansarjan Karma. After completing the treatment Virechana Karma, he was also guided for dietary modifications, regular exercise for at least 30 minutes of walk, strength training exercise with dumbbells, and meditation of 15 minutes. After all these interventions, patient's glucose were in good control, so they again improved drastically. Again, patient had energetic feel and his parameters improved, as we can see on the screen. And after Virechana also, he had a good weight loss, about 3 kgs. His HbA1c again dropped down to 6.1 and his random sugar levels were in good range of 132. So the major observation here were, before starting with the Virechana Karma, as we have seen that lipid profile derangement and sugar fluctuations can have a relationship, and also with the glucose tolerance test. So Virechana was planned, and here we can see his lipid profile improved after Virechana Karma. Previously, one of my presenter also had presented that yes, there are definitely improvement in the lipid profile, and here also same we can see with the lipid profile reports. And after these lipid profile reports, patient was reattempted for a glucose tolerance test, and that time his sugar levels post 2 hours were about 190. So here I would like to discuss about Virechana Karma. Also, along with that, counseling was a major part, that patient was time to time guided for regular exercises, regular follow, and timely investigation where sugar levels were monitored, his weight were monitored. So as we all know, Virechana Karma, why we have advised it? Because considering dyslipidemia, there is hypofunctioning of Medu Dhatvagni, which plays a crucial role. Along with that, Ahar and Vihar is also important part to consider to reduce down the lipid profile levels. So all these intervention, which included Virechana Karma, along with that Ahar, Vihar management, stress management, these were guided to the patient. And after following religiously from the patients, and we could get good results. So GTT negative is not just a single incidence, but again, patient's gastrointestinal tract metabolism improved, his hepatic health was improved, and again, vascular and musculoskeletal system was again activated, where sugar uptake in a patient who is given with 75 grams of glucose challenge was achieved with GTT negative. So here straight away we can conclude that a stringent monitoring along with the diet follow-up, exercise follow-up, and Virechana Karma can help in patient who is dyslipidemic in spite of his HbA1c being in a good range or non-diabetic range. If we wish to get him a GTT negative, a Virechana Karma can be planned. Again, this is a single case study. I need to work on more than 30 or 100 samples to get a proper confined results and to come to a conclusion of GTT negative after post Virechana Karma in dyslipidemic patient. So these are some of the references, and my acknowledgement to all the respected dignitaries, my guidance, my mentors, respected Rohit sir, Gurudatta sir, Praveen sir, Rahul sir, and last but not the least, all the clinic doctors, with whose discussion I am able to conduct these type of researches and always are supporting patient. So I hope I have completed my presentation in time, and thank you.
Thanks a lot, Dr. Nilesh Kulte. Rahul sir, your comments on this, please.
Yes, Dr. Nilesh, very nice presentation. And I congratulate you because being you are a leader of one of the Madhavbaug region, and you presented this case with all the what I'll say, tell you your expertise. So superb case presentation, first of all. Second, I as an expert, I would like to ask you a question. Is there any relationship in between the liver function, pancreatic function, and the viration process?
Yes, as I have stated some of the references, there are clear-cut incidences that yes, lipid metabolism, which majorly take part in liver, because liver plays a vital role. As we have seen in the reverse cholesterol transport mechanism system, liver plays a vital role. So definitely viration karma will help in aiding, reversing, or reducing the dyslipidemia conditions.
Yes, Praveen sir.
Yes.
Comments.
Yes, this was a very nice session, and thank you, Dr. Nilesh, for putting us a link between the dyslipidemia and poor control of glucose in diabetic patients. So every doctor who is attending this symposium must do the lipid profile test for those patients who are not in a good diabetic control and whose GTT is not at par towards the normal level. So it was very nice presentation. No question from my side.
Dr. Nilesh, there are some couple of questions in the chat box. GTT attempt was done after how many days of viration?
Yes, after completing Virechan Karma, a 7 days Sansarjantram was followed, and after that 15 days gap was given, and then patient was planned for GTT test.
What diet interventions regarding fat percentage during course of treatment were done?
Yes, here I think so. I had shared in one of the slide that barley, a mix Madhav Shakti atta that is generally prescribed at Madhavbaug, which contains, I'll just share. Yes, which contains barley, green gram, wheat, and these were chana, which were given to the patient in form of atta, which was given in the quantity of 30 grams of atta on daily basis in one meal. That was the restricted amount of diet that was prescribed to the patient.
Right. Okay.
Nilesh, one last question from my side. How can we confirm that the results of the diabetes remission is because of the diet, the cumulative effect of diet, and it's not because of the viration?
Sorry, didn't get you, sir.
Yes. See, you continue with the same diet. This may be a result of it may be a cumulative effect of the diet that you continued throughout the 6 months. And because the first attempt that you made to confirm the remission of diabetes, you found the patient is still showing the GTT positive, right? He was a positive for glucose tolerance test. But the second attempt when you made, you found the patient is glucose tolerance test negative. But the same time, the patient maybe get benefit of the cumulative effect of the continuously low carb diet that you put the patient on. And so I just want to, how we can confirm that this results, what we have achieved is not of a cumulative effect.
First part is, as patient had initially also continued with the diet, that time the results were not there. So
but that time he was taking it for the 3 month only. After the second attempt, he was taking it for the 6 month. So definitely his insulin resistance status, because as we seen the say HbA1c was 6.8 and now after it moved to 6.1. So how can we rectify that thing, that these results are not only because of the virachal?
Okay, again, I would go to the previous researches what I had gone through, where it has clearly stated that liver functions and dyslipidemia have a strong relationship with the sugar metabolism. And second part was the twin cycle hypothesis, where it clearly states that if there are fat deposition in the liver, then it hampers with the sugar metabolism. So considering those 2 points, I concluded that liver detoxification or virachan karma has helped them to achieve GTT negative. Again, it is a single case study, so it is difficult to conclude from single case study.
So I'll request you and your team to conduct some case control studies in the future. So maybe within the next National Ayurveda Cardiology Symposium, you and your team may represent the exact role or the mechanism behind the virachan and the remission of type 2 diabetes.
Absolutely.
Thank you.
Right, sir. And can we use this virachan karma in patients with impaired GTT? Yes, thanks a lot. So now, doctors, we'll move on to the next presenter. The next presenter is Dr. Tejaswini Shingan, and her topic of presentation is role of heart failure reversal therapy to improve prognosis and prevent organ damage in chronic heart failure patients. Dr. Tejaswini.
Good afternoon all. Myself, Dr. Tejaswini Shingan, working as preventive cardiologist in Madhavbaug, Nerul Clinic since last 8 years. The topic of presentation is role of heart failure reversal therapy to improve prognosis and to prevent organ system damage in chronic heart failure patient. Objective of this study is fluid management is very much important in the chronic heart failure patient. One of the primary problem with heart failure is excess fluid in the body, which the heart must pump to the kidney to excrete it. In order to avoid this fluid overload, patient need to monitor their daily fluid intake as well as urine output. Methodology used is prospective single case study. Patient details. Patient was a 48 years male. He has a history of diabetes and hypertension since 2009. Patient has atrophic kidney, so right renal transplant done. Donor was his mother. In 2016, patient got heart attack. Then he thrombolized with streptokinase and went for a coronary angiography. Then went for PTCA to LAD. In 2021, he went for chronic. He has a diagnosis as chronic heart failure, CHF with CKD. Complaining of dyspnea on exertion, grade 3, back pain, bipedal edema, as well as anorexia. Allopathic medicines. You are watching this list. Next. Investigation before treatment, 2D echo showing ejection fraction 30% with grade 3 diastolic dysfunction, LV apex akinesia. Patient was on a 6-minute walk test. His VO2 max value was at 20.18. HbA1c was 6.9. At that time, his creat level was 2.5. Hemoglobin was 16.1. Also, BUN, urea and uric acid also increased. For differential diagnosis, there are non-cardiac causes like a circulatory congestion secondary to abnormal sodium and water retention, pulmonary edema due to acute respiratory distress syndrome, ankle edema due to varicose veins, obesity, renal disease or gravitational effect also, dyspnea due to chronic lung disease, obesity as well as anemia. The diagnosis was chronic heart failure, diabetes, hypertension, post-PTCA with CKD. Treatment given to him oral medication, we had planned castor oil, Ricinus communis with Triphala, which is anti-inflammatory, analgesic, malashodhan, ampachan, as well as dosh-shodhan. It also increases the plasma to lumen clearance of urea and creatinine. Then another medicine used was a shallaki, that is Boswellia serrata, which is an anti-inflammatory, cardioprotective, anti-atherogenic, as well as hypolipidemic. And then Calmeg, that is Andrographis paniculata, which is an antithrombotic, thrombolytic, as well as hypolipidemic. With this oral medicine, we had given suggested a diet to patient, limit the intake of fluid and water, restrict the amount of sodium, potassium, phosphorus in his diet, restricted protein intake, as well as adequate carbohydrate to provide energy, supplied a moderate amount of fats, that is dry fruits, nuts, ghee, supply vitamins and trace elements in adequate amount with a high fiber diet is recommended. With diet and oral medicines, Panchakarma had also advised heart failure reversal therapy contains centripetal oleation, external oleation or massage with Arjun oil performed on hands, legs, shoulder, thorax, back in centripetal manner for 20 to 25 minutes with 15 to 30 strokes applied on each part. It helps to reduce the peripheral resistance and cardiac workload, decreases activity of nerves, and helps to reduce heart rate and blood pressure, improves venous drainage towards the heart, and improve cardiac output. Also help to increase cardiac contractility, decrease inflammation, and decrease systemic vascular resistance. Then second procedure was thermal vasodilatation, means passive heat therapy with Dashmul decoction for 10 to 15 minutes. It helps to reduce salt and water accumulation, reduces viscosity of the blood, dilates the blood vessel, reduces workload on the heart, as well as decrease the sympathetic tone, which will help to decrease the heart rate and blood pressure. Then third procedure done was thoracic drip, that is Dashmul decoction dripping with continuous speed from 7 to 8 centimeter height over the medial mediastinal region for 15 minutes.
Come to conclusion.
It induces the local vasodilatation, which strengthens the respiratory muscle and decreases the dyspnea. And fourth process was per rectal drug administration, medicated enema of Arjun extract oil 100 ml given per rectally. It will help to reduce lipid levels as well as reduce fluid overload, decrease heart rate, as well as strengthen the heart muscles and decrease the workload on the heart. Treatment with timeline. Next.
Doctor, last 2 minutes left.
After this treatment, his VO2 max is improved. Patient is improved from 6-minute walk test to 15 minutes treadmill test. VO2 max improved from 20 to 36. Fluid intake, at first it was 1 liter, and at that time urine output is only 850 ml. Now he is taking more than 1.5 liter per day, and urine output is also improved. 2D echo reports improvement shows from ejection fraction from 30% to 42%. Serum creatinine level improved from 2.5 to 1.9%. HbA1c also reduced from 6.9 to 6.2% with tapering of allopathic medicines. Next. Reports are attached here. Next. Next. Stress test report also attached here. This report shows from 6 minutes patient improved up to 15 minutes treadmill test. Now his VO2 max value is 36. Medicines tapered. With the help of HRT treatment, fluid restriction, and by monitoring urine output, VO2 max value, ejection fraction, serum creatinine levels were improved. Patient symptoms were also improved. Vital parameters were stable. Conclusion of study is the most important result of this study is that within 1 month of HRT treatment, restricted fluid intake, low calorie diet, exercise, and regular monitoring of urine output showed a significant improvement in 2D echo, exercise tolerance capacity, and renal function test. Thank you.
Beautiful presentation, Dr. Tejaswini. Rahul sir, your comments on it.
Brilliant presentation. and very well presented, though it was a little bit lengthy presentation, because see, when we need to present our topic within 8 minutes, we have to restrict few information, and we have to avoid repeated information. So at bottom of the line is very nice presentation, and the results what you are showing, because see, the patient with a CKD and heart failure, and if they are getting reverse with this kind of Ayurvedic interventions, and so nothing like it, because people are waiting for such kind of a intervention. Only the unknownness, because people don't know whether really this such condition can be reversed. So I request you to compile, you and with your team also, to compile such beautiful results together, because this is I think second case where we are discussing the impact of improvement in the LVEF and its impact on the improvement in the EGFR, and how you are preventing the damage of end organs. So very nice work done, and all the best for the future.
Yes, Praveen sir, your comments on this.
Yes, no comments.
Okay, there is a question, Dr. Tejaswini. Have you seen the kidney size in USG?
Yes, sir. Kidney size shows atrophic kidneys. एक minute, sir.
You're talking about the first sonography or the post one?
It is a previous sonography, sir. Bilateral small atrophic native kidneys. Size is 5.6 into 3.2 centimeter.
Okay.
And now normal after transplant 9.1 into 4.3 centimeter.
Okay. Very nice. Okay, thanks a lot, Dr. Tejaswini. We'll now move on to our next presenter, that is Dr. Naina Ghadigaonkar. And her topic of presentation is role of Mustadi Kashai, add-on to Ayurveda-based blockage management therapy in management of hyperlipidemia in stable CAD patients. Yes, Dr. Naina. Dr. Naina, kindly unmute. Yeah. You have 8 minutes of time, ma'am.
Yes, sir. Thank you, sir, for giving me this opportunity to present my case. So today we are discussing the role of Mustadi Kashai add-on therapy to our Ayurvedic blockages management therapy in the management of hypertriglyceridemia in the stable CAD case patient. So we are discussing because coronary artery disease is a global epidemic. Now we know everywhere. Total plaque volume, VO2 max, DUE score are associated with the risk of heart diseases and their mortality rate also. So reduction in the total plaque volume is directly proportional to reduce the risks, and the reduction in the lipid levels is directly proportional to the reducing in plaque volume. So with the inclination of world toward herbal treatment to combat dyslipidemia or CAD, Ayurveda proves to be the time-tested formula with research studies acknowledging its efficacy. Today I am presenting the case to understand the role of Mustadi Kashai as an add-on therapy to our conventional blockages management therapy in the stable coronary artery diseases. So for that, I took one 57 years of male patient came in our clinic. So he had a previous history of MI.
Kindly put it on presentation mode.
Okay.
We are seeing only first slide.
Okay, sir, it is on the presentation.
मैम वो 64% के बाजू में जो आइकॉन है ना उस पे क्लिक कीजिए.
एक मिनट.
राइट हैंड कॉर्नर पे.
मैम नहीं तो आप शिफ्ट प्लस F5 बनाइए. शिफ्ट का बटन एंड F5. शिफ्ट एंड F5.
So can you see?
No, it's not started. एक काम करेंगे, आप पहले एक बार स्क्रीन शेयरिंग स्टॉप करके फिर से करके देखिए।
Rahul sir, if you have the presentation.
अभी आपका प्रेजेंटेशन आपने स्लाइड शो मोड पे डाला है?
अभी फिर से डाल रही हूँ सर।
ओके, सो प्रेस यस, रिज्यूम स्लाइड शो, परफेक्ट।
Okay. So, 7 months before, one patient, 57-year-old patient, Papnoi, he came to our clinic. As usual, everyone knows in Madhavbaug, blockages management is there, and he had a previous history of MI and recurrent PTC. I would say he had 3 times plasty done. Still, he has showing complaints of dyspnea and palpitation at night. And then when he checked again while his 3rd MI, then same the blockages were there and the triple vessel disease they found, and again he was advised for the bypass. But after so much of therapies, so he came to us, and we have started with our conventional blockages management therapy. For that, we have started our diet kit, reverse diet kit, IRP treatment, his exercise modification, and medicines. First, I would like to tell all the previous parameters. He was taking the Rose Day, Ecosprin, Pan 40.
No change in slide.
Sorry?
There is no change in slide. We are seeing only background hypothesis wala page.
Why it is happening? 1 minute. So can you see now?
Yes.
Okay. So his first parameter was his weight was 78.4, abdominal girth was 100. The BP was also on the higher side. Still, he was taking Concor. And he was with the allopathic medications, Brilinta, Dufalac, Concor, etc. His lipid profile was triglycerides were on the higher side and HDL was on the lower side. Still, he was on the Roste 40 since so many years, but his triglycerides was always on the higher side. When we started our therapy, with the Sampurna Hruday Shuddhikaran treatment, reverse diet kit, and monitoring exercises, and our oral medication Cat Pro with ARG Anupan, GHA Vincol, Emsprin, and for viration purpose, I took Amari oil and Anulux powder. Then regularly we were doing Sasneha Virachan, cause his triglycerides level was not coming down, irrespective his weight, he was losing weight. The TMT was showing improving parameters, VO2 max was improved, but still the cholesterol levels, especially the triglyceride levels was on the higher side only. Where I tried 2 to 3 times Virachan treatment, Sasneha Virachan with Shalmali Gruth, but still there was no improvement with proper Sansanjan Kram. So he had not responding convincingly with ongoing treatment was what was going on. So we thought for the triglyceridemia, liver is the main concern. So we would like to add something treatment for our liver detoxification. So I added a Mustadi Kashai over here. So we can see the ingredients of the Mustadi Kashai: Musta, Aragvat, Patha, Amalki, Haritaki, Bibitak, Devdaru, Gokshur, Khadir, Nimba, Haridra, Hutaj. So after Mustadi Kashai started, and we are still continuing with our therapy, diet, exercises, everything was the same, but we can tremendously saw the result in triglycerides level. Also, he has improved the HDL level over here, and we have tapered his allopathy medication. Still the triglycerides were on the lower side. His all the allopathic medications except ecosprin was tapered after this therapy. And pre and post parameters, we can see his weight reduction was there, but it was more than this weight reduction. But after a few days, he was not that much compliant to that treatment. So his family members got COVID. So there was a dietary issues. So he again put 2 to 3 kgs. The abdominal girth has reduced because the exercise part was there continuously and monitoring was there. And we can see the plaque reduction 40% in his plaque 1, plaque 2. And we can see the calcium plaque has improved here. So we can say the plaque is also stable. And we are lowering his chances of MI over here. So that is a good improvement we can see over here, and also in the cholesterol. So with our conventional therapy, I did the Mustadi Kashai. In hypertriglyceridemia was associated with subclinical atherosclerosis and vascular inflammation, and Mustadi Kashai was helping me with the vascular inflammations also, and like Lekhan Chikitsa to reduce the triglycerides. Mustadi Kashai has anti-inflammatory properties. HDL was increased there, and it increases the lipid metabolism. So the cholesterol was on the lower side. So we can see the good results in this patient. So I would like to tell the Mustadi Kashai has a Aragvad and Triphala, which are doing Vatashaman here, and they are HMG CoA reductase inhibitor in action. So it helped me over there. And the Patha and Gokshur was to reduce the clade because it is the Santarpan Vyadhi. So we need to reduce the clade over here. And Aragvat, Kutaj, Patha, Nimba, Khadir, Haridra, Daru Hadridra, as we know, they are Medohar. They act on Meda Dushti. So all these contents help me over here to reduce the Medoro and Santarbajan Janya Vyadhi, so which is a CAD. So conclusion, this case reports can be used as a pointer to state that Mustadi Kashai Ayurvedic treatment can be effective tool for reduction of hypertriglyceridemia. Further standardized trial are required on large scale to demonstrate its efficacy and to understand the mechanism. Thank you.
Super presentation, Dr. Naina. Superb. Rahul sir, your comments on this, please.
It's a very noble topic and a very novel product that you have used. I hope your senior team must have been aware of what product you have used for the triglyceride management. Second, my basic, what I feel from your presentation, the Mustadi Kashai that you have used in your patient, is it the only Mustadi Kashai who is effective enough in management of triglyceride, or the allied treatment or the allied effort you must have asked your patient to put to manage the triglyceride level? It's still a question. I can understand that with a single case study, we cannot come to the direct conclusion whether the Mustadi Kashai is the only remedy here for the management of triglyceride. So we may need additional cases, as you rightly mentioned. But what I suggest is triglyceride management. When it comes to triglyceride management, it is all like Mustadi Kashai may not be the only treatment. What I feel here. Otherwise, this presentation is good, right? The novelty wise, no question at all. But I think we need more cases in the future to come to any major conclusion point here. That's it.
Sure.
Praveen sir, your comments on this, please. Okay, there is a question. Mustadi Kashai, what is the Rogadhikar, or which part you have used?
Rogadikar means in Mustadi Kasha is for the made any Sandarpanjanya Vyadhi, or we can say diabetes also, in hyperlipidemia also, in weight loss also we can use Mustadi Kasha. And for this patient, I have actually tried n number of things. I would say we have tried Sadhya Virechana, Sasneha Virechana, dietary changes, of course, with the reverse diet kit. And counseling also we done, because of any stress or something, there may be the inflammation, and because of that maybe the triglyceride increasing. But everything was tried, and since I was not getting the results in triglycerides, so we put with that thought, we tried Mustadi Kashay, and it gives me a result.
Right. And what was the dose and Sevan Kal?
10 ml BD after meal with warm water I have given, because he was already on the Emspreen, which is anti-inflammatory, GHA, CatPro, everything was there. But with that, for triglycerides, I did this add-on as an add-on therapy.
Okay. And this coronary artery blockage assessment was done on CAG or CTA?
CTA, sir.
Fine. Super presentation. Now, doctors, we will move on to our next presenter, Dr. Sangeeta Jain, on the topic of diabetes reversal. Dr. Sangeeta. Yes, I'll spotlight you, Dr. Sangeeta. Can you please share your presentation?
जरा एक मिनट आओ ना.
So, Dr. Sangeeta, you're on screen. You can go ahead and start your presentation.
The screen is visible.
Yes, it has started.
Yes.
It is not on slideshow mode. Can you put it on?
Slideshow, 1 minute.
Yes, you can look at the first. Okay, that is also good. Click on that slideshow button, right? And from beginning, the first button from the left. Not online, cancel that. Click slideshow again, and then you can present. Click on slideshow.
1 minute. Yeah.
Perfect. It started.
Okay.
Hello, I'm audible?
Yes, ma'am, perfectly audible. You have 8
Okay.
minutes of time.
Yes, sir. Yeah. Good afternoon, everyone. Myself, Dr. Sangeeta Jain, Chief Consultant, Madhavbaug Mulundist. Today, my topic is role of goal setting in diabetes reversal. So just before starting my topic, I will just give you an overview of diabetes. Everyone knows what is diabetes. Diabetes is a chronic progressive condition where a person is not only affected physically, but psychologically also is affected, and eventually it affects her death ratio also. And globally, if we see epidemiology of diabetes, we are seeing every year 1.6 million deaths are related to diabetes. And both diabetes and depression have been considered as a public health issue, each of them affecting 350 million people worldwide. Hence, I took this topic. The prevalence rate of depression is more than 3 times higher in the diabetes patient than general populations. So what are my aims and objective behind my study was to study the epidemiology, to reduce the risk factor related to diabetes and depression, to reduce the mortality, morbidity, to remission of diabetes, and keep the patient medicine free and educate him for the future healthy lifestyle. So what are my contents? Like I have just briefed you the case study, assessment, treatment, patient monitoring, discussion, and conclusion. Moving forward, about the patient, a 38 years male patient approached me with the complaint of frequency of urination, indigestion, dizziness, loss of weight, depression, and loneliness for the increased HbA1c with the 11.1. When he came, he was unemployed. Actually, before he was ex-office executive
But when he approached me, he was unemployed and with a lot of family stress. I've just briefed the history of family. In 2012, his mother expired, and in 17, he got an TB. I have just related this because what were the causes behind the depression? He was having MDR TB, and in the same year, in the December, he was divorced. In 2018, then he was detected with DM. In 2019, he completed AKT, but his sugars were not coming under control. And in 2020, a second event went in his life that he lost his father also. After the 1 month, he joined Madhavbaug he approached me for the control of sugar. After assessing his history and family history, his mental status, and his investigations reports like HbA1c, fasting TP, I came to a differential diagnosis, which were AKT-induced hyperglycemia, stress-induced hyperglycemia, and diabetes mellitus. Eventually, the diagnosis which I noted was uncontrolled diabetes type 2 mellitus with the depression in known case of treated MDR TB. The line of treatment which I planned was a normal Madhavbaug therapy, which I approached with the Panchasutri Chikitsa, which involved 800 calorie diet, Panchakarma, continuous monitoring, drug tapering, and exercise and stress management. The Panchakarma which I used were our CDC therapy, that is comprehensive diabetic care therapy, which includes Snehana, Swedana, and Basti. And diet, I will discuss further. What I did in regular patient monitoring was I used MIB Pulse app, which gives me this parameters. And on day one, when he approached me, HbA1c was 11.1. And in the same month, after 20 days, when I did his HbA1c was 4.6 with the OHA. Then I started tapering his OHA, and then it came to 5.0, 5.2. And to 2020, he did first GTT, which was normal. And again, I did his second GTT in 2021, which was again normal. And in 2022, it was again, now it is again planned. So what special investigations I did in this patient was HbA1c, which was monitored for the first 3 months when he joined Madhavbaug in September 2020. The chart is given over here. BMI was 23.6 now, which is 20.98 in 2020. OHA, when he came with, was 4 OHA he was taking. At present, he is not taking any OHA. His mood was very sad and energy level was only 10%. His mood gradually started improving. Allopathic medicines I have written over here. Those were Gluformin M1 500 and Astromed G1 mg, which was on day 1. At present, he is not on any medication. Ayurvedic herbs which I used was H8 AVPC, Pyloin, Gruth, Madhoprash, Rhinoma, Diaphragm Plus, Sunrise Breakfast, Madhav Shakti Atta, Amari Oil, and Goodilex tablet was added later on. At present, patient is only on Goodilex tablet 1 BD. Now the case discussion. When patient approached me after noting down history, I noted that patient was actually depressed a lot, and eventually I enrolled him for diabetes reversal program. The first thought was only Prameya diet kit to be given, but looking at his history, the thought of Prameya diet kit didn't work on this patient, and hence the line of treatment changed. And what worked in this case was goal setting, Madhavbaug Panchakarma therapy, portion control diet, which was not Prameya diet kit but sunrise breakfast along with Madhav Shakti Atta, along with strength training exercises and repeated counseling. What was goal setting given? The goal setting given to this patient was to reduce the blood sugar and his symptoms of frequency of urination and dullness, which was my first goal, which was given to him for the 15 days. Later on, I said him the first target would be to reduce, second target will be to reduce HbA1c and dependency on concomitant drugs, which was achieved within a month, and then to reach the GTT test, which was achieved within 60 days. And finally, then I find out what was the reason behind to live happy, because he was very lonely. He was not having anyone along with him. His all family members had left him because he was MDR TB, so he was living alone. Then fourth goal was given him was to maintain this non-diabetic stage and educate the society. Therapy interventions were as below. Like as I said, I used the comprehensive diabetic care therapy, which improved the blood circulation, reduced the intramuscular fat deposit and insulin resistance. It promoted regenerations of islet cells and significantly decreased the sugar levels. As the back history of this patient was MDR TB, so I used WSSP, that is whole body Snehana. Whole body Sastishali Pinda Swet, which was used to improve muscle strengthening and regenerate and regenerate the body. to come out of that MDR TB. Muscle stiffness and muscle loss was there. And again, another thought was that he was having a lot of stress and depression. So Shirodhara was done with the Jatamansi Kwar, which helped me to soothe and calm down his forehead muscles, stimulating neurotransmitter and stabilize the mood and relax the mind. Also, diet and counseling played a very big role. In this case, Prameya diet kit was not used because there was no family member at home. So how he would cook was one of the major concern. So I gave him sunrise breakfast with the Madhav Shakti Atta. This helped me in the reduction of sugar level and maintain the nutritional value. Hence, the stress related to increasing sugar was reducing, feeling of happiness for developing. Repeated counseling sessions were done for this patient 2 times in a week and whenever the patient was in the need, to help him with the emotional escape and come out of the psychological difficulties. Also, I have guided him how with the simple recipes, tips to reduce his cooking stress. As we all know, depression and diabetes, this both are bi-directional cycle, or it's a vicious cycle. Both are affected each other. Eventually, reduction in sugar reduce the stress, and eventually reduction in depression helped me to reduce the sugar, and successfully I was able to break this vicious bi-directional cycle. What was the conclusion behind this? That the remission of the diabetes can be achieved with the proper goal setting and modifying the lifestyle, eating Madhavbaug Panchakarma therapy and exercise daily, and keeping healthy mind for the lifelong. Also, successful breaking of vicious bi-direction cycle of diabetes also helped me to reverse the diabetes. I could make him freedom from all the allopathic medication. This increased survival rate and positive approach towards the life. What was the uniqueness of this achievement? That now patient, when he approached me, he was unemployed, and now at present, though he was in depressed state due to TB, but at present he is working as a counselor for TB support treatment. Patient is again ready for the third GTT event for after 2 years completion of the therapy. Hence, I was able to improve his quality of life. References which I took with the NCBM, PubMed, and WHO, IDF, International Diabetes Federation. Acknowledgement, my senior doctors, my clinical team, and my other colleagues. Our team, thanks.
Yes, fantastic presentation, and the slides were just awesome, Dr. Sangeeta.
Thank you, sir.
We have some questions. Was this case a pulmonary tuberculosis case?
Yeah, it was pulmonary tuberculosis case.
Okay, one of the doctors has asked about what is sunrise breakfast kit.
Okay. As in Madhavbaug, we have a Prameya diet kit, which is an research-based diet kit for diabetes reversal. We have post-diabetes reversal breakfast kit at our clinic, which is named as Sunrise Breakfast Kit, which is again having a portion control, high protein breakfast, which each packet is packed with the 30 gram of atta to prepare the breakfast in the early morning, because major mistakes what people make in food is in the breakfast and meals, like lunch and dinner. So I have adjusted him with that. I have helped him with that, how to make the dinner and how to go with the breakfast, because usually our Indians take breakfast of breads, butter, poha, which are very high in calorie and which I don't wanted to give that patient.
Right. Thank you. Rahul sir, over to you. Please unmute.
Let me unmute.
Yes.
Dr. Sangeeta, this is the best presentation since morning I have. I really, the words will be not be enough to discuss about your presentation, but let me tell you, this is the very different way that you have presented how a diabetic patient should be managed, because goal setting is a very essential, and it is essential for each and everyone. So here you have shown a very different way of management of a type 2 diabetic patient, and very good, and best of luck.
Thank you, sir. Thank you.
Praveen sir, your comments?
Very good and nice presentation. Keep it up, Dr. Sangeeta.
Thank you, sir. Thank you very much.
Right. So thank you, Dr. Sangeeta. Now we move on to our next presenter, Dr. Parvez Shikalgar, and the presentation topic is effect of Trabeculis terrestris on NT-proBNP. Yes, Dr. Parvez. Yes, Dr. Parvez. You have been
Yes, you are audible.
You can share your screen, doctor.
Yeah.
I'm happy to see all the other delegates. They are sharing their experience about the presentation. That means no one is sleeping over there. So everyone is awake and they are listening and they are contributing positively in this National Ayurveda Cardiology Symposium. So thank you everyone for making this event very positive and fruitful.
Yes, go ahead, Dr. Parvez.
Dr. Parvez, can you keep this on slideshow? Presentation mode.
Dr. Parvez, you can click on the top. There is a slideshow button next to home.
Next to
animation.
Home
Animation.
insert design animation slideshow.
Or you can press Shift and press F5 button. Shift and F5.
Okay, F5. Is it okay?
Probably you'll have to stop the screen sharing and reshare it because probably you have only shared one window.
Dr. Parvez, there is a slideshow icon just besides the 70% screen ratio at the bottom. If you can just click that slideshow button. Yes.
Now?
I think you are on the slideshow mode. It is going to take a few seconds.
So we have some very nice live audience in today's session. Before Parvez sir shares his screen, and excellent participation is going on from all the doctors. Thank you so much for your live interactions.
I'm seeing some of the professors from the various Ayurveda colleges. They are also a part of this event.
Yes.
Dr. Parvez, you can restart your screen sharing. It will become better now. Put your slide on the slideshow mode.
Thank you. Thanks a lot.
Yes, Parvez sir. Yes, so now you've started your screen sharing. Just click on the slideshow button so that your presentation will be on presentation mode.
Yes. Okay. Dr. Parvez, I think your slideshow seems to be on, but you're sharing a wrong screen. Can we do one thing? Can you do one thing? Can you click on share screen button below and go to advanced tab in share screen? Go to advanced tab in share screen. There you'll have the option of PowerPoint presentation.
Share screen. Next.
See advanced tab. In the advanced tab, you'll see PowerPoint presentation.
Yes, PowerPoint as a virtual background.
Yes, so you can select your screen from there. You can select your PowerPoint presentation.
Yes, Dr. Parvez, I'm sharing the presentation on behalf of you. Yes.
Yes, meanwhile, by the time Dr. Parvez shares his screen, I will like to know the feedback from all the doctors who have joined today's symposium. Can you just type this feedback by the time Parvez sir starts its
Yes, I hope it is visible now. The PPT is
perfectly visible.
Yeah. Dr. Parvez, go on.
Yes.
We have 8 minutes of time, sir.
Yeah, good evening all. Myself, Dr. Parvez Chikalgar, working in Madhavbaug, Dombivli, Palau MIDC branch. I'm working with Madhavbaug since from last 10 years. Today's my topic, Next slide. Next slide, please. Yeah. Today's topic for presentation is efficacy of tribulus terrestris on NT-proBNP in stable ISG plus CHF patient having TOI less than 10 minutes. Next. Reason behind opting this topic is the death ratio of CHF patient in 30 days is a 10.4%, and after 5 years it jumped to 42.3%. So this is a very crucial topic, and for this purpose only we have selected this topic. Our next role is to create the awareness of this patient, and we have to search some alternative treatment for this. So on this basis, Ayurveda is one of the best alternative treatment on the improvement of CHF patient. Next slide. Next slide, please. Our aim is to study efficacy of tribulus terrestris, that is a Gokshur, in chronic heart disease by study their NT-proBNP records. Next slide, please. Our objective is impact of Gokshur, that is tribulus terrestris, in improvement of NT-proBNP as well as HSCRP. Next. Our methodology, the observation period is only for 30 days. Requirement days 30 days plus minus 10 days. Number of procedure, that is a panchakarma we did, that is minimum 7. Techniques we use in panchakarma, that is Snehan, Svedan and Basti, and time required for panchakarma is approximately 1 hour. Next slide. Our methodology includes some blood investigations like NT-proBNP, HSCRP, as well as other parameters like VO2 max, BMI, abdominal girth. Then some oral medicines we use, that is Gokshur, Haridra and Amlaki. So our main drug of choice is Gokshur in this. Next slide. And for 1 month we give the diet on high ORAC value with high protein as well as less carbohydrate. So for 30 days we keep this diet for this patient. Our main procedure is ischemia reversal program. In that we did Snehan, Svedan, Basti. Snehan, that is external oleation for 35 minutes to 40 minutes with the lavender oil, and normally it is the procedure is centripetally towards heart. Second Svedan, that is passive heat for 8 to 10 minutes. After that, relaxation for 3 to 4 minutes. We use herbs like Dashamul and temperature that is approximately 40 degrees. During this procedure, patient will lie down in the sedation box in the supine position with head position outside. In Basti, we did Basti with the Gokshur, Haridra and Amlaki. Some root cause information of Gokshur, Haridra and Amlaki is Gokshur is a very good in improve intrinsic and extrinsic nitric oxide, as well as it is a very good in coronary blood flow. It is very nice in diuretic, hypolipidemic, cardioprotective, analgesic, antispasmodic, as well as curcuma longa is hypotensive, antioxidant, anti-inflammatory and anticoagulants. Even Amlaki plays very important role like hypolipidemic, cardioprotective, antioxidant, and it is protect from oxidative damage to the tissue. Next slide, please. So first day and last day improvement of the blood reports like NT-proBNP. On the first day, NT-proBNP was 2224, and after 30 days exactly, it come down to 901. Next slide. Second is a HSCRP improvement. On first day, it was 17.98, and on 30 days, after 1 month, it come to a 3. Next, improvement in VO2 max. First day, it was 7, and after 30 days, patient jump to 24. Next slide. Some good improvement is shown in EGFR also. It was 68 previously. After 30 days, we check it and it jumped to 89. Next, abdominal girth also reduces from 113 to 106. Next.
Dr. Parvez, last 2 minutes left.
Yeah, body mass index reduces from 30 to 28. Next. Some medicines was there, allopathic medicine was there with this patient, and we have reduces that allopathic medicine. Only one antihypertensive is going on currently. Sooner we will also work out on that. Our basic conclusion is that Ayurveda based non-invasive IRP treatment can definitely work out on NT-proBNP also. Effective management of the CHF and ISD patient, we can definitely come out with this. NT-proBNP, HSCRP, VO2 max improvement, we can come out with IRP treatment also. Improvements in reduction of BMI, abdominal girth, and decreases the dependency on the allopathic medicine. This is our main role. And improvement in the quality of the life. This is our second target. So that patient can survive without medicine with less problem. These are some references are there. Thank you.
Excellent presentation, Dr. Parvez. Rahul sir, your views on this?
This case, superb. Nice to see the patient having NT-proBNP levels such high, and you have helped him to reduce down his NT-proBNP levels. And what is this is a very basic question that I'm having. What is a relationship between the NT-proBNP and the patient and the treatment that you have given? I didn't understood the rationale or the mechanism of action, how your treatment has helped patient to reduce down his NT-proBNP.
Yes, definitely. Patient was ischemic as well as in chronic heart failure. So both symptomatically he was present. So we have worked out on his heart with the help of diuretics. So Gokshur is the best in diuretic, and Gokshur indirectly help heart to get pumped more, and we can come out with the heart failure reactions, with heart failure results with the help of Gokshur. So Gokshur, I think, plays very important role, as well as even oral medicines also we have given Gokshur dominating. So that's why I think Gokshur plays important role for NT-proBNP, for HSCRP, even heart failure, even in future also maybe in CAD, Gokshur will again play very important role.
Very rightly mentioned, Dr. Parvez, because Gokshur is diuretic as well as it is anti-anginal as well, anti-ischemic as well. So especially the condition where is a LV dysfunction, and that is the reason why there is a raised NT-proBNP. Your rationale was so correct, and it was very bang on. This is the reason the NT-proBNP reduction in NT-proBNP we have achieved with help of a diuretic action of a Gokshur, and as well it is a dual in action Gokshur. This is the reason your patient has also shown improvement in the ischemic heart disease as well. So superb, and congratulations to you, Dr. Parvez.
Yes, we have a couple of questions, sir. What was the percentage used of Gokshur in comparison to other medicines?
60% Gokshur we have used.
Superb.
60%. Okay. One of our doctors has also asked, what was the method used to assess NT-proBNP?
It is a lab blood investigation.
Okay. One of the doctors has asked why we have used high protein diet. Won't it affect the kidneys?
Yeah, very good question. not very high proteins. Okay, we have balance, but we have reduced carbohydrate. That is important. We have to maintain the strength as well as the potential of the patient's health, as patient is in IHT as well as in CHF. So some amount of protein, दाल के अंदर भी प्रोटीन ही होता है. Okay, so some amount of protein we have to advise to give a strength to the body muscle.
So you mean to say, as compared to the carb, you have you means keep the portion of a protein higher.
Yes,
it's good. Thank you, Dr. Parvez and Dr. Omkar. I think we should move to the next presenter.
Yes, thank you, Dr. Parvez. Our next presenter is Dr. Meenal Patil, and her topic for today is HFRT with Langhan. Dr. Meenal?
Yes, sir. Can I audible?
Yes, ma'am, you're audible.
Can you see my screen?
Yes. Just a moment, I'll spotlight you. Yes, ma'am. You have 8 minutes of time. Go ahead, ma'am. Best of luck.
Okay. Myself, Dr. Meenal Patil, and I'm working with the Madhavbaug since last 13 years. Today's my topic is role of Ayurveda-based heart failure reversal management therapy, SHS, and Langhan Chikitsa and fluid retention CHF patient.
Ma'am, your voice needs to be a bit more. Yeah.
Now, is it okay?
Better.
Okay. So chronic heart failure is a progressive syndrome that results in a poor quality of life for the patient and places an economic burden on the healthcare system. Despite advances in the control of cardiovascular disease such as myocardial infarction, the incidence and prevalence of CHF continue to increase. Chronic heart failure is a global epidemic which is commonly associated with fluid overload or fluid retention. Maximum aerobic capacity, VO2 max, ejection fraction, and NT-proBNP are associated with prediction of risk of heart failure. So any modification in these factors can prevent risk of heart failure. The present case study was conducted to understand the role of Langhan Chikitsa in CHF, and Ayurveda-based heart failure reversal therapy is management of low VO2 max, fluid retention, high NT-proBNP, and low EF patient. My case is 68-year male patient joining Madhavbaug in 2019. History of CHF, known case of pre-diabetic. He visited the clinic with complaint of DOE, grade 3, chest pain during exertion and weakness. His BP was 130, 143, 98, and rest of the parameter as given below. The allopathic medicines was Electon, Dieter, Ivemac, and shown in the slide. And all medicines taper down within 2 months of the treatment. 2D echo report was his 2D echo report was 20 to 25% ejection fraction on day 1, or the grade 3 diastolic dysfunction. His diagnosis is CHF. Treatment given to him is a SHS Panchakarma heart failure reversal therapy. In Snehan, we use ARJ oil with Nirgundian, Dashmul, and Til Tel. In Sweden, we gave a Dashmul, Quat, Basti, ARJ, Arjun, and a Pundarnava extract. In diet, I given him a 800 kilocalorie for 3 months, low carb, high fiber, and proteins, low GI protein control diet. Self-monitoring, weekly twice, blood pressure, heart rate, and BSL. Exercise, daily 30 minutes walk, strength training, pranayama, and meditation. Oral medicine given Punura, ARJ, granules, Amaryl, and the rest of the according to its symptoms. Pre and post parameter as mentioned on the screen. BP was on the day 1, 143, 94, and after 3 months, 119, 69. This is a special case of mine, which is this patient came again to me after 1 year of a treatment. And he shows the weight gain again from 66.8 to after 1 year, he was on 71.7. And his heart rate was 135 at that time. His BP is again 134, 80, 84. He's having a pedal edema and fluid retention. After the 30 days, again after 1 year, I give him a treatment with NBM, and after that shows the tremendous results. His heart rate was stable on 85, BP was 100/60. His weight reduced down up to the 64.3 kg. In the 2D echo report, as I shown, his 2D ejection fraction previously was 20 to 25%. Then at the in the last 2D echo report, it was 36.3. NT-proBNP I did before the treatment, it was 9,063, and after that it was 2,407. The discussion part, congestive heart failure doesn't mean your heart has stopped. It means it's not pumping blood the way it should. When that happens, blood and fluid can back up in your body and make it harder for you kidneys to flush out sodium and water. That can make you hold on to too much fluid, which causes swelling. Hence, it should be prudent to explore not newer but treatment options with high efficacy and a few safety concerns. Ayurveda is a potent and viable alternative to standard therapy in the management of CHF with fluid overload, that is Langan. In the present study, I have combined 4 Ayurvedic procedures, as I mentioned before, Snehan, Swedan, Hrudaydhara, and Basti, which has cardioprotective, anti-inflammatory, diuretic, antihypertensive, and improves the endothelium dysfunction, thus reduces the hyperactivity of sympathetic nervous system. Arjun, Nirgundi, Dashmul are used in a Basti, which offer benefit of CHF by improving blood circulation to the heart tissues and improve strength to pump the blood. In the combination with it, after 1 year when he came back to me, I introduced a Langhan Chikitsa for 48 hours. Langhanam Param Aushadam, Shutrut Nigraha. Restricted intake of liquid or water result in a pacification of kapha and pitta dosha due to the depletion of their sources, that is Jalamahabhut. By restriction of a food, the Agni, digestion and metabolism improve first, and it hasten the process of normalizing dosha equilibrium. Restricted intake of liquid, water, and the food is given the result of the decrease in Jalamahabhut, and patient's weight is dropped down up to the 4 to 5 kgs within 48 hours. The therapy is applied to the reduced and abnormally increased body component, Medha and Kapha Dhatu, and bring it back to normal level to maintain the equilibrium. Based on classic Ayurvedic test, I combined Langan, 800 kilocalorie low carb diet to control vascular inflammation changes, to treat endothelial dysfunction, and lifestyle modification helps in eradication of lifestyle related disease. The primary endpoint in this case study was reduction in NT-proBNP value, increased in VO2 max. In this case, indicate that the improved exercise intolerance capacity in this study, both VO2 max and ejection fraction were significantly improved. Study shows that improvement in NT-proBNP value and VO2 peak are associated with better prognosis in this patient, with reducing cardiovascular mortality and morbidity. And my conclusion is the present case study revealed that Langhan Chikitsa with 90 days treatment with low carbohydrate diet and heart failure reversal therapy caused significant improvement in NT-proBNP, VO2 max, ejection fraction, BMI, systolic diastolic BP, heart rate for patients suffering from CHF with fluid overload and low ejection fraction. Thank you.
Thank you, Dr. Meenal. Super presentation. Dr. Rahul, over to you.
Meenal, very nice presentation and very commendable job that you and your team has done, and you are helping patient from taking them out from a condition like LV dysfunction, and it's not a short-term effect that you have given to your patient. You followed your patient for more than 1 year, and that is the more appreciable thing that you and your team has done. So congratulations and all the best for the future.
Thank you, sir.
Yes. No questions as of now, then we'll move on. Thank you, Dr. Meenal. Okay, just a small question has come. 48 hours of strict Langana. Just a minute. If you can see the chat box. Yeah. Very glad with the results and your presentation too. Definitely, I will include this therapy in my practice. Thank you so much, Dr. Sandeep. Yes. So we move on to our next presenter. Our next presenter is Dr. Archana, and her topic of presentation is visible effects in CAG of IRP treatment and in CAD patients. Okay, visible effects in CAG. Okay, of IHD and CAD patients. Fine. Okay, Dr. Archana. Dr. Archana Shikalgar. Yes, ma'am. You have been spotlighted. You can start your screen sharing.
Hello, sir.
Yes, you need.
Am I audible?
Yes, ma'am. Take it on the first slide and then use the slideshow method.
Just a minute.
Perfectly fine, ma'am. You have 8 minutes of time with you.
Okay. Hello, everyone. I am Dr. Archana Shikalgar. I am presenting a single case study. First of all, I am thankful to Madhavbaug and Rohit sir for giving me this big opportunity and this big platform. Now moving to case presentation. The contents of presentation are: first we will discuss about research question, then case details, then the diagnosis done by us. Fourth is we will discuss about treatment, and then discussion about the whole process, how patient get results. Research question is there any role of Basti Chikitsa in atherosclerotic plaques? So patient directly came with angiography report, and we have decided about treatments. So first we will discuss about patient. 63-year male came with complaints of chest pain, palpitation, knee pain. He is known case of CAD, DM2 and ischemia, IHD we can say, ischemic heart disease. His weight is 48 kg. BMI is 18.99. Abdominal girth is 74 cm. First day BP was 120/172 mm of Hg. Pulse was 63 BPM. Blood sugar levels was 135 mg per dl and HbA1c was 6.2. So we can see patient was crucial.
Dr. Archana. Okay, I feel there is some technical issue. Rahul sir.
That is plaque stabilization therapy, that is Panchakarma is used along with main treatments. Sir, unstable internet. After treatments, we can see the reports. Image, sir, Rahul sir, can we see the images properly?
Yes, we can see.
Yes, doctor.
Okay. So comment we can see in first, that is in before angiography, there was DVD. Advice was medical management aggressively karna chahiye tha, and PCI was advised to LAD and diagonals. Now in second, that is latest angiography mein non-obstructive CAD tha, and management was with optimal medical treatment. So we will go to reports in detail. In first angiography was done on 14th of April 2021. Left main artery was normal. In second angiography also it was normal. We can say see in LAD there are it was calcified, but now it is not calcified, and many blockages were reversed or reduced, we can say. In circumflex artery also there is reduction, and RCA was dominant. There was 40% plaques, and now there are minimal plaques. So case was actually so much simple. Discussion, main thing I want to discuss is we used that high ORAC value diet. It gave result, and ischemia reversal program, that is the Basti gave main result to our patient, Gokhru or Gokshur. Guna is means we can discuss its guna. Rasa is madhur, vipak is madhur, virya is shit, guna is guru and snigdha. Karma of Gokshur, we are seeing that it is Vrusha, Shothahar, Mutral, and then Vatanu, Bhut, Bruhan, and Basti Shodhan. So we took main important its guna, that is Shothahar. Why? How it helped and why? In Basti we have took help of Gokshur, Haridra, and Amalaki. Gokshur is diuretic, as Parvez sir said. It helped a lot in these patients. Also Haridra. Many gunas are there, but we took main guna as anti-inflammatory and Amalaki is antioxidant. The total Basti quantity is 100 ml. Like other patients, in this patient, there is no increase in NT-proBNP. It was done on 25th of November 21. So NT-proBNP was 58.6, means he was not in chronic heart failure. We have took stress test before also it was negative and now also it was negative. But symptomatically it got very good changes. He completed that modified Bruce protocol, means 15 minutes he have completed with no symptoms. He is GTT negative. Treatment information with product details. So we can say.
Come to the conclusion.
About what, sir?
Come to the conclusion, the last part of it.
His 4 medicines we have stopped: Nicoran, GTN Sorbi, Ecosprin Gold, and Corbis we have stopped according to means monitored way and with our protocol within 8 months. The main conclusion is high ORAC value diet helped him a lot. So according to Ayurveda, we have considered it as Shoth, and Shoth means aging, fast aging. So we have stopped it with our products, that is Avra, we can say Rajma, Soya, ya fir Kokum, and nut mix bar. So that's all. Thank you. My team is, I am clinic head Dr. Archana, and my compliance doctor is Dr. Meenal, and whole team helped me a lot in getting good result from this patient. Thank you, sir.
Thank you, Dr. Archana. It was a fantastic presentation. Over to you, Dr. Rahul.
Very nicely presented. See, coronary artery disease, it is just not a disease, it is a social stigma. And in a common world where the tertiary care center or the surgical intervention is the only way to come out from the coronary artery disease of the blockage, and the treatment of Ayurveda, you very boldly manage your patient with all the courage. So hats off to you and your team. And when you are showing the angiography report, there is nothing to ask any question about it. The only part where I feel that could be better is how the Gokshur has helping the patient. I think that is a part of research again. What is the exact mechanism of action of a Gokshur to reverse the blockages? Because in earlier presentation, Dr. Parvez has discussed how it is a diuretic and how it is anti-ischemic. But at the same time, it is also reversing the atherosclerotic changes. So this is the part of research again, but congratulations to you and your team that you are managing a blockage is not a joke, and you did it very well. So great. All the best.
Thank you. Thank you, sir.
Thank you, Dr. Archana. Now we'll move on to our next presenter. Our next presenter is Dr. Preeti Muramkar, and her topic of presentation is case study of ischemia with high NT-proBNP levels. Yes, Dr. Preeti.
Am I visible?
Yes.
My screen is, yeah. Good afternoon, everyone. Myself, Dr. Preeti Muramkar, clinic head of Ghatkopar West, working in Madhavbaug since last 14 years. Let me correct my topic. My topic is to evaluate the effect of Snehan, Svedan, Vidyadhara, Basti, and Virachan Karma in management of heart failure with reference to NT-proBNP.
Yes, ma'am. Move on.
have to go back.
Screen is visible, ma'am.
Yeah, but I have gone ahead, so I need to go back.
Any help required?
No, could you help me to go back, please? Because I'm not able to. When I'm clicking, it's going ahead. And on the other side, if I'm clicking, still it is going ahead.
Okay. Rahul sir, if you can share the screen.
Yes, let me try.
Doctor, press page up, and page down. Can you see on your keyboard page up and page
yeah.
down? Click page up and page down.
Yeah, thank you, sir. Yeah. So my research question is, does Snehan, Swedan, Hridayadhara and Basti works in heart failure to improve NT-proBNP? I think my mouse is not working.
Just click anywhere on the screen. Just click anywhere on the screen.
Okay.
Just click anywhere on the screen. Leave that right click. So you have pressed right click. Just click left click on anywhere on the screen.
I think it is something
Perfect.
wrong with
Now
this.
it will move ahead. Don't click right click.
Yeah. Sorry for interruption. So patient came to me on 16 December 2021. History with alcoholism since 10 years, smoking since 14 years, high consumption of junk food and fast food, no exercise, frequent night outing. Age 34, sex male, occupation actor, Prakruti, Pitta Prakruti. Patient's complaints were breathlessness since 2 to 3 weeks, heaviness in chest since 2 weeks, Dewey grade 3 since last 15 days, bloating on and off, gases, bilateral edema on feet and face. Vitals before treatment, his weight was 67.8, BMI was 28.4, abdominal girth was 101, BP 100/70, pulse 94 per minute, SpO2 98. After treatment, we can see the weight reduction near about 6 kg, BMI 26.4, abdominal girth 95, BP 1110/80, pulse 86, and SpO2 99. Investigation advice was CBC, ESR, KFT, LFT, NT-proBNP, and 2D echo. Now you can see on 18/12/2021, his NT-proBNP was 18,943. Okay, so my diagnosis was heart failure with evidence of high NT-proBNP. Treatment advice was heart failure reversible treatment, 7 Panchakarma treatment, which includes Snehan, Swedan, Hridayadhara, and Basti. Kit used for Panchakarma was HFRT kit, which includes ARJ oil 120 ml, Dashmul Quartz 15 ml, and ARJ Basti 80 ml. ARJ oil contains are Arjun, Nirgundi, Dashmul, and Til oil. ARJ oil acts like negative chronotrope and positive inotrope. It helps to reduce heart rate and strength of muscles contractility. Anti-inflammatory, anti-hypertensive agent, improves endothelial dysfunction and calms down hyperactivated sympathetic nervous system. Dashmul Kada, which we use for thermal vasodilation, helps to reduce congestion and load on heart, improves elasticity, endurance, and health of blood vessels. ARG Basti, which includes Arjun extracts and Punanava extracts, helps to reduce overload of heart, because Punanava works as an anti-diuretic and anti-inflammatory. Phenolic compound in Arjun like sturminic acid, arjunalic acid, and glycoside argentine are cardioprotective, which improves blood circulation of heart tissue through Basti. ARJ oil specifies Vyanavayu, increases bala of heart, and also improves elasticity and health of blood vessel, act as an excellent diuretic anti-inflammatory. Hridayadhara helps to reduce intercostal muscle activity. Oral medication on day 1, allopathic medicine was included as Asmarda twice a day, Evabrate 50 mg twice a day, Ecosprin 150 OD, and Lasik 10 mg OD. We have given Catpro 2 TDS tablet ARJ after every 4 hours. ARJ Arjun, as we all know, is a Kashaya, Lagu Ruksha, Shita Virya, Katu Vipaki, Kapha Pitta Shamak, and Vidya. Is an excellent cardiac tonic. Herbs with its Dhatu Gamitva to Meda, Rakta, Asti, and Shukra. It improves tone of blood vessel, rise Kleda and Meda, and breaking Samprakti of Hriday Roga. COQ10 in Arjuna supports the heart energy output and enhance overall energy levels and boosts antioxidant levels. Thus, it is an ideal choice of drug to treat CHF, IHD, HTN, CAD, and dyslipidemia. As we can see, Arjun extract, means Arjun tablet has Arjun 500 mg in each tablet. Cat Pro, the contents are Arjun, Punarnava, Vacha, Patha, Twat, and Vivitak. As we have seen Arjun and Punarnava. Vacha is hypolipidemic and neuroprotective. Punarnava is a diuretic and reduce edema, pleural effusion, and cardiac cup. Dalchini is a cardiotonic, vasorelaxant, and anti-anginal. Patha and Vibhiti acts as an anti-inflammatory. As we have seen in patient history, patient was alcoholic, smoking, was very stubborn, and because of his profession, actor, he was not ready to follow diet book. But we have given him a diet with low calorie diet, high fiber, rich in vitamin C, low carb, water intake 1.5 liter per day. Continuous monitoring helped me a lot, where we have asked his diet photographs every day. Exercise, we have asked him 6-minute walk test thrice a day because he was in such a failure stage, and just normal breathing exercise 2 to 3 times in a day on initial stage. Vitals, his family used to say every day vitals, pulse, BP, weight. So I could manage his fluid overload. That helped me a lot, and water intake. In twice a day, we used to call him to track his all vitals. So continuous monitoring played a good role to help me to give good result to this patient. Virechan Karma. Virechan Karma was given by medicated Grutapan. Sasneha Virechan was given day 1 30 ml, day 2 60 ml, 90 ml till Samyak Snigdha Lakshan seen, which was followed by Panchakarma and Sansarjan for next 7 days with Yush Peya Manda Vilepi. Mode of action of Virechan was reduce fluid overload, reduce preload of heart, liver detoxification, body detoxification, reduce heart failure condition. So after Virechan and after this treatment, we can see on 31st January 2022, his anti-proBNP level was 1912. Okay. Present medication, we have stopped his all medication like Asmerda, Evaprat, Lasix was stopped. Only Ecosprin 75 is ongoing, and Ayurvedic medicine Catpro 1 TDS and ARJ tablet 1 TDS. Patient is in our monitoring for Naujivan treatment with these 2 medicines. Thank you very much. So my conclusion is, and HFRT definitely helps to reduce fluid overload and anti-proBNP.
Yes. Thank you so much, ma'am, for this fantastic presentation. Over to you, Rahul sir.
Yes, I would rather say the experience of 14 years in the field of clinical cardiology was visible in your presentation, ma'am. Absolutely superb presentation. And HFRT, that is the heart failure reversal therapy. That means again, it's a polyherbal combination of Ayurveda based product and the Panchakarma therapy, a non-invasive therapy with a very simple herb that you have used, and still it is showing a significant improvement in the LV dysfunction, and very commendable job actually. And since morning I am seeing a 3rd or 4th case where you have just used the normal Ayurveda herbs, and you have achieved superb results, because as per my knowledge, it took around 19 years for Novartis to develop a product like Arni, what we call a Vimada, and after 19 years they are reducing the anti-proBNP levels by using the Vimada. And we were already been having the product like Arjuna, then the Punarnava, Vivitaki, and all these products, they are showing a superb improvement. And why we need a Vimada if we are having the product like all these Ayurveda products? So superb job and excellent presentation, ma'am. Over to Dr. Omkar sir.
Yes, there is a question, ma'am, in the chat box. Why ECG was not done in the earlier phase, initial phase, and why did we move on to 2D echo directly? Was ECG done in this case?
Yeah, ECG was done in this case, and even 2D echo was done in this case. LVF was 30%. I have not mentioned because I thought in 8 minutes I won't be able to cover this. So I need to focus on the other points. So but basically, whosoever asked this question, thank you. But ECG and 2D echo all was done. Only I have not mentioned. Thank you very much.
Thank you. Thank you so much, Preeti ma'am.
Yeah,
it was a fantastic presentation. Now, last 4-5 presenters are left. So we'll move on to our next presenter, Dr. Smita Karpe. And her presentation topic is role of dietary modification in patients with dyslipidemia. Dr. Smita?
Oh, yes, sir.
Yes, ma'am. You can start your screen sharing. Ma'am, you have 8 minutes of time. Best of luck.
Visible, sir?
Visible, but just make it on the presentation mode. Yeah. Slideshow. Perfect.
Good evening, all. Myself, Dr. Smita Karpe. Since 12 years, I am working with Madhavbaug as a clinic head at Airoli Center. My topic is calorie control diet and dyslipidemia. Objective, why I choose this topic. Why I choose this topic to determine the effectiveness control diet for lifestyle management, dyslipidemic adult patients. There are many correctable risk factors for cardiac disorders. Of this, dyslipidemia has the highest population attributable risk for cardiac diseases. Because of its high prevalence and also because of its direct pathogenic association with atherosclerosis, accordingly, effective management of dyslipidemia remains one of the most important healthcare targets for prevention of cardiac diseases. Here my case details. I took here 35 adult patients, 14 were female and 21 is male. Age criteria is below 73 years old. Male are 21, female are 14. History, hypertension, diabetes, chronic heart failure and obesity history. First day first weight is, average weight is 73 kg. Body mass index is 29. Abdominal girth is 100 centimeter. Average heart rate is 90. Systolic blood pressure is 140 and diastolic 86. At baseline, day one, total cholesterol were 217. Total triglyceride levels are 206. LDL levels are 138 mg per dl. HDL is 39. Diagnosis followed as per a practical approach to laboratory diagnosis of dyslipidemia. Treatment information with product details. Oral medication, I took here Deepani and Pachaniya Medohar Dravya. Main principle is diet. Calorie restricted portion control diet I given to all these 35 patients. Includes food, high HDL levels, high HDL value food, low fat diet, food high in soluble fibers. And also I gave here Panchakarma, that is Lekhan Basti. Diet information, standard lifestyle recommendation like portion control diet with regular more intense intervention diet supervision program. Those are a vegetarian diet with increased complex carbohydrate, high fiber diet, high antioxidant diet, and anti-inflammatory diet. Eat various fruits, vegetables, legumes, nuts, soya products, and whole grain. I choose here oils low in saturated fat, high in omega-3 fatty fat, such as soybean, walnut, and flaxseed oil. Don'ts here is avoid foods high in saturated and trans fats, such as red meat, whole milk products, pastries, deep fried items. Also avoid tobacco and smoking consumption. Diet followed by my patient. Here are some pics. These are patient diet followed. 7 seeds, smoothies, and in this exercises like TheraBand exercises we practice since 90 days. Oral treatment information. Here are I took conventional and herbal drugs are being used to lower levels of serum cholesterol. Lekhaniya drugs mentioned as ganas, दारू हरिद्रा अपामार्ग पारिजात कुटकी भूनिंब रोहितक पिपली नीमपान फाइन गुडमार कारवेल्लक अर्जुना लसून and kumari shunthi maricha lavanga chitrak and vidanga. These are the dravyas for basti. Panchakarma information. The radical Ayurvedic Ayurveda Sanchodhan Chikitsa is a treatment protocol can provide the effect. Therefore, below mentioned drugs mentioned in Ayurvedic classical text used to evaluate the Lekhan Basti in dyslipidemia. In this, Kulatha, Nagvalli, Mesha Shringi, Daru Haldi, Yashti Madhu. These are the dravya I took for Panchakarma. Treatment with timeline. Lipid profile before first day and after 90 days. Here our total cholesterol is 217 and after 90 days it's 174. That means it reduced by 19.82%. 206 total triglyceride level, day first is 206 and day 90 is 121. LDL levels are 138 and day 90 levels are 113 and HDL levels are 39 day first and 36 day 90. That means total triglyceride levels are 41% reduced, LDL levels are 18.12% is reduced and HDL is 7.7. So in this I should mention that HDL levels are not raised, so that is my drawback, but all other parameters are decreased day first as compared to day 90. How treatment work? To reverse any lifestyle disorder, we need to make sure that calorie intake is less. More in order to utilize stored calories, Madhavbaug considered diet as a therapy and the most effective intervention in reversing lifestyle disorders. Oral medication administration of Medohar and Lekhaniya drugs. These drugs possessing Tiktaras, Ushna Virya, Laghu and Ruksha Guna, Katu Vipak, Vata Kapha actions helps to reduce kapha clade toxins from body and scraps out lipids, fats and subsides prameha. Lekhan Basti being a Tikshana formulation, the treatment modality of Lekhaniya Basti is aimed basically apatarpan of the body. The Basti is the fastest apatarpan, helps to scrap out fat deposits, reduce overeating and weight gain, also helps to improve fat metabolism. Calorie restricted portion control diet is the main principle in dyslipidemia. Replacement of saturated by polyunsaturated fatty acids in the diet may lower serum very low density and low density lipoprotein concentrations because the liver preferentially converts the polyunsaturated fatty acids into ketone bodies instead of into very low density lipoprotein triglycerides. Thus, unlike saturated fatty acids, polyunsaturated fatty acids are transported to the tissue for oxidation without leaving a trail for lipoprotein in the form of low density lipoprotein. Conclusion is here, standard lifestyle recommendation like portion control diet with regular exercise, and want to mention here more intense interventions diet supervisions program along with Medohar and Lekhaniya drugs may effective at improving blood lipids, other risk factors and quality of life. References are here. Dr. Snehal Kolekar, review Medohar and Lekhaniya Gun in obesity. Harshit Kumari and BA Pooja and Lenulon. Acknowledgement. Thank you, Honorable Dr. Rohit Sanessa, Dr. Gurudatta sir, Dr. Praveen sir, and Rahul sir, and Nilesh sir, and my team. And here I mentioned all day first and day 90 parameters. Is it visible, sir?
No, the backup slide is not visible.
No, you need to click on the Excel. It's an Excel which has been inserted. No?
Yes, sir.
Old patient of age.
Okay, no worries. We have some questions. That was a fantastic presentation, Dr. Smita, but we have some questions for you. Can
Yes, sir.
old patients of age near about 70, 73 years perform the exercises shown in your slide, or they need some assistance or some medicines were given for such conditions? This is a
No,
question
sir.
that has been asked.
Everyone can do TheraBand exercise basically, and like diet control, we here mention supervision. Diet control is a key factor, and TheraBand exercise, strength bearing exercise is all. Yeah.
Okay, fine. So any medication was added?
Medication like Basti Dravya Lekhaniya and Lekhaniya Dravya Bastis are given. Medor and Lekhaniya Dravya.
Fine, fine, fine. Do we have the lipid profile reports pre and post of
Yes,
this
sir.
patient?
In Excel, there are all parameters like abdominal girth, first day, systolic and diastolic blood pressure, heart rate, everything is mentioned.
Fine, ma'am.
And all 35 patients.
Yes. Rahul sir, your views on this, please.
Dr. Smita has taken this management of dyslipidemia with the Ayurvedic product to next step. And normally in the world of cardiology, the dyslipidemia is one of the major risk factor for a coronary artery disease or the ischemic heart disease. And I'm happy to see how the Ayurveda doctors, they have taken the command and they can manage the condition like dyslipidemia with a very effective and very safe way. And you have collected the data of around 35 cases. It's a very commendable job, Dr. Smita. Hats off to you and your team. And keep the same work going in the future. So all the best to you again.
Thank you, sir.
Thank you, Dr. Smita, for your fantastic presentation. Now we move on to the next presenter, Dr. Karishma Lad, and her topic of presentation is chronic heart failure. Dr. Karishma. Yes.
Is it visible?
Yes, it is, but you need to click on the enable editing option. And you need to put this presentation on slideshow. Yes, ma'am. Just put it on the presentation mode.
Okay, sir.
Perfect.
Okay.
You have 8 minutes of time.
Okay. Good evening. Good evening to all guests, mentors, and my colleagues. Myself, Dr. Karishma from Naupada, Thane. I'm working since last 7 years. And let me correct my topic. My topic is to study the role of ischemia reversible therapy along with oral medicine and lifestyle modification in ischemic heart disease. So my case study, male, 35 years, occupation was service, and came with the history of chest pain and with 2D echo report. And chief complaint was chest pain, upper back pain, and past history was COX on 2015, and he was taken AKT for 3 months. And MI in November 2020. And allopathy medicine, he was taking Nicorin 5, BD, Monotrate 10 TDS, Clopidogrel 75 OD, and Atolip 30 HS. And before treatment, his vital was as given. And I have taken stress test on 20th/11/2020. Timing was 7:48. And termination criteria was chest pain and DOE. And VO2 max came 14.38 and MET value was 4.1. And angina was scored 2. Thus, due score came 13.9. And EC 2D echo report shows regional motion wall abnormality with LVF 30% and diastolic dysfunction grade 1. Then diagnosis IHD, ischemic heart disease. And ischemic heart disease impact on body response. Like ideally 225 ml of blood every minute is required for normal functioning of a heart. If heart doesn't receive required amount of blood during exercise, heart muscle can get damaged due to lack of blood supply and not function properly, and clinical it is termed as ISD. ISD can increase your chances of getting heart attack and developing future heart failure like CHF. Thus, we diagnose him as ISD with developing CHF. And we have given our treatment like a diet. We have given him reverse diet box, which is high ORAC value, high antioxidant, low carb, low fat, and high in fiber. And exercise was advised him with daily early morning walk before breakfast for 30 minutes, pranayam for 15 to 20 minutes as Brahmari, Anulom Vilom, and Madhavbaug exercise kit, which contains spirometer, TheraBand, balloon, and smiley ball. And medicines was given to him was Arjun Kada, which contained Arjun, Pranayama, and Vatsa, GHA tablet, Gokshur, Haridra, Haridra and Amalki, and cat pea powder, which contained Dalchini, Amalki, Patha, and Bibita. And Panchakarma was advised him for centripetal oleation with Abhyanga oil 100 ml for 20 to 25 minutes, thermal vasodilation with Dashmul Kada 15 ml for 10 minutes, and PRDA with GHA Kada, which contained 100 ml of 100 ml. And Panchakarma was taken for 14 therapies twice a week. And here are the reports which shows the result that LVEF increased from 30. 30 was taken on first day, which was on 8/11/20, and then repeated in January 8/21, which came to 45% with normal changes first it was showing hypokinetic at apical septum and anterior wall, which get with this therapy we get result like it has shown only a normal motion abnormality, and afterwards we have taken in next month, which shows all report normal with 65% of LVEF, no regional motion wall abnormality, and with no symptom. And after treatment, stress test was taken again on 27/1/21, and time was 15 minutes with VO2 max 32.9, and termination was complete with no angina, and due score came to 9.4, and 2D echo as I have shown. And discussion on medicine, like action we have taken on medicine. First, Arjuna is an excellent 1 minute. Arjuna is an excellent cardiotonic by restoring the depleted endogenous myocardial antioxidant and myocardial function, lowers the cholesterol and improves blood circulation to heart. Dalchini, Punarava, Vatsa combinedly improves the functional capacity of heart by reducing the cardiac load and acting as a diuretic, analgesic, and vasodilatant. Gokshur, Amalki, and Haridra breaks the pathophysiology of ISD, like it improves the digestion. We call it as Agni, so there is a proper formation and maintenance of blood and its content, like Rasa Dhatu. Thus, no longer vitiated dosha can contaminate Rasa Dhatu and affect the heart to cause ischemic heart disease, as Hruday is a mool sthan of Rasa Dhatu. It reduces inflammation of endothelial, improves dilating capacity of heart vessels, protects from oxidative damage, and promotes healthy healing. It also reduces edema and congestion. And Panchakarma, as I have told earlier, centripetal oleation improves volume of blood to the heart and reduces the peripheral resistance. Thermal vasodilation reduces breathlessness on exertion by improving its blood supply to chest muscle. And PRDA with GHA CADA improves the health of blood vessel, reduces oxidative stress, and increases the blood supply. And diet with reverse diet kit, high ORAC, it helps in lowering the lipid level and anti-anginal effect and increase the blood flow. Exercises, early morning walk 30 minutes, and exercise helps to reduce the excessive fat in body and improves the blood circulation. And medicine, we continue to date allopathy, no medicine, and Ayurvedic medicine, ARJ 500 mg OD and GHA 1 tablet BD. And here conclusion is IRP therapy along with oral medicine and lifestyle modification is effective in ischemic heart disease. Thank you.
Super presentation, Dr. Karishma. Thanks a lot. Rahul sir, over to you.
Very confident word is reflecting from the confidence that she has given to her patient, and hats off to you, Dr. Karishma.
Thank you, sir.
Exceptional job has done. So all the best for the future. Thank you.
Thank you, sir. And my regards and acknowledgement to all mentors and especially Dr. Rohit, sir.
Yes.
Thank you.
Fantastic. So now we move on to our last three presenters. We now move on to Dr. Vidyanvadkar ma'am, and she'll be presenting on the topic of positive impact of telemedicine in managing NCDs and disease relapse at patient's home. Dr. Vaibhavi ma'am, welcome. You have 8 minutes.
Am I
Yes,
audible?
Perfectly audible, ma'am.
Good evening, everyone. Good evening, all the doctors, all the presenters, and all the attendees. Thank you so much giving the opportunity for the telemedicine department as well. I am sharing my screen for my presentation. Is it visible, Dr. Omkar?
Yes, ma'am.
Yes, thank you so much. Myself, Dr. Vaibhavi Mahesh Vakchaure. I am the SGM for Madhavbaug Wellness Department. Topic for today's presentation is positive impact of telemedicine in managing NCDs, that is non-communicable diseases, and disease relapse at patient's home itself. Before I move on to the actual presentation, would like you to understand about the telemedicine or the online clinic of Madhavbaug. So telemedicine is a new venture started recently by Madhavbaug, wherein the delivery of healthcare services to patients' home and the exchange of healthcare information like patients' reports, their medicines, their guidelines for the diet and exercise, everything is managed across the distance for the patient. There are two modes how the teleconsultant consults the patient. One is a audio consultation and second is a video consultation wherever possible for the patients. So all the patients' reports are gathered before the consultation of the doctors, either on WhatsApp or an email. And then after compiling the case, the consultation happens with the respective doctors. All the case papers of all such patients are maintained in our CMS, and even the weekly monitoring of all the patients are done in the CMS itself. Just to give you a brief idea why patient prefers telemedicine. So basically, old patients, wherein it is not possible to visit to clinics or see the doctor in person, patient prefers the telemedicine as a platform for taking care of his illness. Because of geographical barriers, if the patient is not able to visit to the doctor, he opts for consulting the doctor on the online platform. And even in the remote parts of the India as well, the patients prefer nowadays telemedicine. And patient expectations are limited to his illness or controlling, managing the symptoms are the needs for the telemedicine. So in this study, the objective is to study the impact of online or home-based disease treatment therapy in managing NCDs at home and improve the quality of the patients. We all are doctors, we are aware that the non-communicable disease prevalence in India, as you can see in this image, almost 70% of the disease population fall into the NCDs categories, majorly highlighting the CVDs, then cancers, respiratory illnesses, respiratory diseases are on priority as well, and other associated NCDs. So it becomes our moral responsibility as a preventive cardiologist to help all these NCDs and the related risk factors too. You can see the impact in 1990, if we see, the NCD percentage was around 38%, and the recent data by WHO in 2016, it has reached around 62%. So all my doctor friends, it is our responsibility wherever the patient in the remote area, we need to help the patient. In this study, I am plotting the data of 83 patients as a pilot study into the telemedicine department, out of which around 51 patients fall into diabetic category, and rest, as you can see, hypertensive, obesity, CAD, dyslipidemia, hypothyroidism, and others NCDs. Majorly, the patient expectation here is to control his disease, is to manage his symptoms, is to get rid of the long number of medicines what patient is taking. If I talk about the geographical location of these patients, so around 40 patients from this are located in the remote part of the India. Around 30 patients of these 83 patients are coming from the metro cities of India. And there are 13 international patients who have taken telemedicine treatment recently since last 5 to 6 months. So the expected outcomes when we wanted to plot the study, they are in front of your screen. First is improvement in the overall health parameters of the patients. Reduce the dependency on n number of allopathy medicines, because as we all know, allopathy medicines or any medicine some or the other way shows some or the other impact on your body, which is labeled as the side effect of that medicine. Maintain health on the minimum medicines and maintain maximum compliance for the recommended diet and exercise, and overall improve the quality of the life of all the patients. So here plotting the intervention what we have used. Now, we have classically used all disease-specific medicines for each and every case, like in diabetes, in HTN, even in associated related NCDs, oral medications, diet kit. Around 15% of the patients in the diabetic category were given the diet kit for the duration of only 30 days. I mean to highlight here only one diet kit. Exercise protocol as in monitored through the Pulse app, and also highlighting the diet. The customized diet charts were also given in around 80% of the patients. And very importantly, because we all know the root causes for NCDs are our sedentary lifestyle, the poor dietary habits, depression, addictions. So motivation is the education. This is the principle that all the teleconsultants use here, that they educate the patient and they motivate all the patients to create that impact on their health. So the treatment duration, as I've highlighted, in 80% of the cases, it is only 30 days, and 20% of the cases, it is 90 days. Treatment motive is a daily ritual of life. This is a main important word I would like to highlight here. Simple lifestyle modification. If they are overburdened, patient doesn't follow them, he gets bored of following it. So we made a habit that they become a part of the daily rituals of their life, and discipline and consistency. So how do we maintain this? The doctors in the telemedicine get in touch with all their patients on weekly basis. There is a compliance executive who gets in touch with the patients on a weekly basis, and entirely data is monitored. In the today's presentation, just highlighting the 51 diabetic patients because of shortage of time. So in this 51 patients, only one Prameha diet kit was given for the duration of 1 month, of course. Average HbA1c when we had started the treatment on the day when it is 9.33, and post 30 days average HbA1c in all these 51 patients is 7.84. So I'm glad, my friends, to show you this improvement. That improvement in HbA1c averagely over a period of 30 days is 1.49 milligram percentage. Associatedly, along with the main diabetic category, we have monitored the other improvements as well. Average weight loss of the patient. So here, both the interventions, the diet kit in diabetic patients and the diet charts in other NCDs, around 3.32 kgs weight loss in a period of 30 days. Medicine tapered almost in all the diabetic cases, and other cases, 52% cases medicines been tapered. Quality of the life improved. Here we have that questionnaire typically wherein the compliance team asks the patient about the improvement in their overall system. So 80% of cases, a symptomatic improvement have happened. Around 40% in cases, we have seen the simplest symptoms like migraine or headache in case of a HTN, simple sleeplessness in otherwise NCDs. So all these symptoms were tapered off. So non-relapse of these symptoms is observed over a period of next 30 to 60 days in all the patients. So conclusion, my friends, here that as this department aims that no patient should be deprived of the necessary treatment due to geographical barriers. So here I conclude that this pilot study proves that self-motivated proper disease care provided by the telemedicine physicians helps in managing NCDs and stop disease relapse at patient's home itself. So the key takeaway for all the patients is consistency in the self-motivated proper disease care. And that's how, even if the patient is sitting at any part of the world, if the consistency and regularity is there, it is very much easy to control and manage NCDs at home itself. So these are the references taken from the international and even the Indian journals. And I here thank all the senior mentor team, all the teleconsultants actually who are creating this positive impact into the lives of the patients, not seeing the patients physically, and even though connecting and helping the patients to manage their NCDs and prevent the relapse of the cases at their home itself. Thank you so much for giving the opportunity. Thank you.
Thank you, Dr. Vaibhavi. Rahul sir, your comments on this, please.
Actually, it's really a pleasure, or it's a, I will call it a feast, given Dr. Vaibhavi ma'am is there and she is talking on some point. She is always giving some very good point to learn and very new aspect of learning that you have shared, Dr. Vaibhavi ma'am. And reducing the HbA1c by 1.49 in a 51 cases of a type 2 diabetic patient without meeting them in person. And so it's a very fantastic job that, and within just 30 days, as we know, HbA1c, if you reduce the HbA1c, it's a 30 days of, it's 90 days of average sugar. If we can reduce the HbA1c by 1%, the 16% of our risk of heart attack can be prevented. So you are not meeting or visiting anyone in a person, and still you can reverse their 51 patient HbA1c you have reduced by 1.49. So you have prevented so many people, type 2 diabetic people, from landing up into the disease like a heart attack, and also a commendable job that you and your team is doing. And it is really difficult to every day go and call your patient and ask them for their betterment and getting compliance from them. And even if you see this through the perspective of Ayurveda, Ayurveda has very beautifully mentioned. So there are three types of a treatment: Hetu Viparit Chikitsa, Vyadhi Viparit Chikitsa, and Dosha Viparit Chikitsa. So here you people are doing a very good diet that you have given. It's actually a Hetu Viparit Chikitsa. And you don't need to meet person to make a change in his life. Very rightly said. And when you ask your patient for the change in the diet and you advise them for a good, you get a good compliance from them. So it's really, it brings a goosebump on for me also. So superb and excellent work, Dr. Vaibhavi ma'am, and keep it up.
Thank you.
Yes, Dr. Vaibhavi, we have a question. How do you overcome the need to know TPR, BP, or to auscult palpate your patient during telephonic consultations while discussing his or her symptoms? Example, patient may complain of ghabrahat, chakkar, dhad. So your view on this, ma'am?
Yes. We face some of these drawbacks while we are doing teleconsultation. But you know what? All the patients who were taken for the disease management, specifically talking about high blood pressure or diabetic patients involved in the study, we made sure at the beginning of the study itself that the basic devices are there at patient's home. So monitoring, even while reducing the dosage of insulin, the monitoring, like we have a classical protocol of monitoring, sugar to be monitored every day, BP to be monitored every day in the morning. That was well maintained, and the complete home education was provided to the patient. The drawback was whenever auscultation or pulse checking, nadi parikshan, these were the drawbacks. So for which we are creating one system wherein I hope very soon we would be able to overcome these drawbacks. And some of the cases wherever we found the need to connect with their physicians. So the teleconsultant gets in touch with the physician and helps the patient through the other physician. So all in all is creating a positive society of the doctors. So wherever the patient is, helping the patient on any of the treatment is the key motive for all this therapy.
Thank you for this elaborative answer. And now we move on to our last two presenters. So the second last presenter for today is Dr. Mamta Naidu, and her presentation topic is effect of 1 month diet and exercise online therapy in a young diabetic patient, a case study. Yes, Dr. Mamta.
It is continuation with Dr. Vaibhavi Madam's presentation.
Yes, Dr. Mamta, you need to keep your video on for me to spotlight you.
Before we finishing these two sessions, I would like to share one few things here, Dr. Omkar, if you allow me. All the delegates, they have shown a great efforts and they have shown a great temperament, because since 1 p.m. we all are together and we are sharing so much of information. We are discussing so many of aspects. We have connected with more than 20 presenters, 3 chief guests we have learned. And it was a really wonderful, energetic session all the way. And we all maintain, and we are sitting here right now in front of this laptop or your mobile, and we are discussing till. So this is something very good I have seen today. And tomorrow we are going to discuss the more cases with the doctors from the Western Mumbai and the doctors who are practicing in a Vidarbha region. So geographically, 2 different areas we are going to explore tomorrow. So I'll request all the delegates to join tomorrow's session on time, so that we will discuss more and more cases, because in this session, in this symposium, we are going to discuss around 90 various cases. And this today, as you shown your temperament for today, so please show you give us this your love and support for tomorrow's session also.
Thank you, Rahul sir. We now move on to Dr. Mamta Naidu. Dr. Mamta, welcome. Good evening. Yes, you need to unmute, ma'am.
Yes. Now am I audible?
Perfectly audible, ma'am.
Yes.
You have 8 minutes of your presentation time.
Yes, sir. Good evening, respected doctors. Myself, Dr. Mamta, online consultant, and I've been working with Madhavbaug since past 2.5 months. And today I'm here to discuss about a case of a diabetic patient and his control in sugar level with the effect of 1 month diet and exercise through online consultation. So these are the contents and which I'll be discussing further. And so the objective of the this case was to observe the effect of diet and 1 month diet and exercise through online consultation in a diabetic patient. So these are the patient details. A patient, a 42-year-old male, he was suffering from diabetes since past 5 months, and he came for the consultation on 14th of March 2022. So as I mentioned before that he was suffering from diabetes, I mean he was diagnosed with diabetes in past since 5 months only, so he did not had any major complaints. But past 1 month he has suddenly developed excessive thirst and hunger and generalized weakness. So since the time of diagnosis, he has been taking medications, that is Glycifish 250 twice daily. And during the consultation, we have assessed few parameters, and the patient did not have any addiction. His sleep pattern was sound, and his urine output was 4 to 5 times a day and 1 to 2 times at night. And if you have seen the first slide, the patient works under an IT firm, so his work schedule was quite hectic, and he relies more on outside food. And his exercise routine, he was not regular in exercises. He sometimes, when time permits, he used to go for jogging for an hour daily. I mean, not daily, I mean, it was not regular. And his height was 161.5 centimeter and weight was 78 kgs, and his BMI 29.9, which is the border of overweight and obese class 1. And abdominal girth was 93.98. So during the time of consultation, patient had this investigation already done. It was a fresh report. And if you see the reports, his FBS and PP was quite on the higher side. And his HbA1c also was 7%. And lipid profile also, total cholesterol, triglyceride and LDL, everything was on the higher side. And HDL was very low. And after seeing all the parameters, I have diagnosed as the diabetes mellitus type 2. And based on all the parameters, our interventions was first, as the patient was not under major dose of allopathic medicine, so we have prescribed oral medications, Ayurvedic medications as well. Along with Prameha diet kit, we have given which includes which has a high fiber, low calorie, low carbohydrate, high protein, high fat, and it is rich in micronutrients. And we have advised patient to go for a regular exercise, walking and jogging, which needs to be followed regularly, was advised to the patient. So the main goal for prescribing the diet was, first was the main weight reduction. So as you have seen, his BMI was quite higher. So our main motto was to bring back his weight to the optimal level. And the second was to control his sugar level. And third, to withdraw his medicines, his allopathic ongoing medicines. And the fourth goal was to prevent his further diabetes related complications. So these were the main goal for prescribing the diet. And the oral medication which was prescribed to him was Glyinoma capsule, 1 capsule BD, Lipox tablet, 1 tablet BD after food, and Amari oil 10 ml early morning, which was taken weekly twice or thrice. And after this treatment intervention, we have found some changes in weight and BMI in the span of 30 days. And if you see, the patient has started with the diet and medications from 25th of March 2022. And we have assessed his parameter exactly after 30 days, which is on 23rd of April. And you can see some significant changes in the weight and BMI. So weight, patient was around 78 kgs before treatment. It was reduced to 72 kgs within the span of 30 days. And BMI also 29.9, which was reduced to 27.6. And abdominal girth also, if you see, it was 93.98, which was reduced to 90.17 within a span of 30 days. And there was some observation noticed in the investigations also at the span of 30 days. And if you see, fasting and PP got under control, and his HbA1c, if you see, it got a very good change. I mean, the patient landed from 7% directly to 5.5, that is extremely to the normal level. And if you see the lipid profile, total cholesterol and triglycerides seen some very good change, and the HDL also was improved. So discussion, as we know, due to the fast growing lifestyle, currently this generation people are more towards the fast food, junk food. They rely on outside food, and due to their work pressure, they are not able to maintain their lifestyle. So because of that, currently the people, this generation and the patients, like people from this generation, they are following in the trap of diabetes very rapidly. So the prevalence, which was 40.9 million few years back, at currently it is around 72.9 million patients are diabetic. And if you see the percent, 11.2% are only from urban areas. So we can understand, because of this ongoing fast growing lifestyle and because of this heavy work schedule, people are not able to maintain their lifestyle. And moreover, mainly the people are from the urban areas. So here, if I have mentioned before, I mean, the patient during this whole course of treatment, I have not met the patient physically. Everything was done throughout the online platform. So in this, main role comes for the online treatment was patient was followed up weekly. So every week we used to follow him about asking about his any added symptoms, if he had noticed, if he had developed any new symptoms, or if he had seen any improvement, that was followed up every week. And then we advised him to download the MIB Pulse app. So we used to monitor that app on daily basis, and we used to monitor his vitals and his daily exercise routine. Everything we used to monitor through the Power Map monitoring. And then patient was, we were continuously in touch with the patient. We were boosting his confidence that if you follow this protocol completely, you will get rid of all the ongoing medications, and you will be free from the symptoms. And the level of trust and patient, due to the continuous communication and throughout the follow-up, patient developed the trust, and he also was reciprocating in the same way as the consultant. And
last 2 minutes, please.
Yes, and the last one was to educating the patient, and we were throughout educating the patient that if he deviates from his routine, there is a possibility of relapse. So he was advised to be on the protocol what we advise in his daily routine. So the conclusion is, based on all the parameters observed, 100% compliance on diet and exercise can control the diabetes in patients if treatment started in early stage. It will also help patient not to rely on medicines and maintain his sugar level by diet and exercises at his own place itself. It will also prevent from other diabetes related complications as well. And if the diabetes is diagnosed in the early stage without any extreme panchakarma interventions also, patient can maintain his diabetes just based on his diet and exercises. And currently patient is under second month follow-up, and his medicines completely tapered. It is completely stopped, and patients is following this basic routine and basic diet at home itself. So these are the references. Thank you.
Thank you so much, Dr. Mamta. Rahul sir, your views on this, please.
Yes, I think I already put my views on, and this is a very superb work that Dr. Vaibhavi ma'am and her team, Dr. Mamta, excellent presentation. I like your confidence on your voice, and when you were given the presentation, that was showing how much your patient is getting betterment in his health. So hats off to you, and keep the good work. Continue.
Thank you.
Yes, Rahul sir, we have a couple of questions from some of the doctors for Dr. Mamta. I think Rahul sir, you can answer these questions.
Yes, the question, how can we repeat the HbA1c within a 30 days? So HbA1c is something.
Yes, the HbA1c should be done. It is the average sugar which is to be done in the 3 months. But the difference what it has been shown in 1 month, that I have shown here, it is impossible to show some differences within 1 month. If a patient is taking diet, the HbA1c should not improve to that level within 1 month. But it has shown, that was the reason I have portrayed that thing here. So it is quite a significant change what I have noticed.
Great.
Yes, Rahul sir, you can elaborate this question again. This answer again.
Right. See why we do HbA1c after 90 days, because normally RBCs get matured in the 90 days, and this is the reason 90 days is the average span, but it's not like a rule you have to do it after 90 days only, because even after 30 days you will get at least some change. And to know the betterment, whether whatever the intervention you are doing, so uska short term goal agar achieve ho raha hai nahi ho raha hai, to understand that, you may ask patient to see whether the last 30 days is there any change in the A1C. So absolutely right method to see the prognosis in the type 2 diabetic patient. Continue with Dr. Mamta, and all the best.
Yeah, in Madhavbaug, we do have a culture of checking HbA1c every month. Right. And last question to you, Dr. Mamta, do you offer something like menu to your patients?
No, sir. Actually, what do's and don'ts, what it has been described under our diet kit protocol, that we have explained to the patient, that you have to avoid some milk and milk products, and you need to avoid certain food which has a lot of sugar content or high in glycemic index, that we ask patient to avoid. Other than that, what is mentioned and what is present in the diet kit, that we ask the patient to follow it.
Perfect. Perfect. Thanks a lot. So now we come to the last presentation of today. I'll request Dr. Smita Patil to present a topic of impact of online treatment to stop the heavy dosage of insulin in chronic diabetes case. Dr. Smita Patil?
Not Sunita Patil.
Yes, Dr. Smita Patil.
Sunita Patil, no?
Okay. Fine. Dr. Smita Patil from the telemedicine team.
Okay.
Yes, ma'am. You have joined from Dr. Vaibhavi's access.
I think a doctor from New Panvel, Dr. Sunita Patil is also there, no?
Yes.
Even she is supposed to give her presentation.
Okay, fine. So
okay, let's complete this. Dr. Smita, you have 8 minutes. You can start your presentation.
Yes, sir. You can hear me, sir?
Yes.
Okay.
You need to be a bit loud, ma'am.
Yeah.
Good evening all. Myself Dr. Smita Patil from Madhavbaug online consultant team, and my case will be on insulin dependent diabetes patient. Impact of online treatment to stop the heavy dosage of insulin in a chronic diabetes case. Objective to help taper down long-standing high insulin dosage in a chronic diabetic patient. And these are the contents of my case. So nearly approximately 31% of diabetic patients are treated with insulin. Specifically, 15.4% use insulin only and 13.6% use insulin plus oral medications. So we all know that insulin has its long-term disadvantage also. So it raises the risk of hypoglycemia in some patients. It also can promote weight gain, and some people may be uncomfortable for taking daily injections and can create skin damage as well. So my patient, he is of 72-year-old, and he is a known case of diabetes since 25 years. He was dependent on insulin since last 10 years. He had a history of Bell's palsy and 3 attacks, was on allopathic medicine since last 27 years. And when I consulted him online, as the patient was 72-year-old, and he was fed up with all his treatment since long. So he was looking for betterment for his diabetes related queries. So he consulted me online, and I convinced him that diet plus Ayurvedic medicines and exercise that will surely give him get rid of his insulin doses. So he when I consulted him, that time he had a grade 2 of dyspnea, and that time his weight was 63. Initially I advised him his fasting sugar levels, post lunch sugar levels, and average sugar as well. Then he checked with all his investigations. That time his HbA1c was 8.8 mg percentage, and he was on oral hypoglycemic agents, 3 oral hypoglycemic agent. He was taking insulin morning 22 unit in the morning, and evening also he was taking 20 unit. So my diagnosis was Bell's palsy, MI, insulin dependent diabetes. So during my treatment, during the first week itself, when I started with the treatment, I gave him Pramay diet kit, Ayurvedic medicines. Pramay diet kit that includes basically low glycemic, low calorie food, which helps to get fasting and HbA1c levels improved. So I preferred diet kit, then Ayurvedic medicines I used, and exercise. The patient, he was since long he was having diabetes, so he was himself doing walking, few yogasana also he was doing, and he was totally aware of that he needs to follow his diet and few medicines which I will give him for his betterment. So he did cooperated very well. So, and additionally, I connected with his family as well for diet, and build a good communication with patient, with his wife and his son as well. So because it's an online treatment, so basically what kind of diet he is following, that I need to check closely, plus whatever he is doing, and the weekly follow-up was there for his treatment from my part. Then during the treatment, during first week of treatment only, gradually first week he developed little hypoglycemia. So that time I tapered his insulin dosage, and gradually tapered his insulin dosage on the 40th day of our treatment. 60% insulin doses I tapered, because the patient was really following everything, whatever I guided him. So he got good result. And on 74th of day, I completely stopped his insulin. So he completely get rid of his insulin as well. Presently, he is completely off the allopathy medicines, and the parameter difference these are also there. Before treatment, his weight was 63 kgs, and after treatment, with the help of diet, Ayurvedic medicine, and exercise, he lost some kilos as well. And his BMI improved to, which was borderline 24.9, as his height was 5'4" something, and BMI improved to 21.8.
his sugar levels, when he enrolled, that time his sugar levels was 188 fasting, and post lunch after treatment his sugar levels, fasting sugar levels were 101, and 8.8 average sugar improved to 6.5 during the treatment. So my conclusion is, with the help of correct diet pattern, Ayurvedic medicines, which are good to control the sugar levels, exercise and simple communication, I could stop the heavy dosage of insulin in 10th week of my treatment in a 72-year-old patient. So which was really very helping the patient as well. And the patient is very, very satisfied. So thank you. This was my case. And first time I was giving a presentation like this.
But it didn't seem so, ma'am. It was just superb presentation.
Okay, sir. Thank you so much.
Yes, Rahul sir, over to you.
Very nice presentation, and managing insulin dependency of a patient with just a telemedicine or consulting is a very difficult job, and you did it very nicely and very well. So all the best for the next your future practice.
Yes,
and
thank you so much.
I think there are a few questions for you as well. कि क्या diabetic patient को mango देना चाहिए या नहीं?
We need to avoid it, because this also I saw during the course of treatment. Whenever a patient take mango in between, that time his fasting sugar, otherwise post-lunch sugar, it goes up. So we need to avoid it. And everyone knows that mango has a high glycemic index too. So we need to avoid it.
Right. But once I think if I am completing your treatment of type 2 diabetic, and so can I take a little bit of mango, or I can test?
Sometimes if sugar levels are continuously at a very good level, so sometimes you can take.
Because ये तो साल में एक ही बार खाने जैसा fruit है, so can.
Yeah. 2 slices you can take if you are insulin dependent or got rid of with the treatment.
Okay, that means once you correct your glucose metabolism, and you can enjoy your mango, but unless and until your sugar metabolism is not correct.
We need to keep close watch on everything.
So पहले अपना डायबिटीज रेमिशन के लिए प्रयास कीजिए, डाइट कंट्रोल कीजिए, और नेक्स्ट सीजन के मैंगो के लिए रेडी हो जाइए. So this message we can give to our diabetic patient, right? Thank you, ma'am. Over to Dr. Omkar, sir.
Yes, thank you so much, Dr. Smita Patil. Now we move on to our last presentation of today. Dr. Sunita Patil from New Panvel Clinic. Dr. Sunita. Yes, Dr. Sunita. Please unmute. Yes, Dr. Sunita. Your voice is not audible, ma'am.
No, you are still not audible, ma'am. What's exercise advice? Dr. Sunita, ma'am. Please check with your sound setting. I think your mic setting especially. Yes, Dr. Swati, the what exercise to be advised to patient, jab tak Dr. Sunita is trying to connect, I'll briefly share what information I have. See if right on high insulin. Yes, if your patient is obese and he is taking insulin, so in that case, the exercise that he should do it should be a cardio exercise, that the patient should run, or he should swim, or he should play some outdoor sports kind of activity he should do. So if your patient muscle mass is good, if your patient fats are more, but if at all the patient is lean, thin, and what we call a sarcopenic type of insulin dependent patient, in that case, don't ask patient for too many of cardio exercise, otherwise he will end up into more problem. In such condition, we normally suggest in Madhavbaug, we normally suggest patient to go for a resistance training or exercises which will improve the muscle mass. So like TheraBand or the strength training or a weight training kind of exercise, if you are advising to the patient and if you are providing them a good protein diet, so that will help your patient to increase the muscle mass. And if there are good muscles, the sugar will go into the muscles. If there are no muscles, the sugar will go into the blood. So like that, yes, even at the age of 74, patient can do the strength training, resistance training. And that is the best way to help the patient out from the insulin. Yes. So, Dr. Sunita Patil, ma'am, is it possible for you to join? My pleasure, Dr. Swati.
Otherwise, Rahul sir, we can consider Dr. Sunita tomorrow.
Yes, I think because almost 6 p.m. now. And if it is not possible, then we can join tomorrow. Before leaving anyone, I'll tell you whatever the discussion we have done today in this session, all the discussions are available on Medemy. This session, this symposium is powered by medemy.in, and you can get all the this video on this website medemy.in. You have to just log in with this with your credentials, and you can easily access all the videos at any time. Yeah. Dr. Omkar, can you please help everyone with this?
Yes, there's a logo in the left bottom, MEDEMY. That's Medemy. Medemy.in. And today's presentations were live on YouTube as well as Facebook Live. So those who have joined a little bit late, you can see those presentations on YouTube and Facebook as well.
No, it's a wrong spelling.
It's MY, MEDEMY. Okay, so I think Dr. Sunita, we can consider you tomorrow in tomorrow's presenters list, and we should call this a day today. Dr. Rahul?
Yes.
So tomorrow we are going to start exactly at 1 o'clock, and tomorrow too we have around 20 to 25 presenters of Madhavbaug who will be presenting their case studies in front of all of you. I request all the doctors who have joined apart from Madhavbaug in today's sessions to please share the same link to all your friends and colleagues who are interested of learning new sciences with Madhavbaug, so that they can also encash this opportunity, this golden opportunity to know how scientifically Madhavbaug doctors work. And Dr. Rahul will be there with us tomorrow. Dr. Praveen sir will be there with us tomorrow, along with all our Madhavbaug doctors. Dr. Sunita, we will be taking
one surprise session for everyone tomorrow. One of the chief member and the most dignified Dr. Gurdatta Amin will be there tomorrow to start the session, and he will be addressing all of us how we should start our own Ayurvedic clinical cardiology practice, and what skills and what knowledge we need required to establish our own clinical cardiology practice. So I request everyone to be a part of this session tomorrow. And over to Dr. Omkar sir.
Yes, and I am really grateful to all our three chief guests, Dr. Madhuri Kanitkar ma'am, Dr. Rohit Sanessa sir, and Dr. Jagdish Hiremat sir for their valuable time and guidance today earlier in the symposium, and to both our chairpersons, Dr. Rahul Mandole sir, Dr. Praveen Ghadigaonkar sir, for your valuable guidance throughout. Tomorrow again we are going to meet at 1 o'clock, so requesting all to please stay tuned. Tomorrow 1 o'clock we'll be meeting you again with new case studies. So this is going to carry on for the next 3 days. Thank you all for being part of this fantastic cardiac symposium throughout. Now it's near about 5 hours that we are together, and that requires a lot of courage and a lot of sincerity to be part for last 5 years and 5 hours. Sorry. So thank you. We'll be meeting tomorrow again at 1 p.m. See you all tomorrow. Bye bye. Take care. Bye bye.